seniors who require them.
My name is Hamza, 69 years old. At the moment, I'm at the rehab center in DK because I'm one of the stroke victims. I at the moment doing therapy. Actually, I don't know about this place. That time my wife admitted to this place. She got Parkinson because she cannot talk properly. And my daughter was with me coming here. So after some time, I told my daughter, okay, I think I can give a try coming here. Last year, July, until now, I got a very good therapist here with me. When I come here first, I can't even walk properly. I have to use the wheelchair. Until now, I can walk properly. I'm getting the momentum again. So I really thank her very much. The people here, they are very, very friendly and very experienced. They know what they're doing. They know what they want to give you. I really enjoy it.
We recognize that many family members are thrusted into the role of a caregiver unexpectedly. Our caregiver training and support program aims to equip them with skills and techniques to better care for their loved ones and for them to understand the resources available in the community. Our desire is to empower our patients to live with joy despite the circumstances and challenges that they may face. We want to be here for our patients and clients who need us today and for those who will need us tomorrow. We will become a hub for home healthcare services, a go-to pillar of support for caregivers and patients to assess the comprehensive services that we provide. We hope that you will join us as our community of supporters, donors, volunteers and partners to help our patients and caregivers walk this journey with joy.
Hi, I'm Lawrence Low.
My name is Wei Ping.
I'm Wendy Lee.
Hi, I'm Asher Ang. I'm 17 years old this year, and I'm a volunteer at Wellness at Hougang.
I've been doing volunteer since almost 10 years.
I'm 56 years old. I've been doing volunteer job for a few years.
With HNF Foundation, I started volunteering about 6 years ago. I've always been volunteering since school days when they organize volunteering activities, and I just maintained it throughout my life.
Usually we will accompany the senior, have activity with them and home visit them. It actually motivates me to be more strong and more active so that I can have more years to assist them. I feel happy when I'm with them, when I see they smile or I see they have more energy to interact with me, and that makes me feel that it's a great job that we can make senior more active and more happy.
So I've been volunteering for about a year now. So that was during my school holidays, and we came down for about 1 to 2 weeks. And we continued doing that every school holiday, whenever we can and when COVID restrictions allow. Some of the best life stories I hear are from the seniors here. And I think that it's very good for us to come down and have this intergenerational bonding. And I think that my friends also have feedback to me that they learn about how to socialize better with their own grandparents through coming here to volunteer.
So far, I find that I'm working very well with those seniors, especially at my age group. I find that I'm able to communicate well with them. I will collect the hamper from the home nursing. I will distribute to individual patient. While distributing, normally I will say hello to the patient, consult our patient and asking them, how are you? I think after they receiving the hamper, majority of patients are very happy and they will keep on thanks you.
Many of the recipients I visit, they are going through difficult situations in life, but they put on a smile. You see the love in their family, you see the hard work, the dedication, and it is very inspiring.
To me, volunteering is giving your time and effort where you can to help improve other people's lives.
I believe good quality volunteers, you must have the patience and the heart to share and to contribute.
最要有的就是慈悲心，因为你有慈悲心的人，你就愿意去付出，no complaint.
Good morning, ladies and gentlemen. It is our pleasure to welcome you to make your way into the hall and kindly take your seats as we are going to commence with the conference in a short while. Thank you.
and most established home healthcare providers in Singapore. While we started out solely providing home healthcare services, we now have started 2 daycare centres in Hougang and Buangkok to help look after seniors in the daytime when their family members are busy with work commitments. We also provide caregiver training at these centres. Our suite of home healthcare services include home nursing services, where our nurses provide nasogastric tube changes, urinary catheter changes, medication management, caregiver training and support.
我叫蔡彩凤，70岁了。2010年我确诊了癌症，2018年癌症复发，我还要照顾我孩子蔡玉贤，今年32岁了。1岁多，因为发了高烧，所以伤到了脑跟语言神经，所以他现在不能说话，右手左脚不顺利，因为他不能够正常的吃固体食物，只能够通过鼻管来摄取营养牛奶。教育基金每个月来换 feeding tube， 提供免费的 feeding tube， 来换这个 feeding tube 的时候也没有收费。我可以省了一点那个金钱了，而且我不用担心去找护士来换这个 feeding tube 了。那我们这3年这样了，接受家护基金的服务了。
Our doctors provide home medical care such as regular health reviews and prescription of medications. We also provide home rehabilitation services such as physiotherapy, occupational therapy, and speech therapy. Home personal care services assist patients with daily self-care activities like toileting as well as basic housekeeping, medication reminders, and maintenance exercises. Our social workers address the psychosocial needs by providing counselling, care coordination, advanced care planning, application of grants, nursing homes, respite care, and emotional support for patients and their caregivers. At our wellness centres, we offer daycare services to help lessen the load of family members or caregivers who are unable to care for their loved ones during the day due to work commitments. Our professional care team, which includes physiotherapists, occupational therapists, and nurses, come together to design the most personalised activities that are suited for our seniors' needs and interests. A range of centre-based nursing services that include tube changes, medication management, wound management, and chronic disease monitoring are also available for seniors who require them.
My name is Hamza, 69 years old. At the moment, I'm at the rehab center in daycare because I'm one of the stroke victims. I at the moment doing therapy. Actually, I don't know about this place. That time my wife admitted to this place. She got Parkinson because she cannot talk properly. And my daughter was me coming here. So after some time, I told my daughter, okay, I think I can give a try coming here. Last year, July, until now, I got a very good therapist here with me. When I come here first, I can't even walk properly. I have to use the wheelchair. Until now, I can walk properly. I'm getting the momentum again. So I really thank her very much. The people here, they are very, very friendly and very experienced. They know what they're doing. They know what they want to give you. I really enjoy it.
We recognize that many family members are thrusted into the role of a caregiver unexpectedly. Our caregiver training and support program aims to equip them with skills and techniques to better care for their loved ones and for them to understand the resources available in the community. Our desire is to empower our patients to live with joy despite the circumstances and challenges that they may face. We want to be here for our patients and clients who need us today and for those who will need us tomorrow. We will become a hub for home healthcare services, a go-to pillar of support for caregivers and patients to assess the comprehensive services that we provide. We hope that you will join us as our community of supporters, donors, volunteers, and partners to help our patients and caregivers walk this journey with joy.
Hi, I'm Lawrence Low.
Hi, my name is Wei Ping.
I'm Wendy Lee.
Hi, I'm Asher Ang. I'm 17 years old this year, and I'm a volunteer at Wellness at Hougang.
I've been doing volunteer since almost 10 years.
I'm 56 years old. I've been doing volunteer job for a few years.
With Home Nursing Foundation, I started volunteering about 6 years ago. I've always been volunteering since school days when they organize volunteering activities, and I just maintained it throughout my life.
Usually we will accompany the senior, have activity with them and home visit them. It actually motivates me to be more strong and more active so that I can have more years to assist them. I feel happy when I'm with them, when I see they smile or I see they have more energy to interact with me, and that makes me feel that it's a great job that we can make senior more active and more happy.
So I've been volunteering for about a year now. So that was during my school holidays, and we came down for about 1 to 2 weeks. And we continued doing that every school holiday whenever we can and when COVID restrictions allow. Some of the best life stories I hear are from the seniors here. And I think that it's very good for us to come down and have this intergenerational bonding. And I think that my friends also have feedback to me that they learn about how to socialize better with their own grandparents through coming here to volunteer.
So far, I find that I'm working very well with those seniors, especially at my age group. I find that I'm able to communicate well with them. I will collect the hamper from the home nursing. I will distribute to individual patient. While distributing, normally I will say hello to the patient, consult our patient and asking them, how are you? I think after they receiving the hamper, majority of patients are very happy and they will keep on thanks you.
Many of the recipients I visit, they are going through difficult situations in life, but they put on a smile. You see the love in their family, you see the hard work, the dedication, and it is very inspiring.
To me, volunteering is giving your time and effort where you can to help improve other people's lives.
I believe good quality volunteers, you must have the patience and the heart to share and to contribute.
最要有的就是慈悲心，因为你有慈悲心的人，你就愿意去付出，no complaint。
Ladies and gentlemen, as we are going to proceed with the event very shortly, we would like to invite you again to take your seats in the hall as soon as possible. Thank you very much. Ladies and gentlemen, it is our privilege to welcome our guest of honor, Madam Rahayu Mahzam, Senior Parliamentary Secretary, Ministry of Health, to join us for this morning's proceedings. Let's give Madam Rahayu Mahzam a round of applause, please. Thank you, Madam Rahayu, for gracing this event. Good morning, our guest of honor, Madam Rahayu, esteemed guests, ladies and gentlemen. Welcome to Home Nursing Foundation's Caregiving Conference 2023. Creating a Sustainable Caregiving Community, a conference for practitioners and caregivers. I am Kamaljit, and I'll be your MC for today. Thank you for taking your time from your busy schedule to be with us here this morning. To kick off an exciting day of information, sharing, and thoughtful engagements, I would like to invite the CEO of Home Nursing Foundation, Dr. Christina Tiong, for her opening address. Dr. Tiong, please. Thank you.
Madam Rahayu, Senior Parliamentary Secretary, Ministry of Health, community partners, guests, colleagues, friends, and esteemed caregivers. Good morning and our warmest welcome to HNF's Caregiving Conference for Practitioners and Caregivers. It warms my heart this morning to see so many of us here and online, united by our passion and commitment to create a sustainable caregiving community for those who care and those who are being cared for. My mom recently passed away after living with Parkinson's for 15 years. It was heartbreaking to see her functionally decline, to see her physical frailty, and the mental and emotional challenges that she experienced over the last decade. And so caregiving is a topic close to my heart, as it is to many of yours. I'm also grateful to my family members now, not then, when they were taking on the difficult task of looking after her as their main caregivers and care managers. And even though it was not always easy to agree on those care decisions, she was very blessed to have strong and capable helpers at two very critical periods in her life, at the start and at the end. But there were also myriads of challenges and adaptations, and all these were part and parcel of the caregiving journey. Apart from kind-hearted colleagues, relatives, and the kids who visited her and brought her out on excursions and meals, she was also very fortunate to have the support of a team of great home care professionals, experienced home medical doctor, dedicated nurses, and therapists from none other than Home Nursing Foundation. And they played an important role in guiding my mother's care, offering expertise, comfort, and resources at crucial moments. Caregiving, while deeply personal and demanding, is not a solitary venture, although it can feel that way at times. And it involves more than just the caregiver and the care recipient. It's the entire family unit, the ecosystem, the friends and the neighbors that comes together in order to sustain and support the caregiver in his or her endeavors. Many of us, as caregivers or having experienced caregiving as a healthcare or social service professional, understand the interconnectedness of the caregiving ecosystem and the importance of working together. Each of us bring a unique perspective and expertise to this collective effort. Caregivers provide much-needed physical care and emotional support to their loved ones. Social service agencies offer resources and guidance, serving as signpost or reprieve for caregivers seeking assistance. And healthcare organizations or practitioners contribute to the medical knowledge and treatments and enhance the overall quality of care. Academic institutions conduct research and develop best knowledge and practices that can enhance the work of caregivers and care professionals. No single entity can do this alone. Sustainable caregiving is a collaborative journey with various stakeholders, exchanging experiences, knowledge, and innovations with the common goal of empowering caregivers to keep going and respond and evolve with the needs of their loved ones and Singapore's changing needs and landscape. As part of Home Nursing Foundation's gift to caregivers, we are building a caregivers digital resource, Carers Hub. This will be launched next year, and the Carers Hub will be a virtual platform where caregivers can access useful and relevant caregiving resources 24/7 and convene with other caregivers online like themselves, exchanging tips, encouragements with one another. And this initiative is also supplemented with a 250 square meter physical space at our office in HDB Hub, where we conduct workshops or support sessions with our partners for caregivers. We have also embarked on writing interdisciplinary care protocols so that the different care professionals understand how to work together and come together to support the caregiver in a meaningful and sustainable way. Many family members may feel confused and lost when the role of a caregiver is trusted upon us unexpectedly. Hence, we have also partnered with Sengkang Community Hospitals and other regional health systems on a series of virtual caregiving training sessions where we train caregivers on how to care for their ailing loved ones before they are discharged from the hospital, in addition to our face-to-face workshops and in-home caregiver training. In today's conference, I'm very excited to have the privilege of hearing from experts, engaging in meaningful discussions that will further enrich our understanding of sustainable caregiving. Together, let us explore innovative approaches, discover best practices, and pave the way for a future where caregiving is not only sustainable, but possibly fulfilling. Thank you for being part of this crucial conversation, and I look forward to these discussions and insights and collaborations that will unfold during this conference. And as a physical show of support to all caregivers, past, present, and future, I would like to ask all of you who have received a paper flower when you checked in today, lovingly handmade by our seniors at HNF Wellness Senior Care Centre at Buangkok and Hougang, to make a generous donation and plant it into the flower pot that you will see at the lunchroom as well as at the registration to show support for all caregivers. Lastly, I would like to express my deepest gratitude to all of you, as well as Madam Rahayu, for the past years of dedication and support to our partners and our colleagues, and being uplifting in our journey to empower our patients and caregivers. Please join me in giving a warm round of applause to our guest of honor, and may this conference signify the start of building a sustainable caregiving community for all of us. Thank you.
Thank you, Dr. Tiong, for the opening address. With that, it is my pleasure to invite our guest of honor, Madam Rahayu Mahzam, to share a few words with us, please. Madam Rahayu.
Dr. Christina Tiong, Chief Executive Officer, Home Nursing Foundation, distinguished guests, ladies and gentlemen, good morning. It is my pleasure to join you today at the Home Nursing Foundation's HNF Caregiving Conference. With Singapore's aging population and shrinking family sizes, more Singaporeans will become caregivers if they are not already caregivers today. Whether it is because of a sense of duty, responsibility, or love, most of us want to provide care to our loved ones. However, we often hear stories of caregivers who are overwhelmed by their caregiving duties. Many caregivers make sacrifices to be there for their loved ones. Their social life, their life plans, and even their own self-care may suffer. Some might sacrifice their careers to spend more time with their ailing parents, and their retirement savings might take a hit. But this need not be the case, as support is available in the community for caregivers. As Dr. Tiong shared earlier, the caregiving journey can be a sustainable and fulfilling one. The ecosystem of support that cared for Dr. Tiong's family exists for other caregivers too. For homebound seniors, there are home care services providing custodial, medical, and nursing support to enable caregivers to fulfill their loved ones' wishes to age at home. For seniors who are less frail, daycare services provide social engagement with care, allowing their caregivers to continue working or take breaks from their caregiving responsibilities. Beyond care services, caregivers can empower themselves with knowledge and skills through caregiver training courses subsidized by the Caregivers Training Grant, and find camaraderie with other caregivers in caregiver support groups. But there is much more we can do, and I believe that we can get closer to our goal by putting our experiences and knowledge together. This is what this conference is for. Let us first understand the problem statement. Why do some caregivers struggle while others find balance? The first panel discussion will explore this through a range of perspectives, from a wider population-level view of patterns and similarities to the individual and personal experiences of our caregivers. What are the strengths of the more resilient caregivers? What are the issues weighing down our vulnerable caregivers? How do caregivers seek help, and what sort of support do they desire? While we listen and learn from our panel experts, let us ponder on this together. After learning more about our caregivers, we must also know how to best support them so that they can maintain a sustainable caregiving journey. Our social service and care professionals face the difficult challenge of crafting interventions for many while still addressing the unique circumstances of each caregiver. In the second panel discussion, the panelists will explore different ways the community can come together to support the varied needs of caregivers. What has worked well so far? How do we scale up the effective interventions? How do we involve the wider community in building a sustainable caregiving ecosystem so that the caregiving responsibility does not fall on care professionals alone? These are the questions we should endeavour to answer. This conference is an important step towards our shared vision of a supportive and sustainable caregiving community. Although this conference will only last a day, I am sure the conversations you will have here today will continue into the weeks and months to come. The relationships you forge today will serve as catalysts for future collaboration and innovation. Together, we can enable our caregivers to have joyful and sustainable journeys. I wish you all a fruitful and engaging session. Thank you very much.
Madam Rahayu, may we kindly request that you remain on stage for the presentation of our token of appreciation and photo taking. Dr. Tiong, please. Thank you, Madam Rahayu and Dr. Tiong. Thank you very much. Now, we will be inviting our speakers to share their insights on caregiving with us. There will be a Q&A sessions after each presentation. During the presentation, you may scan the QR code on the screen to leave your questions on the Q&A platform. The speakers will be answering these questions at the end of the presentation. May I invite Dr. Ng Wai Chong, who will be introducing our speakers and moderating the Q&A sessions. Dr. Ng, please. Thank you.
Good morning, everyone. So we are going to do it this way. The first, we'll have 3 keynote speakers. The first is, as you know, Dr. Rahul Malhotra, who has the really like the 30,000 feet view of population-based caregivers' needs. And then we'll have Mr. Samuel Ng on the perspective of a caregiver, and Wang Jing perspective of a service provider. And we're going to have a panel after that, after the break, where caregivers will be sharing, and I'll introduce the panelists a bit later. So for the first speaker, he'll be given 30 minutes to present, and then we'll have 15 minutes of Q&A. So the first speaker, Dr. Rahul Malhotra, is a doctor by training, and he has been with the Center for Aging Research and Education of the Duke-NUS Medical School for many years now. He's a researcher, and his interest is in aging. And today he's going to share with us a very important study related to caregiver needs in Singapore. So, Dr. Malhotra, please.
Yeah, thanks a lot. Good morning, Madam Rahayu. Good morning, Christina. Good morning to all the people in the audience and those who are joining virtually. So I would like to thank the Home Nursing Foundation for organizing this very relevant conference and for giving me an opportunity to share my work. I guess before starting, maybe just a clap to all of you. I guess we don't celebrate ourselves as caregivers, so clap to all the caregivers in the audience. Clap to all of you. And when I say caregivers, it's not only family caregivers, but all the formal caregivers, the service providers as well. So I'll be talking about family caregivers of older adults, and that's not to say that caregivers of other groups of individuals, such as those with mental illness or those with disabilities, are not important. It's just that my work is focused on caregivers of older people, and therefore that's what I can speak about confidently, and therefore that's what I'll be sharing about today. Right. And I come from the Center for Aging Research and Education at Duke-NUS Medical School, and I'll be talking about, as Dr. Yeung mentioned, caregiving-related needs and the importance of social support for family caregivers. I'll be starting out with motivation for why I do it, as well as from a personal level, as well as from an empirical basis, why it's important to focus on caregiving for Singapore per se. Then moving on to a study that Dr. Yeung mentioned that we've done at CARE called the TRACE study, presenting a brief profile of the family caregivers in the study, and then moving on to caregiving-related needs and social support, and finally summarizing the findings towards the end. Right, so what's the motivation? So at a personal level, it comes from this gentleman that you see on the screen, and that's me in his lap years ago. I was a secondary family caregiver for my grandfather, who passed away nearly 30 years ago in fact, and he lived till the age of 85, which was an achievement for him given that he was in kind of what is now Pakistan, and then moved to India during the partition and had a hard life, but he was a teacher, and I learned a lot from him. But the long life that he lived till age of 85, of course, brought in the fact that he had dementia. Age is the single biggest risk factor for the development of dementia. And I guess I was a secondary family caregiver with my father and his brothers taking the role of the primary caregivers. And I guess I was a bit shielded from the overall kind of caregiving experience because I was in school and so forth, and I was maybe too young to really contribute meaningfully. But I did contribute in the diagnosis, right? So he used to teach me. And at some point, just simplistically, 2 + 2 for me was 4, but for him became 5. And we used to have half-an-hour discussions on why I'm right and he's wrong, or he's right and I'm wrong. And that started off, and my father is a doctor, so he was able to pick up the fact that there's something going on, and then he was diagnosed. But again, it was a personal experience for me that I still remember, again, the good and the bad of it. And that kind of motivates me to work in the area of family caregiving. At an empirical level, why Singapore should be concerned about family caregiving, and all of us are, I mean, the fact that there are organizations like the Home Nursing Foundation and the Ministry of Health is involved in a lot of programs that support caregivers, is simply because of the speed of aging that Singapore has experienced. Right? So this is a graph, and all the data that I present is based on UN population estimates, simply because I compare different countries. And according to the UN population estimates, Singapore kind of moved from being an aging to an aged nation in around 18 years and will move to a super-aged nation over a course of just 7 years. Compared to Japan, which we think as the world's most aging country, it took around 26 and 13 years for the same process. And the US, where a lot of research on aging and caregiving occurs, took, nearly a century to become an aged nation and around 30 years to become a super-aged nation. So Singapore has a very rapid pace of aging, which kind of keeps a lot of us up, who are involved in research as well as policy and practice. Right? And why is this so? Again, not surprisingly, 3 main kind of drivers for any country to age. It's the total fertility rate, the number of babies that would be born to a woman through her reproductive lifetime. And that's had a rapid decline in Singapore. So it's the pace at which fertility rate has declined, which has resulted in the rapid pace of population aging. And the lowest value was observed last year, 1.04 in 2022. It could be the effect of the year of the tiger. Hopefully next year, year of the dragon, it pushes up a bit. But again, that will be a small bump if at all. But the overall pattern is that it has been low and it has been sustaining low for a long period of time. There has been a rapid increase in life expectancy, beating the US years ago, nearly touching Japan. There has been a small dip towards the very end, and that reflects the COVID mortality across all countries. But again, that is a temporary blip. Singapore would be kind of back to its increasing pattern. And then we have migration. I guess migration is also a policy lever or a tool that's used in many countries, including Singapore, for countering or buffering population aging. But again, it cannot be considered to be a tool that will be kind of omnipresent or to an extent that it will completely counter population aging, I guess, because it has kind of implications in disturbing the social fabric of a nation and so forth. So it has to be kind of carefully looked into. So given population aging and these drivers of a declining fertility rate, increasing life expectancy, we will have an increasing number of older people in Singapore. So currently we are at around 1.44 million individuals aged above 60 and above, again based on the UN population estimates. And the increase compared to the year 2000 is around nearly 4 times more people. Now this will temper eventually because I guess of the low fertility rate. So if there's no kind of pool of people who are left to age, or there's a smaller pool of people who are aging, of course we will have the pace of aging will eventually decline, but of course, we will have a higher number and proportion of older adults. But again, we are looking at nearly 1 in 4 persons aged 60 and above by the year 2050, right? Another kind of point to note here is who are these older people? What's the distribution of these older people? And that matters. And that matters because based on the data that we've collected in national surveys at CARE, including the SIGN study, we see that there is a dramatic increase in the proportion with limitations in activities of daily living, as well as in activities, instrumental activities of daily living, right? So the ADLs are things that one does as soon as they get up in the morning, and that's essential for survival, if you may. And instrumental activities are activities that are needed for societal functioning. And all these, based on our data, there is a rapid increase in the presence of limitations in these activities once an individual crosses 75 years. And therefore, we should look at the numbers that I showed in the previous graph, in the number of older people in the population, and divide it by age group. And when we do that, it tells an even alarming story. The story, of course, is that if we look at the year 2000, we had nearly 4 times as many 60 to 74 individuals in the age range of 60 to 74 compared to those 75 and older. Even today, that number is around 4-fold, but it will change dramatically as we move ahead. The number of people who are age 75 and older and the number of people who are age 60 and 74 will be roughly similar, and therefore it's this kind of lower group, the orange group, where we expect a lot of people. That's where a lot of things start going wrong in terms of health and the need for social care and medical care. That's the group, and therefore the pace of increase has kept pace till now. But from here on, there will be a much more rapid increase in the number of people who are age 75 and above compared to those who are 60 to 74. And that's the group that we have to really kind of think about. again, population aging is not something bad, right? It reflects a public health success. It reflects hygiene, sanitation, clinical kind of service success. But at the same time, we have to be cognizant of the fact that as people grow old, there are issues that start cropping up, and it's the 75 plus which really kind of are where a lot of kind of help and support from the family and service providers and the clinical services would be eventually needed. And again, who handles that? So at least till now, and I think in the foreseeable future, it would be family caregivers. Family caregivers are central for caring for older people in Singapore, given cultural values and societal expectations, given policies that are aligned with age in place, including the latest action plan for successful aging. And again, when we say age in place, for most individuals, it would mean aging at home, surrounded by their family and friends, supported by home and community-based services. And with a declining family size, consequent to low fertility rate, people would have, compared to kind of your parents who may have 2 or 3 children, many of you may, and the younger generation may have only 1 child or no child at all, and therefore there is an increasing likelihood of the younger generation to take on caregiving responsibilities full-time compared to kind of the senior generation or those older, because they may have brothers and sisters to support kind of the whole caregiving role. And therefore family caregivers will and will remain central to kind of caregiving for older people in Singapore. Now, I was trying to look at numbers and projections for numbers of family caregivers in Singapore, and I couldn't find any. So I did a bit of calculation, and those are the assumptions that are listed there. So again, one has to kind of take these numbers in context of the assumptions that I've made, which include that around 15% of older people would require human assistance with at least 1 ADL and IADL. Each older person would have at least 1 primary and 1 secondary family caregiver to help and support them based on the data that we have. And that suggests that by the turn of the century, nearly kind of 500,000 individuals in Singapore would be family caregivers to older people. Of course, this is just older people. I'm not counting caregivers of other groups that require caregiving. And when it comes to proportion, it's nearly kind of more than 1 in 10 individuals who are aged 20 to 89, because that's the age group where most caregivers lie. At least based on our data, we rarely have caregivers who are themselves 90 and above. But again, even now, we have around 300,000 individuals who are caregivers based on these numbers. Again, these are based on the calculations that I have kind of there, and may not be fully accurate, but at least give a sense of where we lie and where we are headed towards, right? So given the importance of family caregivers in Singapore, given the fact that it's an increasing group, of course, it's important to have data on family caregivers that helps policymakers, that helps service providers, practitioners to really provide services that benefits caregivers and their care recipients. So with that intent, we did a study called as the TRACE study. And you can read more details in a brief that we published that's on our website. But again, it's a longitudinal study in which we enrolled and followed up the same group of caregiver and care recipient dyads, nearly 300 of them, over a period of 2.5 years. So they were interviewed every 6 to 12 months. The plan was 6 months. Then, of course, COVID hit, and then things got derailed. But we were able to kind of sustain and interview them for up to 4 interviews. And the care recipients we had in the study are community home-dwelling older Singaporeans aged 75 and above. And why 75 and above? Because as you saw, that's the age where a lot of care needs start evolving, who are receiving human assistance with at least 1 ADL and IADL. And these individuals came from national surveys of older people in Singapore. We did not sample from hospitals or care providers, specifically because a decent proportion of older people may not be hitting these services, may not be hitting the hospitals and so forth, and therefore we wanted a real picture of what's going on in the community. And the caregiver was a family member mostly, and a few friends who were involved in at least 2 of the following activities: providing direct care to the older person, ensuring provision of care, or making treatment and care decisions for the older person. And some of you in the audience or those who are attending virtually may have even participated in this study, so I really thank you for your participation and your time and your sharing as part of this study. So who were these caregivers? What we found in our study, that it's most of them were children, followed by spouses, And when we broke it down further by relationship, one thing kind of clearly struck out was nearly 3/4 of them were women. Spouses, daughters, daughter-in-laws. So caregiving, again, I'm not saying that there are no male caregivers, but again, caregiving even now, and this is kind of data that we collected nearly a decade ago, all of them show that caregiving still remains a strongly gendered kind of story in Singapore, as it is in many countries. Singapore is not unique in that perspective, but again, that's something to kind of really kind of think about. In terms of age, because the care recipients themselves were 75 years and above, not surprisingly, a lot of caregivers themselves were kind of older adults themselves in the age range of 60 to 69 or up to 79 years. Given that age range, we nearly had 1/3 who did not have any education or only primary education. Around 40% was still working, part-time or full-time, and therefore there is a potential for caregiving work conflict for individuals who have both a caregiving role and a work role. And that's something that I will speak about more in subsequent slides. Were they kind of caregiving all alone? As it was mentioned, it takes a whole ecosystem to care for kind of an older adult. Well, in addition to the primary family caregiver that we enrolled in the study, nearly half of them were helped by a secondary family caregiver. At least one other person in the family or a friend was helping them. Half of them were being helped. Again, these are not mutually exclusive. So there could be kind of people who are helped by a family member as well as by a migrant domestic worker. So half of them also had a migrant domestic worker helping them. But still, nearly 1/3 were the only caregiver for the care recipients. They had no help from a family member, a friend, or a migrant domestic worker. What about formal care services? Again, the first column there is the migrant domestic workers. So that's, again, the two colors that you see here. The first, the blue color, is about the overall sample, and the orange color is more about care recipients who had at least one ADL limitation. So that group is the one that we expect has greater care needs, right? So they're not able to kind of have, they're not able to independently eat, walk on their own, bathe, dress, and so forth. And we did see a higher use of care services by those who have ADL limitations compared to the bigger group, but still it was overall low. I mean, the biggest kind of service use, if you may, was the employment of migrant domestic workers, whereas the rest of the home care and daycare services was relatively low. What was concerning was only around 2 to 3% said they were, in the last 6 months, they had been part of a caregiver support group. And only 1/3 or so knew about the caregiver training grant. So those are things that, of course, have to be kept in mind as we kind of think about service provision for these individuals. And that's kind of the benefit of taking a sample from the community rather than from care providers. Because if you just sample from, let's say if you had gone to the Home Nursing Foundation and enrolled caregivers only from there, we would have had a very different picture. Nearly everybody would have said, yes, we use services. But when you go in the community, it's relatively lower. So what were the needs? Then we went on and we asked them, what are your needs? What else do you need to care for the older person that you're providing care to? And we define needs as a wish to receive support with regard to an experienced problem. And why is it important to study needs? Because if needs are not met, it's been shown in the literature that it's associated with increased caregiver burden, lower quality of care provision to the care recipient, lower caregiver and care recipient quality of life. And therefore, we asked them in the middle of the survey when we had established enough rapport with the caregiver, what services or other forms of assistance would help you in caring for your care, for your mother, for your father, for your kind of wife, for your husband. And not many really stated anything. Only 1/3 stated something in return. The most common response was no need, right? So that became a very common response. And it may be partly the fact that we were a research team that was going in. We were not very familiar with them. And therefore, they didn't find us to be, maybe they didn't open up to us as much as they would have opened up to somebody who was more familiar with the situation. But again, I mean, just keeping that in mind, only 1/3 of them reported any need. And who was more likely to report any needs? Caregivers who were more well-educated, who were living in more expensive housing. Caregivers who were caring for care recipient with 3 or more chronic conditions, and caregivers who had more than one care recipient. So those groups were more likely to say, yes, I have a need, and I think this kind of service or assistance would help me more in taking care of my kind of father, mother, or care recipient. Among the 98 caregivers who did report a need, the most common need was in the context of financial assistance or financial help, followed by home care services. Again, I won't really read through all of them. You can have a quick read. But again, in terms of financial assistance, some of these are representative quotes. These are not comprehensive. They don't reflect everything. But these include things like expanding the Medisave to cover certain medicines which are not subsidized, Pioneer Generation cards to cover additional areas such as kind of medical supplies, diapers, and so forth, subsidies and means testing to be applied only to the older person. Why should the family be included? Again, these are thoughts and wishes of the caregivers, so I'm just putting it across there. And direct grants to the caregivers as well. Home care services, so subsidized medical escort services for the polyclinics or hospitals, short-term reliefs, befriender services, more help to hire male maids, because I think, again, female migrant domestic workers are common, but it's very difficult for a female migrant domestic worker at time or migrant domestic worker to really kind of take care of kind of a male elderly who may exhibit certain behavioral symptoms, especially dementia. So I think and people who have tried to hire male helpers faced issues in hiring such helpers. Informational support, caregiver kind of support in terms of leaves, respite care, and so forth. Again, some of them were more some of them are available in the field. It's not that they're not out there in Singapore. It just kind of points to me that some of them may not be aware of these services, and therefore they're expressing that, oh, these things should be available. Why are they not available? Daycare services, medical care services in terms of polyclinics and hospitals, maybe being open after closing hours for helping them to kind of collect medicines, do payments, and so forth. Again, reflecting that even though we have apps, not all caregivers are comfortable and are familiar with use of digital technology to really make use of it. Community-based services, stay-in-care services, and other platforms. So it was encouraging to hear Dr. Tiong say something about the carer hub that would be launched. And again, that was something that they said, well, some sort of a platform where they can pass on equipment, food, medicines that they hadn't used because they bought a lot of it, or unfortunately the older person had passed away. And what to do with all this that they'd spent money? They don't want any money in return, but they just want to make sure it's not wasted and somebody else can use it. Right? So overall, what we find in the study is a relatively low prevalence of caregiving-related needs in Singapore, and it matches with what we observed nearly 10 years ago as well. The proportion there was around 40% again, much lower than what we see in studies in the UK and the US, where it reaches as high as 70 or 80%. So is it good news? Does it indicate that we have been super successful in meeting all the needs of caregivers and therefore they don't voice anything? I don't think so. I think it's a limited awareness, such that individuals do not recognize that they need help and support. And that became apparent because those with lower educational status and therefore may not be aware of a lot of facilities out there, or residing in less expensive housing, again a socioeconomic indicator, did not really express a lot of needs. It could also be underreporting. Even if they recognize it, they may not be open up about it. And Dr. Maulod, who works with me at CARE, will speak about that in the afternoon, where a lot of people are very hesitant and really do not want to say out loud that they need help and support. And they just trudge alone and alone and alone, which can be dangerous. They can be, and he'll talk more about it, so I won't speak more about it now. But nonetheless, I think financial assistance, both direct and indirect, and home care-related needs were prominent needs that were voiced by the caregivers in our study. Moving on to kind of social support that the primary family caregivers voiced in the study. So covering we've already covered kind of formal care service use. We've covered kind of what are the needs and services and assistance that they voice for. But in terms of social support, what are their thoughts and feelings? And again, in what ways the social support help primary family caregivers of older adults? So what is social support? Social support can be defined as social resources that are available, either they're actually available, actually used, or at least perceived in their mind that if I need to access it, it's available and I can tap onto it. There are two major types of social support: expressive and instrumental. In the context of caregiving, expressive social support would entail having family, friends, or even care providers, formal care providers, whom they can confide in, they trust in, they can share their inner thoughts with, individuals that can pep them up when they're down and so forth. And instrumental support is something that we would be much more familiar with, helping them in a certain task, providing them with a certain service, not necessarily at emotional level, but more kind of at a physical level and just kind of at a technical level maybe. And in our work, we focused much more on the expressive social support bit, and in two groups of caregivers, working caregivers and bereaved caregivers, because although caregivers are considered to be a vulnerable group overall, there are certain subgroups that may be at even higher risk of worse adverse outcomes within the group of caregivers. And therefore, working caregivers are a substantial subgroup among caregivers, and they will likely increase in the future. And when caregivers are straddling a caregiving role and a work role, there is likely interference in both worlds from the other world, from the other role. And what we focused on was how caregiving interfered with their work. And it has been shown in previous research to be associated with worse mental health outcomes such as stress and depressive symptoms among caregivers. At the same time, expressive social support is beneficial for caregivers, and it acts through psychological mechanisms as well as physiological mechanisms. And therefore, it begs the question, can social support, specifically expressive social support, temper or buffer the impact of caregiving interference with work, with stress or depressive symptoms among caregivers? Before moving on to answering that question, let's first look at what ways was caregiving interfering with work among the 116 working caregivers we had in our study. So we asked in the last 6 months, we had a list of things that had been shown in the previous literature, how caregiving can interfere with work. And we had nearly 70%, 67.4%, respond yes to at least one of those ways. And the most common was work interruptions, having to leave work either physically or take a phone call and try to kind of navigate caregiving while being at work. Work schedule being affected, both increased and decreasing work hours, changing of shifts, work performance being impacted, as well as work kind of continuity and prospects. And remember, these are people who were still working when we did the survey. Those caregivers who had left work as a result of caregiving are not even counted here, and therefore I suspect the impact of kind of caregiving on work is even higher, because if we count people who had left work as a result of caregiving, that number of kind of the proportion in which through which caregiving interfered with work would even be higher. So what did we find? Again, there's some kind of regression equation findings below for those of you who are interested in the statistics, but summarizing the findings on top, we do find that the extent of depressive symptoms among working caregivers increased, with an increase in the number of ways in which caregiving had interfered with work. Right? If you consider each of these as a specific way or a specific type of caregiving interference with work, for each type of kind of different interference, there was an increase in depressive symptoms. However, we did find that there was, as expressive social support increased, this association became weaker and weaker. So if you focus on the graphs that are down there, the section that is highlighted in red, the red box, indicates that there is an association between caregiving interference with work and depressive symptoms or with stress. And the section in green highlights that effect vanishes. And we do see, and the x-axis, the axis below, indicates the extent to which they have expressive social support. So we do see that as expressive social support increases, as it moves along kind of the x-axis, we do see kind of people moving on to the green box, such that any interference that caregiving had at work seems to not really affect depressive symptoms or stress any longer. And therefore, that's the importance of having individuals, family members, friends, providers that they can trust, they can confide in, individuals who are around them, who not only provide kind of technical assistance or help with daily activities, but really somebody to share deep thoughts with, inner thoughts with, and pep them up when they're down. Again, the other group that we looked at was bereaved caregivers. The fact that once the care recipient passes away, a lot of services don't, and a lot of family kind of are no longer around. And that's even a greater kind of period of vulnerability, the bereavement period, and therefore we want to look at it. And in our study, we had around 40, 45 kind of bereaved caregivers who lost their care recipient as we followed them up over time. And among bereaved caregivers, a concept that's often looked at is prolonged grief symptoms. Grief is a part of bereavement. But if you still are grieving and you have a lot of grief symptoms at 6 or 8 months after the person has passed away, that kind of points towards something that kind of maybe the need for a professional help and seeking out help. And what it has been seen that it can be impacted by, among other things, a closer relationship with the care recipient. The more closer you are, the more likely you are to grieve and experience prolonged grief symptoms. But having more social support from others around you helps tone down the extent of that grief. And therefore, we wanted to study that does caregiver expressive social support received during caregiving have a lingering effect such that it helps you in the bereavement period as well? And what we found was two things. First, a direct effect. We did find, as one would expect, a closer relationship of the caregiver and the care recipient, unfortunately, was associated with a greater extent of prolonged grief symptoms. And that's expected, and that's in line with the literature. And on the other side, greater social support during caregiving had a lingering effect such that it helped reduce grief symptoms even after the older person had passed away. And when we kind of, again, did an interaction term, again, the red and the green boxes, we did see that individuals who had greater expressive social support during caregiving, the effect kind of vanished. So expressive social support, the fact that you have kind of loved ones around you, is important. Individuals who are not offering unnecessary advice, rather individuals who are helping you, supporting you, listening to you, giving you a listening ear, and supporting you in a positive way and really lifting you up out of your kind of moods. There is a beneficial role not only during caregiving, as we see with working caregivers, but a lingering effect during bereavement as well. And therefore, it highlights the role of family members to extend just beyond instrumental support. It may not be just enough to say, okay, I can provide this service, I can take mom and dad to your brother and sister, I can take mom and dad to the hospital today, why don't you rest? But also sit down with them, talk to them, and really be the listening ear and share your and their thoughts with each other. And that's important. Again, for family care providers, formal care service providers, I think, I guess one kind of message here would be, it's important to take a family-centric approach. And we were discussing just before that it's tough because a lot of KPIs, if you may, are not geared towards measuring the provision of expressive social support. A lot of them are geared towards measuring instrumental social support. How many services did you provide? How many visits did you do? What kind of help did you provide? And it's tough. It's not easy. It's easier said than done, given that a major focus is on extending instrumental support. And how do you then measure it? How do you really value it is a discussion that hopefully this kind of finding opens up. And therefore, that's kind of my last slide. I mean, I've been talking for a while now. And again, the summary is that, I mean, there will be a rapid increase of older adults in Singapore and in the age group where a lot of us will need help and support, that is 75 years and older. Family caregiving has been and will remain central for elder care in Singapore. And thus, there will be a concurrent increase in the number of family caregivers. But again, it will be challenged by a smaller pool of family caregivers within each family. And therefore, the load, if you may, or the benefits, and I think people who are speaking after me will speak about the positive caregiving experiences and the benefits of caregiving, will be focused on a smaller pool and maybe a single caregiver compared to spreading over more family caregivers currently. No need is not equal to no need. And that's important to know because a lot of people may be hesitant in sharing their needs. And when they say no need, there is a need to dig deeper and really sit with them and understand why they're saying no need. Do they not recognize what all is out there and therefore they're saying no need? Do they recognize but want to do it all by themselves? They want to be the superhero. And I was in a mental health conference presenting some findings yesterday, and a caregiver shared that she was so used to doing everything herself, a high flyer, an achiever in the public service, and she was the one who would do everything. And therefore, when it came to caregiving, she just wanted to do everything and she burnt out eventually. And therefore, no need, even if you think there's no need, rethink and therefore focus on what needs are. And finally, the beneficial role of expressive social support over and above instrumental support. It's good and it's fine to provide instrumental support and technical help and assistance and information to caregivers, but at the same time, if you have a caregiver in your family, in your friend circle, as a provider, do sit down, listen to them, talk to them, be the listening ear who can provide support and help to them. So that's kind of the end of my talk. Some acknowledgements for the TRACE study, including MOH and MRC that have funded the study, and thanks a lot.
Hi, we have about 10 minutes for Q&A. So we have 5 questions here. So thanks, Dr. Malhotra, for the very enlightening survey that's based on rigorous scientific research, but it does show something that we know about the importance of emotional support. And there's a question here that really asks about how to, does there any, it's very interesting that that when the caregivers say they don't need, sometimes they actually do need, and you mentioned that you would suspect it's because there's a lack of awareness. But are there any indication that, are there any way to help the caregiver express this or elicit the needs from your studies?
Yeah, so I would say not directly from our studies, but again, talking to kind of community providers and talking to caregivers themselves, I think we realized that I think it's important for the person who's inquiring about these to really kind of first build a rapport with the caregiver, with the family, and then kind of assess the needs, because it's unlikely, and again, I think a function that we observed low proportion of needs in our study was simply because we were a researcher who had spent maybe just a half an hour or 45 minutes before this asking a lot of questions from them, but we didn't really know the family or the caregiver well. So I think what's important is, and again, I think service providers who work with the caregiver and the family day in and day out would be in a much better position to inquire about these. So I mean, that would be maybe not a great answer, but again, I think that's what it is.
I mean, it does sort of align with our usual experience. Like, you really need to build a trust and rapport before people will actually open up to you. But the other thing that was very interesting for me is about the expressive social support. People don't have such words to say, I need expressive social support.
Right.
They just say, I need money. Right. I just need you to come and take care of my mum.
Right.
So perhaps it's a situation of not having a word. So, yeah. Maybe we can go on to the next question, which is very interesting. Based on your understanding of the demographics, there's a question about the needs of caregivers in the future. What are the main strategies? What do you foresee the need of caregiving in the future?
Sure.
Based on the population trends.
Yeah, so I think there will be a greater need for services such as those provided by the Home Nursing Foundation. I mean, simply because I think 2 or 3 phenomena. One, I think although migrant domestic workers take kind of a heavy kind of sharing of the caregiving load at this point, we cannot consider them to be always present, because we've heard many times of the labor sending countries kind of having tighter rules and so forth, and that becomes one. So there will be a greater kind of need for formal care services, community-based services, home care services that will increase. And another reason for that is that the number of children that would be able to support, again, declining fertility rates means 2 things. One, there will be lesser number of children who will be around to support their parents, to take care of the parents. B, there will be an increasing number of childless seniors, individuals who do not have any children, and therefore, as we see in our study, nearly kind of 75% of the caregivers were children. And that proportion likely will go down over time, because simply there won't be any child around to take care of seniors. So future caregivers would have to, I guess future seniors and future caregivers would have to prepare for situations where there may not be any other family member to provide for them. Some future seniors would have to prepare for the fact that there is no child caregiver to provide care for them. And therefore kind of there would be a greater reliance And therefore, there's an importance for building long-term care capacity now rather than wait for when it's kind of required and gradually ramp it up, both the quantity and the quality of care to kind of increase. And we will have to, I guess, one consideration would be, again, in terms of housing and so forth, a lot of kind of facilities will be in our neighborhood, and we will have to kind of acknowledge that. I think, again, there was kind of not in my backyard kind of issues that cropped up before, and we read about it. But again, I think there will be an increasing need for accessible services that are closer to home that allow you to age in place, simply because caregiving will become more intensive with fewer caregivers around.
Thank you. That's and in fact, that's a popular question because somebody also asked about this and about the housing solution. You mentioned about the phenomenon of bereaved caregiving, the grief that is a bit more prolonged. So based on your research among this group of people, what are the other areas of needs do caregivers have after life after caregiving?
Sure. Yeah, so I think bereavement, of course, is one. I think the other thing that I see caregivers in our studies kind of voicing out is integration back into the society, integration back into the workplace. Because many of them have either left the workplace or reduced working hours over the course of caregiving. And they find it challenging, especially those who've been out of the workplace for many years. They do find it challenging and a bit overwhelming to go back to the workplace. Because I think workplaces have changed. And they find it difficult because when they left the workplace, it was a very different workplace. The skill sets that were needed were very different. And again, I think it's important for them to upskill for sure. But for some of them, it's easier said than done because even the task of convincing themselves that they are ready to go back to the workplace, although they want to, is difficult for some of them.
Very interesting. So there are a lot of structural challenges as well as intra-psychic challenges.
Yep, both of them.
And it's related to one of the questions here that you mentioned about the challenges of a working caregivers, that they have to juggle between work and caregiving, and it's like interfering and creating some distress. Are you seeing that those who are full-time caregiving are better off? And then, of course, but if they stop caregiving, then they have to face this integration issues again. But how are the people who are full-time caregiving? Are they better?
I mean, we haven't looked at that specifically. We haven't compared kind of, say, the health or situation of people who are not working versus who are working. But based on kind of research that I've read, I think it's a mixed. I mean, it's not concrete. It's not a one kind of single direction. It depends on the context. It depends on, I guess, the reason why they became full-time caregivers. And many of them may have had to leave the workplace because the care recipient required had much more care needs compared to those who continued working. And therefore, it's kind of confounded with the fact that they're caring for somebody who's sicker. And therefore, it's not. I think it's difficult to generalize and really say that this is whether leaving the workforce is good or bad for you. I think it is something that is very peculiar to each kind of caregiver, care recipient dyad and the support that they have around. So tough to generalize.
So it's a different kinds of caregiving situations. Mm-hmm. Working caregivers have working caregivers suffering, but also have their supports and protective factors. Maybe I've time for one last question. It's about you using the term. Okay, I myself find the definition of caregiving very difficult, very confounding. Different jurisdictions, different definitions. So how did you define caregiver in your research, and what is primary and what is secondary?
Sure. Yeah, I mean, great point. So I think easier for me to define it from a caregiving perspective, from a research perspective, because I think for research, I think we usually take the definition that would help us best answer the research questions that we want. So the focus of our study, for example, wasn't really on the financial aspects of caregiving. If that was the case, maybe our definition would have shifted to the person who's responsible for kind of paying for the various care services that the older person has. In that case, I guess there would be even a higher proportion of individuals who are in the younger age group who are still learning, who are supporting the older person. What we wanted was an overview of how caregiving has impacted the day-to-day life in a variety of ways of the caregivers. And therefore, we did not include kind of individuals who really pay for. So if you're doing a study on the financial aspects of caregiving, I guess the definition would be different. The primary family caregiver, we left it to the family to decide. So when we went in, we first assessed the older person and we decided whether he or she was a care recipient, such that he or she was receiving human assistance with at least one ADL or IADL. Once that was decided, we left it to the family to come together and see who is the person who best fits those three, at least two of the three criteria. And I think of the 278 caregivers, I think nearly 75 to 80% fit all the three. And so that became the primary family caregiver. And the secondary family caregivers, we had a question in the survey asking, who else helps the care recipient with ADLs, IADLs, health and social service use, other needs such as emotional support, supervision, monitoring of the migrant domestic worker. And then the primary family caregiver listed out who else helps, and those form the secondary family caregiver. Again, from a research perspective, sometimes you have to simplify things. But in the real world, often it's difficult to define, and there's usually a network of caregivers that surrounds an older person. So in future work, we definitely want to kind of capture that kind of completely, and hopefully we'll have more advanced analytical methods that help us to analyze those kind of networks better compared to today, and that's an evolving field.
Thank you, Dr. Malhotra. I'm afraid that's the only time, that's the time that we have for this Q&A session. So thank you very much.
Thank you.
So we have many other questions coming in, but we can leave it for the subsequent keynote speakers. And I also like to give a shout out to Dr. Malhotra's colleague, Dr. Maulod. He will be one of the speakers for this afternoon. And I understand his research was the qualitative counterpart of Dr. Malhotra's very robust quantitative data. So the next speaker is also equally eminent, is Mr. Samuel Ng. He is the founder and CEO of one of the largest and most significant social service agency that I know, Montfort Care. And he himself also happened to be a caregiver. So today he's sharing with us his learning from a perspective of a caregiver. So Samuel, please.
Okay, a very good morning to all of you. I think I'm too absorbed in your research findings because I see myself, I'm one of probably what you're talking about, one of the caregiver and the struggle that I have, that I forgot what I want to share. So mine is more light-hearted. I don't have any research. I'm not that academic type. But I just want to share from my personal experience as a caregiver, also being a social worker myself. And I did not realize that, one day, because, social worker, you always think you help people, so you didn't know that one day you end up at the other side, and it was with my, how to use this? Okay, thank you. Okay, first I want to self-goyo a bit. Last year, actually, I published a book called Lao Ma Jiao Hui Wo, that's literally translated to what my mom has taught me, the lessons that my mom had taught me with my 8-9 years of caregiving journey with her. But it's in Chinese. But the good news is the English version is coming up in 2 months' time. So, so there are some Chinese versions. So if you want, you can later on go and buy. But in this book, why I decided to actually pen down my experience is also more to actually as a reflection and also as a personal therapeutic kind of journey. Because I didn't expect that. When my mom, I think it's a typical HDB auntie, the time, my mom is very active, So a lot of people tell me, you hear a lot of people say you play mahjong, you go make friends, all this, then you can reduce the risk of dementia. My mother play mahjong every day. Play mahjong every day, until 12 midnight. My sister would call her, "Ma, look at my thing Then yet again, it started off, we didn't know, the usual stuff. Of course, then the journey of the onset of dementia. Initially, we thought, it's just the irritating mother kind of. Then gradually, I found that, not. For example, I remember one example, Chinese New Year. Chinese New Year, I used to get my church friends to come to my house, over 20 of them, So everybody come with their children. My mom very happy, give ang pao, right? So go around, give ang pao. So she came out, give ang pao, and then after that, 10 minutes later, she came out again, give another raw ang pao. Then they say, "Hey, auntie, you give already. Oh, go back again." 15 minutes later, come out again, give again. And my friend, So finally, they give up. They say on the divorce state, and then my friend quite good, they return to me. I'm not sure whether all of them returned or not. Then on that very evening, when my friend left, that evening time, I saw my mother cutting lemons in the kitchen. So I went and asked her, "Ma, what are you doing? Ma, 你做什么? What are you doing?" Then she said, "Oh, I'm preparing lemon water for your sister. She's going to work." Then we said, "Ma, 你看外面太阳下山了嘞. The sun is setting, So she thought that it's morning. So she wanted to prepare breakfast. This is my sister. So that's the onset. Then I realized my social work friends told me, "Sam, I think you better get your mom for assessment." Then we realized that gradually that begins my journey with my mother, because I'm not married. And then my sister, I have two sisters. My eldest sister is married and moved out. So my second sister is also not married. So the two of us actually then took care of my mother. The initial part, quite okay. But one thing I learned about it is a lot of time, maybe through the media, we always associate dementia with forgetfulness, right? They forget a lot of things and all this. But actually, as a caregiver, joining my mama, now I realize that actually the easiest thing to handle is forgetfulness. Forget, 算了咯, forget, better still, right? Forget. But what is worrying and what is driving a lot of caregivers, even like myself, later on I will share, it's not the forgetfulness, but it's the disruptive behavior. That's the other part of dementia. Some of the dementia patients, like my good friend, her mother, quite good, after that forget, and then very quiet, calm, very calm type. I think that kind is quite easy to handle. But unfortunately, my mother case is the other side. My mother is not the violent case, but my mother is very disruptive. Meaning that, for example, towards the end, she will, like for example, she refused to sleep. And they can really don't sleep for 3 days, 3 nights. I don't know why. And I asked my psychiatrist friend, what happened? He said it's my power and all this, And then they have to prescribe sleeping pills. And then we start to give my mother, she need to sleep. And we also need to sleep, right? So initially it works. After a while, it did not work. So until such a point in time, the psychiatrist has to prescribe sedative for my mother. And do you know that even after a while, the sedative also doesn't work? So one day, my psychiatrist friend called me. He was my childhood friend. He said, "Samuel, this is the highest dosage I can give. In my entire 30 years of clinical experience, I never prescribed such a high dosage, So that's it. I cannot give anymore." So that is, and then the fact is that my mother still doesn't sleep after the sedative, And then when she doesn't sleep, okay, if you doesn't sleep, you lie on the bed, it's okay. But my mother wants to walk. That's another thing I realized, and the psychiatrist told me is what they call a syndrome called aimless wandering. And my mother, towards the end, the leg, and she's already 80 plus and all this, she has no strength. So we need to actually hold her. She refused to use the walker. And then, when she's so tired, it's like almost dead weight. So you have to hold her and you just walk. Can you imagine non-stop walking? My mom can walk for 12 hours non-stop. We stay in a 4-room flat, so my mom will walk from bedroom to sitting room, to the hall, then to the kitchen, and then just walk, and then we just have to carry her. The moment when she sit down, she will scream and yell, and then she want to stand up, and then she can't talk. So that is the kind that causes us, until at the end of the day, the three of us take care. Actually, I'm quite fortunate. We got my sister and my maid, right? Three of us, so we take turns. But do you know that in HDB, you cannot sleep one hour because your mother is still bing bing bang bang outside, So eventually, the sleeping pills that the psychiatrist prescribed, I take. Because I really need to sleep, I cannot. After taking, also cannot sleep. That is where I realized that, and it's very real, when the caregivers for elderly patients, usually you are also into your midlife. So that is where you are also vulnerable. Your health also start to deteriorate. So that's one point in time my health really go downhill until finally actually I collapsed. So and we just cannot cope anymore. But me and my sister are very adamant. In Asia, especially Chinese, this is filial piety. I understand that in the afternoon there's one session on that. It becomes very real to us, especially for my sister. My sister once told me that, when my mom is quite okay, actually she's quite cute, right? And my second sister one day told me, you know the struggle that I have. One day mom asked me, 以后你们会不会送我去老人院? Will you all send me to the aged home one day? And my sister told my mom, 不会. But you know what happened today? My mom is in the nursing home. So it has been a lot of struggle. I think a lot of us also go through the struggle. When the caregiving responsibility actually pushes you to the extreme, but the two of us are still very adamant. But our health are going down. We can my doctor friend tell me, you just cannot cope with your mother's situation. So I'm very thankful that in my life, because then I realized, one thing, actually I'm very fortunate because I'm social worker, I'm in social service, so I got a lot of contacts, I got good friends like Christina and all this, right? And then I got my psychiatrist friend. And then financially, my family, we are not rich, but okay, no need to apply. Still no need, no need to apply all the financial assistance yet, And my family is very closely knitted. The three of us, we all meet and then we pray together and all this stuff, I mean, given all this, the caregiving responsibility is still so tough. That is the beginning of what I realized, what more a lot of other people, those who are struggling in the sandwich generation, they still take care of the children and all this, and what support can we give? So that is also part of the reason why actually Montfort can move in also actively into, providing all the support. And one of the support I find that, I agree with the research, a lot of Singapore, we are a very pragmatic society, correct? So we look for a solution. We always want quick fix solution. So that's why a lot of the caregiver supports are centering around very external or structural help, financial assistance, respite care, daycare, and all that stuff, which is not wrong, which are important. But I like today what I hear from you is the expressive support that I find that is very lacking. And even in my family, me and my sister and all this, do you know that come to a point our family almost break down? I hear a lot of story. Last year when I launched my book, so I have a lot of book sharing with temple, churches and all this. At the end of it, there are a lot of Q&A. Then I hear a lot of stories, how family broke down because of caregivers, the siblings, correct? Why am I only take care of my... Oh, thank you. Why am I only... I'm the only one that's taking care of my mother and stuff like that, So actually, at the end of the day, I find that, we need to relook at our support given to the family relationships. Caregiver, I share with you, okay, I've already shared with many people, so I don't mind. Today, a lot of people, because I go for radio, TV show for the Chinese, so a lot of people know, wow, 你很孝顺啊, you're a very filial son, and all this or that. But do you know that the truth is it's not? Me and my mother, when I was younger, that time, very deviant, I moved out of the house for 20 years, I never contact my mother. When my mother has a first stroke at hospitalized, I didn't visit her. So am I a filial son? I'm not. See, you know, family, we have all this, what I call past hurts or unfinished business and all this. Then when my mother gets dementia, I'm forced, in a way, no choice, forced to take care of her. Now, upon reflection, I find that it is a very good, quote unquote, spiritual journey for me. Because it enables me, and I'm very thankful to God for giving me this. I always say dementia is a long goodbye, right? Gradually, very slowly decline, regression, and all this. But this long goodbye, actually, although it is very difficult in caring for the person, but it also provides you a long enough time for reconciliation, for forgiveness. I'm very amazed and very thankful that today, you know, I can go and, you know, when I go and visit my mama, I can massage her, you know, I can do foot massage. Because today, even you go to the nursing home, you cannot fit, ma. After COVID, you still cannot fit. So, you know, I think bodily touch is very important. So, my own personal spiritual journey with my mom is I need to go through that. But I hear from a lot of my, my social worker or counselor, their cases is a lot of people, you know, you heard of that, right? 以前你怎么对我的？我现在为什么要照顾你？ You know, last time, you know, you remember I got one case last time, many years ago when I was working in Queenstown. I remember one case, you know, he said, you know, the father, during younger, that time, womanizing, gambling, and all this. Now suddenly, you know, they all have to take care of her. Then the father charged them into the tribunal court, you know, the parent tribunal, all this. So all of them come. Then they say, you know, what do you expect me? I mean, all this, all that. So I realized that's another reflection or realization of myself. That actually, what more we can do to support the family for reconciliation. Because if you can strengthen the family core, then the family will be able to actually take on the caregiving responsibilities. Otherwise, in the long run, you know, everything will go to our super omnipotent government. Correct? They will say, you know, yeah, I mean, that's very real, you know. So since you're very good, and our government predicament is the better you are, I mean, now they are doing very well, right? No, the expectation for you is to do more, correct? Give more financial assistance, provide more care, and give more, and all this stuff. So I thought, you know, is it time that actually we should reflect on how can we actually help the family to act, I mean, in this caregiving journey, to gel better, and also to actually come together and to solve their own internal, because there's a lot of past, I mean, that's psychotherapy, a lot of past, you know, hurts, and it gets surfaced up because the caregiving responsibility push you to a corner. You cannot run away. During day, normal time don't have actually, like I always remember when my mother was okay lah, the HB auntie period, she live her life, I live my life, you know. Then okay lah, dinner we eat together. Then that's okay. But then when you have to actually really take care of it, you know, then you will realize, you know, how difficult it is. And then I have one veteran social worker, a very prominent leader, one day say, Sam, can I go and visit your mom? Because then later on she told me, because I look at you, I think you are burnt out. And you really need help and see what I can help. So okay, so she came to and visit my mom. Then she said, hey, because she also hear from me and my sister that don't ever suggest us to bring her to nursing home. It's a no-no thing. Then she said, how about respite? Because you all really need the help, need a break, and then respite for 2 months, and you're going to take care. Then we said, okay, I mean, then we agreed. But it was so difficult. I remember that very day that when we sent our mother to the nursing home, even for respite, I tell them, I cannot take it. I cannot, so I'm not sending her. Then my sister and my uncle actually sent her. And then the medical social worker I know them, the medical social worker actually texted me one photo. You know what happened? Because when they send my mother to a nursing home, at the reception, they don't allow my sister or this to go in. So they say, you go back. Then my sister don't want to go back. So then the social worker took a picture of my sister, it's the Hindi movie already, hide at the pillar. Hide at the pillar. And crying, So there's a lot of, there's a lot of emotions, and the more love you have, then, the more emotional struggle you will experience, And then that particular social work leader told me, her assessment is that my mother needs a long-term institution care. And she said, and in today's context, a lot of people, we need to relook at institution care. There are a lot. I think Christina said, the purpose of this conference is so that we will have more in-depth conversation. I don't presume that I have all the answers, but maybe the other issue is maybe we should relook at institution care. When I was a young social girl, I was told institution care is always the last resort. All right, which is not wrong. But I'm thinking, with this, the trend of this caregiving, could the future institution care, instead of being seen or being perceived as a last resort, but it's a complementary. Because last time the nursing home and all this institution care is like it's a dumping ground, they say, the dumping ground. But even today, I'm sitting on the Catholic Welfare Nursing Home Board. We run 3 nursing homes. And with the fact that we see is over 95% of the resident, the family visit them regularly. So it's not the case, in the past where people see it as a dumping ground. But people need that. In your research, you find that, for example, my sister is working as a property agent. So at one point in time, she wanted to quit and become a full-time caregiver. Wow, our family joking. Everybody sit down, have family conference, and tell her, cannot. You know why cannot? Because after that, my sister is single. Can you imagine the mother? You take care of mother for another 10 years and all this, After that, it's like what you say, Are you able to regain, So in Taiwan, there's a very famous, TV program host says that, in Taiwan, I don't know how relevant it is in Singapore. We need to watch out. Could it be the case of, at the end of the day, the elderly last 10 years of their life kidnapped the golden 10 years of their children, where they are still productive. So this can be a social issue. The number become bigger. So these are but for me, my family, I'm very thankful. My sister then finally agreed. Then we need to come in and support. So I thought, in a nutshell, what I want to share is a few things. Number one is, we need to relook at the family support in a more in-depth sense. It's not just, case management. I think today in Singapore, we are by and large, the social service sector, we are very good at case management capability. I think that one quite excellent, very well done. But I think the other part of it is, can we dive in and look at more on the psychotherapy component and help people to build relationships. After all, family is still the most precious unit, right? So can we actually put in more resources and look at it? And also, secondly, is for my thinking, I think a lot of time is the framing. How can we help caregivers like myself, at the end of the day, to also take a different view of the caregiving journey? It is burdensome. There's a lot of challenges. It can be very hurting also. But on the other hand, it can also be spiritually very enriching. That's why my book, I say what my mother has taught me. My mother has taught me a lot of very precious life lessons. And for that, I'm very thankful. Thank you very much.
So that was a very interesting insight into we were talking about intrapsychic forces, the mind of a caregiver. So I would like to relate what Samuel has just shared with Dr. Malhotra's research just now. So what would you say? She was saying that when you ask caregivers, many of them, if you ask them whether you have any needs, many of them will tell you they have no needs. So I would like to hear your insights on this. Why would a caregiver, maybe when you were burnt out at that phase, when somebody asks you, Mr. Ng, I am here to help you, what would you like me to do for you? What would you say?
I'll take care of my mother.
Are there any needs? Are there any needs that we can...
Okay, I find that a lot of time, even as social workers, when we talk about caregiver, the first thing comes to mind is training.
Yeah.
We see a lot of caregiver hubs, caregiver training, caregiver network around, and the training is top on the list. And then one day I have a lunch conversation with ESM Go at Marine Parade. So because that time they are also talking about the caregiver network. So I said, ESM Go, can I be very, very honest with you? I am a caregiver that is struggling, very big take, very burnt out, very big take. Really ask me to go for training, you must be out of your mind. Correct. So when that about reflection, my view is training or this maybe is a pre-thing, before they go into the caregiver, then you need to actually prepare them. But when they are already in the journey, I think at the end of the day is the journeying with them.
Yeah.
So I find that number one, the case management is very important. I think that one is I think AIC has started the CREST and Commit program, and one of which a lot of social workers are doing that, which I think is very helpful because every case, today I share my case with my mother is also very unique. Maybe in our audience, I think many of you are also caregivers. I think your challenges also very unique. So I think at the end, we need more of all these professionals to actually able to take up this case management journey with them.
Thank you. So perhaps it's not so much asking them directly, point blank, what are your needs, but it's actually care management, journeying with a person. So you mentioned about filial piety. So somebody asked a question about conflict between the philosophy in Singapore where, self-management, family as a second line or first line of support. So how, from your own perspective, what was your journey in dealing with this pressure, to caregiving? How did you overcome it? And what do you have to say about this, perhaps you can call it some kind of ideology of care, in Singapore?
Honestly, sometimes I find that this concept, this value, the Asian value of filial piety, for me, has become a cross that is too heavy for us to bear. And we need to rethink, redefine what is filial piety in the modern day context. In the past Asia context, we filial piety. I think that era is applicable because we got extended family, even got kampong, your social network, the natural indigenous network are very strong.
We were agricultural.
Yeah, correct. So, it's not so sophisticated, not so stressful. Today, we are all living in a high stress and all this. So, if you compare us with the Western, 18 years old, you get out, all this. So because of that, in their long journey, they have built up a lot of institutional, community resources, care. So that the elderly, even early on, you mentioned, I'm thinking about myself, I'm also single. I'm 57 this year, Next time, who is taking care of me? That's why I want to become a social worker. That's why we need to go into community elder care to build the future support network for myself also, in that sense, Yeah. Because Because you cannot rely. Even my friends who have children also say, you cannot, they'll be overseas, they have their own aspiration and all this. So we really need to relook at community, how we can actually beef up or how we can facilitate the indigenous power of community care.
Yes. Oh, totally agree. I mean, as a doctor, I've got a few patients whom, when I see the parents, I actually have to Zoom call with their daughters, one in Australia, one in America. So it is going to be quite common where even if you have children, your children may not be with you. So lastly, I'd like to take you on your point about, you sent your mom to a nursing home. I mean, of course, in the future, people like us, we may have to go to the nursing home. What to you is an ideal place for an older person to live in? I mean, you were talking about going to a nursing home is probably a good thing. Yeah. What is an ideal nursing home?
My ideal case is, for me, I cannot speak for yourself, don't live too long.
Oh yeah, he was telling me that. But we don't have a choice.
We don't have a choice. No, I feel that, which I think the government has spearheaded a lot of initiative into like the different option, housing option, community living and all this, and I thought, that is one of the area. You talking about nursing home, one thing that came to my mind that I want to share, probably the last thing, that sometimes we confuse love with guilt. A lot of my social workers counterpart, I think some of them here, Yi, Yuxuan, and all this from Montfort, all this, they always tell me, given my situation, they say, your mom now settled in so well in the nursing home. The space is big and all this or that, If you look at it objectively, that is a better place for her. I mean, now my mother is gong already. She cannot even recognize us, cannot even communicate. All this stuff. But if you ever want to bring your mother back, like your sister or this, sometimes it's the guilt, It's just your guilt. So the home administrator, the ED, also very pointedly tell me, you all want to do it, you all must be aware that, it's do it for yourself and not for your mom. So then I go back and think about it. I thought, it's quite relevant. Sometimes we get confused. We thought it's love. But actually, the driving force beneath that love may be guilt.
So with that, I would like to thank Samuel for the enlightening talk and the Q&A session. Thank you. Thank you. So with what Samuel said on one of his parting remarks was about psychotherapy, about journeying with the person, and it's not just about tangible support for family caregivers. Well, it gives me great pleasure to introduce my next speaker. So it's Ms Wang Jing. She has been a community gerontological psychologist counseling for many, many years. She has built the Huame Center for Counseling and Coaching Service from its beginning in the 2009, if I remember correctly. And she's also run and curated a course on gerontological counseling a few years ago. So this is Wang Jing. She's from Tsao Foundation. She's the head of the counseling service. I'm not sure what's the full title now, but I think it is not as important as what she's going to share with us about how do you work with a caregiver. Yeah, so Wang Jing.
Good morning to all of you here. Yeah, it's really happy to be here to have this opportunity. Thank you for Home Nursing Foundation, Dr. Chong, for giving me this opportunity to share with all of you on our practice, our experience in working with family caregivers. I was so connected just now when Dr. Chong mentioned about your experience as a caregiver, and Dr. Rahul mentioned about his experience for the grandfather, and of course Samuel. I heard this for a few times, but still very inspired. Yeah, I'm a caregiver for my father who suffered from Parkinson's disease as well. So this really reminds me about this saying, like, there are only 4 types of people in this world who has been caregivers, who currently are caregivers, or if you are young, caregiving is something new to you, you will be caregivers. Or one day we may all need caregivers. So that is, I feel it's so well said. I mean, it covers all of us. Actually, caregiving is so universal and it's so close to our heart. Yeah. So I would like to share our experience. Actually, it's a program. Actually, we start running in foundation in some way of different in working with caregivers. So this morning when Samuel mentioned about whether going nursing home is a good choice or whether people want to stay in the community, there's no clear answer. But I think everyone may have their preference. So this actually one of the survey done by our HDB in 2018, and this is the news from CNA in 2021. It shows like 86% of the elderly residents, actually, they intended to continue living in their current flat, which means aging in place, the familiar environment. And also, if one day they will need some help, they would prefer, 46% of the residents, they prefer or believe the ideal living arrangement would be stay at their own home and care by having family members or domestic helpers. So this is a very interesting findings, how important actually family caregiving need to be, because this could be the preference from our parents, from our loved ones, but it also could be one day we may want this, I mean, in a familiar environment. But we all know actually family caregiving is never an easy job. It's so many challenges and so much, whether it's physically, emotionally, psychologically. So when talking about family caregiving, a lot of people will really relate to this as like stress, burnout, or difficulties. I mean, we have went through so much, right? So then this brings to the next question is whether is it possible to have a positive and rewarding caregiving experience? Because all of us actually coming into caregiving with good intention, whether it's with love, want to be responsible for our family members, or with some kind of like, I want to do this. But along the way, actually, because of so many challenges and all the things, then people will start question, why I'm doing this? Actually, I really like experience so much and it's really reached to the limit, and whether this is something too heavy for me to handle. So, but we all know, like what Samuel mentioned, this is a great opportunity for us to provide the care and appreciation for our family members. And at the same time, actually, this is such a wonderful moment. Actually, we want to really treasure because it could be the last stage of our loved ones. So then how to make it happen? Whether we are able to really cultivate this something like we can still feel meaningful, still feel rewarding. So we have done this collaboration with Duke-NUS, Dr. Rahul. So they share some of the small fundings with us, and we start to try to find answers about those questions. What is important? What could be some of the key elements? Some caregiver, they, no matter whatever the difficulties or challenges, they can still cope, and they still manage, they sustain. But some of them, they say, it's enough. Really cannot already. So what makes some of them can continue this journey? So we want to find out some answer. Through the research findings, we managed to summarize in these 3 points. I don't know whether this makes sense, but to us, we try to map out. The first thing, the caregiver need to feel motivated, or at least accepting. It's a role I want to play. It's a role I want to take on. So it could be out from love and care because my parent or my loved one treat me so well. This is the time I want to give them that kind of better quality of life or whatever things I want to do. Or some of them, actually, they may not have very good family relationship, but it's in their belief system. It's like, this is the job I need to do, and I want to do it. So with this kind of acceptance and motivation, the caregiver is able to continue. And second thing, it must be something they feel they benefit, something they feel I also get in this journey. Because it cannot be always providing, giving, you will feel exhausted. I mean, sometimes actually the energy may really go flat. So what actually keeps us going sometimes is we feel we learn something, we gain something, we benefit from this journey. So it could be some of the family caregivers share with us, it's a knowledge and skills I learned along this journey. Now I'm the expert, how to navigate the system, where to find resource, where to find the support. Or I'm become a better person. I'm now more patient. I'm able to really go through the difficult time. I have this opportunity to work with my family members together to go through this difficult time. It brings us closer. So all those could be something people feel good about it. And that help them to keep going. Yeah. And the last one is very important, is that must be something they feel they can manage. The sense of control and sense of taking charge is so important. A lot of caregivers, they feel burnout is because things are really, I cannot manage. Things are really out of control. There's so many uncertainty. There's so many things I don't know how to manage. So we need to enhance that kind of things. So how to get these things done? I think importantly, we need to help them to really take charge of this journey. They need to get prepared. They need to understand what's going on. What could be the possible things happen? And also, they also need to know how to cope with the daily caregiving tasks. What could be some of the things I need to handle? Who can be my partner? Who can help me? Who can support me? And they also need to prepare for future. This future is not only just for the care recipient, the loved one. It's also for their own future. This caregiver role, it could be in your life. It's part of the different roles you are playing. There's so many other commitments. And there's still life after this caregiving journey. How they can plan long enough so that they understand, in this journey, I want to do at my best. But what's next? And what could be possible things may happen along this way when my loved one, like their function deteriorated, when things get worse. How can I cope? Can I mentally, physically, socially prepare for this? So those are the important part. And also take care of their own well-being. Like this is, I really want to connect to what Dr. Rahul mentioned. A lot of times they say they don't know or don't have need. Sometimes may not have clue what kind of needs I may have. How is the well-being going, whether it's physically, mentally, psychologically, spiritually, what kind of needs, what kind of status they are at. So that is important. But a lot of times, they may not have a balanced life because the focus and the attention always cater to the loved ones, and they neglect themselves. So along these findings and some of the insight we gained, we decided, okay, then how can we do it in the community level? What we can do differently in supporting our caregivers. So the translation into findings to practice is something we try to figure out. It's still under experiment. So it's a 10 months pilot project. We started in July this year. We want to train our clinical staff in the foundation in some different ways of working with caregivers. It could be something they're already doing, but can they do it more mindfully? Sometimes it could be something more expanded in their job scope, something different they can start doing. So we try to figure out a way how we can train our staff. So about 20 over nearly 30 staff actually involved in this small pilot project. Doctors, nurses, social workers, care managers, counselors. So we have a group of them. We want to find out something is like not certain job can only done by certain professional staff. Whether emotional support can only done by counselor or social worker, whether a nurse can do that also, doctor can do that also. Is it like resource, like how to engage and access to resources, refer for training, refer for whatever kind of things? Is it can only done by care manager or social worker? Maybe counselor can do that as well. So we try to do things which in a more expanded kind of role for any of the elder care professional in the foundation. And we also conduct some focus group discussion to understand the difficulties and what need to equip them so that our staff can feel I can do this. And also understand from caregivers, from their experience, the caregivers we work with, what could be some of the difficulties and some wish they may have so that they can have a more positive kind of journey. So through those, actually, we start to develop something, and we realize there's a lot of things need to be done. The first thing is mindset changing. We need to think differently how to work with caregivers. For the longest time, and I don't know, maybe for other community partners when we work with caregivers, how you pick up so-called risk. I think the famous Zeri burden scale, right? It's, okay, look at the score. How is the score? Okay, this is, okay, at risk. We need to pay attention to this caregiver. We always look at problem. We always look at, oh, this caregiver cannot already. It reached the limit to burn out already. Oh, we need to pay attention to this caregiver. Can we do it more like in an early stage? Can we engage them earlier? Even when they tell you, looks, I can cope now, but how about their well-being? How about their own issues in life? How about their preparing for future challenges? We need to start early to engage them. And usually when you feel you reach out to a caregiver at the crisis mode, very difficult to introduce anything because they are basically is like so overwhelmed. So if we engage them early enough, we build a rapport, build a relationship, we will have better chance to support them when they want to open up and look for help. So that is something very important. Another mindset change need to be is like we need to see our caregivers. We are not just providing them for solutions. Caregiving is not just about getting tasks done. It's a journey. It's an experience we want to create together with them. Can we be more empowering? Can we really help them to see this journey, what you want to do? What's your preference? What's your loved one's preference? How we can figure out this way? And how we can coach them on something they are not familiar, try something different. That is an important concept. Rather than you have a problem, I come and fix for you. Then forever, you will find they will become like more and more, I don't know how to manage. And another mindset change need to be, we need to shift from service providers role to we are care partners. Even for our caregivers, they need to see their role with their loved ones. We are care partners. So a lot of times we want to shift the concept that you are care recipient, I'm a care provider. I am responsible for your life. There is a huge responsibility. But a lot of times, whether our loved ones also have their own way, their wish, and how they want their things to be arranged and coordinated. Can we do it in a partnership? So, caregiver also see, I can do certain things. And some of things is beyond my control. It's not I can manage. Can I accept this? And also, when I open up to allow more other partners coming in this journey with me, whether it's a service provider, whether it's a neighbor or friends or anyone, whether we can work together. That is a very important concept because so many caregivers always work in silo. They believe they are the best person. They know the needs of the care recipient best. They can do the best job. But this cannot go long because you need other people to come in. So we need to cultivate this care partner idea and concept. And more importantly, our clinical staff also need to learn not working in silo. I'm a nurse. I only do anything related to the medical condition and functions. So you want to talk about emotion things, I go and arrange my counselor or social worker talk to you. And usually the caregiver, you will find it, okay, forget it, no need. Whether we can help them to see, actually I also can do some small little things to provide some kind of help. It's really the expressive social support every staff can start doing. Yeah. So we also come up with a very comprehensive kind of resource list for our colleagues to really understand what could be the resource available, who are other colleagues is doing, what kind of support they are doing. And then some things I can do. If this caregiver just need a listening ear, just need someone to talk to them, I can do this. But if this person really shows something really difficult kind of family relationship, history of the relationship, a lot of like trauma in the past, then I may need to bring some colleagues who are so-called expert in that area. So we have level 1 and level 2 kind of intervention, which level 1 is everybody can do. And level 2, they can bring in resources which some of the colleagues can do better job. We work as team rather than, this is only my job, I can only do this. So we also learn we need to raise the awareness of well-being to caregivers. Because if they don't know their needs, we need to help them to understand what could be the needs. Physically, are they okay? Can they have a good sleep at night? Whether they also suffer some pain or discomfort, physically, are they well? So those are the things we need to help them to understand. And also socially, psychologically, whether our caregivers actually is in good status. So that wellness, well-being screener, we actually adopted from WHO Quality of Life screener. That one is a very long and comprehensive screener. It's 100 over questions. So we try to have a shorter version, limit to like about 10 over questions, but it's a guide for our clinical staff to understand how to assess the well-being of the caregivers. And we also understand we really need to help our caregivers to explore with their motivation and their acceptance. For a long time, actually, caregivers may be doing things just day after another day. Along the way, they may forget or they may disconnect with their motivation. Why I'm doing this? What's the meaning of this caregiving? They just feel like there's a long list of the tasks can never finish. So how can we connect with the motivation and really help them to reflect what I'm doing? Certain things can let go. Certain things more important. Okay, then I can prioritize. And also we need to help them to reflect about their learning and growth. What are the things they are doing? So today when I cook some meal for my mom, I forgot to put in some things. Is it really important? Or rather, we have a good time chit-chatting over the meal. My mom enjoyed that 10 minutes interaction. So those are the important things we need to help them to reflect. So what is our experience and our insight gained so far? I think most of the colleagues in the team, whether they're nurse, social worker, care manager, or counselors, they really like the idea about we need to focus on the soft part of the caregiving, which is expressive social support. Whether it's help them to understand their motivation, acceptance, whether it's the emotional support, whether it's promoting the self-care, whether it's really about the care partner idea, that soft part of the caregiving is something really, some of the colleagues feel like, can I do it? Especially our nurses colleagues. Initially, they will feel, I don't know how to open the conversation. So we went through some training, we have role play with them, and having that kind of discussion to help them to build the confidence. So that's important when people start trying. And also when we have more partnership with the fellow professional staff, people feel more connected. And we even present this well-being so-called observation of the caregiver in our interdisciplinary discussion team. When we present the case, we don't just talk about the client, the older person. We also talk about the caregiver. For the longest time, they are the by the way. When you are able to do your things well, okay, then let's focus on the client. But even when they're doing well, can we also focus what could be the area of the needs we need to pay attention? So that is something important in our way of working with all the different teams. And the assessment of the well-being, that is serve a guide for our colleagues to really learn to understand and also learn to help the caregiver to understand what are some of the things I need to pay attention. I need to have this kind of self-care. Resource limitation, that is the feedback given by a lot of colleagues, especially when they are doing care management, social work. They have long list things to fulfill, right? So usually they will tell you, I have so many assessment tools I need to go through. So now adding on one more tool, is it too much? And also I have my KPI, I have my caseload. So if I spend extra time working with this caregiver, this is not counted. This is not so-called the work I'm supposed to do, right? So how can I find extra time to do this kind of work? So these are the challenges or issues they're facing. And also not easy to engage the family caregiver to talk about their family relationship issue, because it's whether it's something they feel not nice to share with someone outside of the family, or whether sometimes it's just about the safety, or whether they are not prepared. So we need to start early to engage them rather than wait for in the surviving mode, then we talk about this. And the last one is really about more what needs to be done at the community level at early stage. Because as service provider, when client or caregiver refer to us, usually they are in some issue already. They're having some difficulty or not able to function well. So whether that is a good time we are able to engage the caregiver, or shall we do something earlier at the community level, try to promote and help people to understand what is caregiving, what I need to prepare myself. So some of the work need to be done earlier, right? So I think the experiment, it just started about 3 months. There's still about another 7 and 8 months to go. We are about to collect more insight and experience, and we hope to share more actually when we have all the things actually collected. Yeah. So then I think we hope to value add to our community partner is like, is there a good opportunity for advocacy for policymakers, funding bodies? What need to be included? So the funding is not just about serve a client. Can the funding include serve a family, including the caregiver, even when it looks like okay at this moment? Yeah. And also a comprehensive model of working with family caregivers. How can we, by this experiment, we learn some of the things and we can share with more of the colleagues in community? Can we do this together so that we can provide this expressive social support in our daily work? And also, I think we need to build this inclusive community for our caregivers. That is so important because it's never just a service provider's role. It's never just a policymaker's role. It's every one of us. It's our role, how we can work together. So this brings to the end of the presentation is like, yeah, positive and rewarding caregiving experience is possible, I think. As long as we look at this, not just doing the task, but can we also build this experience and journey together, make it meaningful and positive. Thank you.
Thank you, Wang Jing, for the excellent reminder that caregiving is actually good karma. It's very meaningful. And that's why many of us are still doing it. But of course, we understand there are two sides to it, and we have to be really balanced about it. And what I like particularly from your sharing is that the reminder that all of us, whether you're doctors, nurses, we need to really have to tune ourselves to be more caregiver sort of friendly, and the reminder that perhaps it takes more resources. And you're right that for a long time I understand, but I think it's a bit better now that social workers are not quite funded for most health services programs. So the question I have for you is, well, you have been a counselor for so many years. If you were to encounter a caregiver who is burnt out, who is like take a long time to do certain things and is not having enough sleep, a lot of symptoms, and is still doing caregiving, what would you advise? How do you work with a caregiver like that?
I think most importantly for that situation, we usually need to focus on the caregiver themselves rather than the caregiving responsibility, because they are so much involved in that role. Actually, they forgot about their own needs. So the first thing we want to help them to shift their attention back to their own self.
How do you do that?
Basically, usually we will go into them and really help them to see actually whether this caregiving role is something actually they enmesh their identity, their self with this role. Can they separate this first? So they need to take a role in a little bit more distant kind of way rather than so much involved and they forget about their self. So usually we need to help them to see like, so who are you?
I find that very enlightening. But are there any tricks of the trade or things that you like? How do you get a person to suddenly focus on themselves? What are your methods?
Yeah. So first thing, actually, when we go in, a lot of times the engagement is very much at the feeling level.
Yep.
Because usually they come in with a bunch of the negative feelings, whether it's disappointment, frustration, sadness, a lot of things there. So the first thing, we need to help them to settle down with the feelings. Because when they are involved so much about all those feelings feel overwhelming, very difficult to talk about their role, their whatever. So we need to address and help them settle down. And also one thing important is they need to learn how to relax. A lot of them don't, all of the anxiety or all those kind of like long list of the things they're supposed to do, the first thing they need to learn is how to be more relaxed.
Yeah, otherwise they're bringing tea to you and then they're going to wipe a table while you're waiting for them to sit down and talk to you. Thank you. Yeah. The other thing I'm also very curious, how did you train or orientate the doctors, nurses, and those traditionally who are not really the the counseling material kind of stuff. How do you work with them?
I think it's really engagement as a human being. Because I think doctor or nurse is our role, right? Whether you take this role, definitely you have your goal, you have your job need to be done, right? But also we want to engage them and start with, we have a planning session with all the clinical staff, including doctor and nurses. So the first thing we ask them actually about their own caregiving journey, whether there's a wonderful caregiving experience they have, whether they receive the care or they provide the care. Is there something personal they can share? And that start the ball rolling, because then they start to connect with their own experience and their own insight and wisdom. Yeah, otherwise they are stuck in their role and I must do this, I must do that. So actually when we have the planning session together with all the clinical staff, that is really the very good starting point. And they start to understand, this is something I want to have, and I also want to maybe help my caregivers I work with to have that kind of good experience.
Yeah, and then that will lead to the point about resource limitation. If you were to support the caregivers, and then you're only funded to support the care recipient,
yes.
And how? So, but that was, I think many of us in the community sector have this insight. And recently I just realized that many of us, we use CREST, CG, as a way to tap into the official resources. But then again, there's social workers, I think it's not, there's no direct funding when you're providing social work support for, like for example, home nursing patients. So with that, we're actually just about on time. Let me look for any. Actually, maybe we shouldn't eat into the tea break. But thank you so much, Wang Jing, for the excellent sharing.
Thank you, Rachel. Thank you all.
Thank you.
Thank you. Thank you very much. Thank you very much to our speakers for the insightful presentations facilitated by Dr. Ng. With that, I would like to invite Mr. Mok Pek K, board member of HNF, up on stage again to present tokens of appreciations to the speakers. May we also invite Dr. Rahul and Mr. Ng up on stage. Maybe Ms Wang. Thank you very much. Dr. Rahul, please. And of course, Mr. Ng. I think it's a good time to take a group picture. I see Dr. Tiong is back. Let her catch her breath. Come on up. Thank you. Yes, big smiles, please. Thank you. Thank you very much. We will now be taking a 25 minutes break. For those who are here at Suntec with us, we have prepared some snacks and refreshments in rooms 334 to 336. There are also exhibition booths there where you can connect with various organizations to inquire more about their caregiving-related services. For those online, We have virtual exhibition booths, so you might want to take this opportunity to check them out. So we will see you all back here for our first panel discussion at 11:10. See you soon. Take care. Thank you. And a gentle reminder to all our guests to have your wristbands on when you're making your way to the reception area, please. Thank you.
最让我开心的就是他能够这样的笑容，看不出身体有什么病痛，希望他能够健健康康最好的。
Founded in 1976, Home Nursing Foundation is one of the largest and most established home healthcare providers in Singapore. While we started out Our suite of home healthcare services include home nursing services, where our nurses provide nasogastric tube changes, urinary catheter changes, medication management, caregiver training and support.
我叫蔡彩凤，70岁了。2010年我确诊了癌症，2018年癌症复发，我还要照顾我孩子蔡玉贤，今年32岁了。1岁多，因为发了高烧，所以伤到了脑跟语言神经，所以他现在不能说话，右手左脚不顺利，因为他不能够正常的吃固体食物，只能够通过鼻管来摄取营养牛奶。教育基金每个月来换 feeding tube， 提供免费的 feeding tube， 来换这个 feeding tube 的时候也没有收费。我可以省了一点那个金钱了，而且我不用担心去找护士来换这个 feeding tube 了。那我们这3年这样了，接受家护基金的服务了。
Our doctors provide home medical care such as regular health reviews and prescription of medications. We also provide home rehabilitation services such as physiotherapy, occupational therapy, and speech therapy. Home personal care services assist patients with daily self-care activities like toileting as well as basic housekeeping, medication reminders, and maintenance exercises. Our social workers address the psychosocial needs by providing counseling, care coordination, advanced care planning, application of grants, nursing homes, respite care, and emotional support for patients and their caregivers. At our wellness centres, we offer daycare services to help lessen the load of family members or caregivers who are unable to care for their loved ones during the day due to work commitments. Our professional care team, which includes physiotherapists, occupational therapists, and nurses, come together to design the most personalised activities that are suited for our seniors' needs and interests. A range of centre-based nursing services that include tube changes, medication management, wound management, and chronic disease monitoring are also available for seniors who require them.
My name is Hamza, 69 years old. At the moment, I'm at the rehab center and daycare because I'm one of the stroke victims. I at the moment doing therapy. Actually, I don't know about this place. That time my wife admitted to this place. She got Parkinson because she cannot talk properly. And my daughter was with me coming here. So after some time, I told my daughter, okay, I think I can give a try coming here. Last year, July, until now, I got a very good therapist here with me. When I come here first, I can't even walk properly. I have to use the wheelchair. Until now, I can walk properly. I'm getting the momentum again. So I really thank her very much. The people here, they are very, very friendly and very experienced. They know what they're doing. They know what they want to give you. I really enjoy it.
We recognize that many family members are thrusted into the role of a caregiver unexpectedly. Our caregiver training and support program aims to equip them with skills and techniques to better care for their loved ones and for them to understand the resources available in the community. Our desire is to empower our patients to live with joy despite the circumstances and challenges that they may face. We want to be here for our patients and clients who need us today and for those who will need us tomorrow. We will become a hub for home healthcare services, a go-to pillar of support for caregivers and patients to assess the comprehensive services that we provide. We hope that you will join us as our community of supporters, donors, volunteers and partners to help our patients and caregivers walk this journey with joy.
Hi, I'm Lawrence Low.
Hi, my name is Wei Ping.
I'm Wendy Lee.
Hi, I'm Asher Ang. I'm 17 years old this year, and I'm a volunteer at Wellness at Hokang.
I've been doing volunteer since almost 10 years.
I'm 56 years old. I've been doing volunteer job for a few years.
With Home Nursing Foundation, I started volunteering about 6 years ago. I've always been volunteering since school days when they organize volunteering activities, and I just maintained it throughout my life.
Usually we will accompany the senior, have activity with them and home visit them. It actually motivates me to be more strong and more active so that I can have more years to assist them. I feel happy when I'm with them, when I see they smile or I see they have more energy to interact with me, and that makes me feel that it's a great job that we can make senior more active and more happy.
So I've been volunteering for about a year now. So that was during my school holidays, and we came down for about 1 to 2 weeks. And we continued doing that every school holiday, whenever we can and when COVID restrictions allow. Some of the best life stories I hear are from the seniors here, and I think that it's very good for us to come down and have this intergenerational bonding. And I think that my friends also have feedback to me that they learn about how to socialize better with their own grandparents through coming here to volunteer.
So far, I find that I'm working very well with those seniors, especially at my age group. I find that I'm able to communicate well with them. I will collect the hamper from the home nursing. I will distribute to individual patient. While distributing, normally I will say hello to the patient, concern our patient and asking them, how are you? I think after they receiving the hamper, majority of patients are very happy and they will keep on thanks you.
Many of the recipients I visit, they are going through difficult situations in life, but they put on a smile. You see the love in their family, you see the hard work, the dedication, and it is very inspiring.
To me, volunteering is giving your time and effort where you can to help improve other people's lives.
I believe good quality volunteers, you must have the patience and the heart to share and to contribute.
最要有的就是慈悲心，因为你有慈悲心的人，你就愿意去付出，no complaint。
Three. Hey, three. Hey, three. Hey, three. Hey. Louder. Hey. Okay. Hey. Hey. 4. Hey. Check. Hey. Mic 4. This is mic 4. Channel 4. Mic 4. Hey. Hey. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hey. You want louder? Okay. Hey, mic 5. Hey. Mic 5. Hey. Mic 6. Hey. Mic 6. 6. Hey. Mic 6. Hey. Mic 7. Hey. 7. Hey. 7. 7. Hey. 8. Mic 8. Hey. Check mic 8. Hey.
Be one
最让我开心的就是他能够这样的笑容，看不出身体有什么病痛，希望他能够健健康康最好了。
Founded in 1976, Home Nursing Foundation is one of the largest and most established home healthcare providers in Singapore. While we started out solely providing home healthcare services, we now have started 2 daycare centers in Hougang and Buangkok to help look after seniors in the daytime when their family members are busy with work commitments. We also provide caregiver training at these centers. Our suite of home healthcare services include home nursing services, where our nurses provide nasogastric tube changes, urinary catheter changes, medication management, caregiver training and support.
我叫蔡彩凤，70岁了。2010年我确诊了癌症，2018年癌症复发，我还要照顾我孩子蔡玉贤，今年32岁了。1岁多，因为发了高烧，所以伤到了脑跟语言神经，所以他现在不能说话，右手左脚不顺利，因为他不能够正常的吃固体食物，只能够通过鼻管来摄取营养牛奶。教育基金每个月来换 feeding tube， 提供免费的 feeding tube， 来换这个 feeding tube 的时候也没有收费。我可以省了一点那个金钱了，而且我不用担心去找护士来换这个 feeding tube 了。那我们这3年这样了，接受家护基金的服务了。
Our doctors provide home medical care such as regular health reviews and prescription of medications. We also provide home rehabilitation services such as physiotherapy, occupational therapy, and speech therapy. Home personal care services assist patients with daily self-care activities like toileting as well as basic housekeeping, medication reminders, and maintenance exercises. Our social workers address the psychosocial needs by providing counseling, care coordination, advanced care planning, application of grants, nursing homes, respite care, and emotional support for patients and their caregivers. At our wellness centers, we offer daycare services to help lessen the load of family members or caregivers who are unable to care for their loved ones during the day due to work commitments. Our professional care team, which includes physiotherapists, occupational therapists, and nurses, come together to design the most personalized activities that are suited for our seniors' needs and interests. A range of center-based nursing services that include tube changes, medication management, wound management, and chronic disease monitoring are also available for seniors who require them.
My name is Mahzam, 69 years old. At the moment, I'm at the rehab center in daycare because I'm one of the stroke victims. I at the moment doing therapy. Actually, I don't know about this place. That time my wife admitted to this place. She got Parkinson because she cannot talk properly. And my daughter was with me coming here. So after some time, I told my daughter, okay, I think I can give a try coming here. Last year, July, until now, I got a very good therapist here with me. When I come here first, I can't even walk properly. I have to use the wheelchair. Until now, I can walk properly. I'm getting the momentum again. So I really thank her very much. The people here, they are very, very friendly and very experienced. They know what they're doing. They know what they want to give you. I really enjoy it.
We recognize that many family members are thrusted into the role of a caregiver unexpectedly. Our caregiver training and support program aims to equip them with skills and techniques to better care for their loved ones and for them to understand the resources available in the community. Our desire is to empower our patients to live with joy despite the circumstances and challenges that they may face. We want to be here for our patients and clients who need us today and for those who will need us tomorrow. We will become a hub for home healthcare services, a go-to pillar of support for caregivers and patients to assess the comprehensive services that we provide. We hope that you will join us as our community of supporters, donors, volunteers, and partners to help our patients and caregivers walk this journey with joy.
Hi, I'm Lawrence Low.
Hi, my name is Wei Ping.
I'm Wendy Lee.
Hi, I'm Asher Ang. I'm 17 years old this year. and I'm a volunteer at Wellness at Hougang.
I've been doing volunteer since almost 10 years.
I'm 56 years old. I've been doing volunteer job for a few years.
With Home Nursing Foundation, I started volunteering about 6 years ago. I've always been volunteering since school days when they organize volunteering activities, and I just maintained it throughout my life.
Usually we will accompany the senior, have activity with them and home visit them. It actually motivates me to be more strong and more active so that I can have more years to assist them. I feel happy when I'm with them, when I see they smile or I see they have more energy to interact with me, and that makes me feel that it's a great job that we can make senior more active and more happy.
So I've been volunteering for about a year now. So that was during my school holidays, and we came down for about like 1 to 2 weeks. And we continued doing that every school holiday, whenever we can and when COVID restrictions allow. Some of the best life stories I hear are from the seniors here. And I think that it's very good for us to come down and have this intergenerational bonding. And I think that my friends also have feedback to me that they learn about how to socialize better with their own grandparents through coming here to volunteer.
So far, I find that I'm working very well with those seniors, especially at my age group. I find that I'm able to communicate well with them. I will collect the hamper from the home nursing. I will distribute to individual patient. While distributing, normally I will say hello to the patient, concern our patient and asking them, how are you? I think after they receiving the hamper, majority of patients are very happy and they will keep on thanks you.
Many of the recipients I visit, they are going through difficult situations in life, but they put on a smile. You see the love in their family, you see the hard work, the dedication, and it is very inspiring.
To me, volunteering is giving your time and effort where you can to help improve other people's lives.
I believe good quality volunteers, you must have the patience and the heart to share and to contribute.
最要有的就是慈悲心，因为你有慈悲心的人，你就愿意去付出，no complaint.
Hello everyone, hope you had a good break. For those still streaming in, please take your seats. For our first panel discussion on my journey as a caregiver, let's welcome our panel moderator, Dr. Ng Y Chong, Medical Director of HNF, and our 5 panelists on stage. I'll introduce you. Our 5 panelists consist of Mr. Samuel Ng, CEO of Montfort Care. Ms. Mohini Tarapali, nurse trainer at Active Global Home and Community Care. Thank you. You may come up on stage, please. Dr. Wilson Chong, who's a caregiver and a home medical doctor with HNF. Mr. Chiang Yo-po, caregiver to his wife. Thank you, Mr. Chiang. Miss Doreen Koh, who was a caregiver to her late mother. As you can tell, the backgrounds and experiences of our panelists are very diverse. We wait for Mr. Samuel Ng to join us shortly, but in the meantime, if Dr. Ng is ready, maybe you can introduce today's panel discussion. Thank you, Dr. Ng.
Thank you, everyone, and thanks for coming back after the delicious tea break, which I didn't get a chance to taste. I was just looking for coffee and meeting people and saying hi. And so, as you can tell, the way we designed the panel, we want perspectives from caregivers, and you can see the various diverse background here. And then Samuel, who was one of the keynote speakers earlier, he's a social worker by training and the CEO, director of a, here he is, of a social service agency. And then we have Doreen, who used to be a caregiver caring for her mom until she passed away. So just now the speaker, Rahul, talked about caregiving, the life of caregivers after the caregiving period, the grief period. So this is a caregiver that perhaps she can share with us some insights. Wilson is my good friend, a senior consultant in hospitals and a very experienced doctor, and recently having to go through caregiving journey. So it will also be very interesting to hear his insights on caregiving, as a doctor and then as a family member. Mohini is very interesting life history too. She's a nurse trainer, but she's a trained nurse in India, but when she came to Singapore, she was hired as under the scheme of foreign domestic worker. So she had many years' experience working as a migrant worker in a family lived in. I feel it's very important for us to have a perspective of the perspective of a person who is hired as a lived-in caregiver. And of course, Mr. Chiang, caring for his spouse with dementia. And we will also like to hear perspective from an aging caregiver. But to blast off the discussion, I'd like to hear from your response to the earlier presentation from Dr. Rahul Malhotra and Wang Jing and Samuel, What is your immediate reaction to that? Does it sort of talk to you? Maybe, maybe Dr. Mohini, any thoughts from the presentation earlier?
Hello. Good morning, everyone. Actually, the statistics, Dr. Rahul Malhotra and then a few of the speakers that they have shared, is quite interesting as we see the demand for the caregiving as a primary or as being a loved ones or from a different perspective as a second caregiver. The demand for caregiving is quite high, and it needs a lot of dedication and also your commitment when you are saying that you are ready to be a caregiver, that the dedication and commitment plays a lot to take care of the loved one or yourself, to manage yourself in your burnout and stress management, a lot of things that compile together. Yep. Thank you.
Mohini. Anyone else would like to comment? Mr. Chiang, Wang Jing mentioned about self-care. So, as a person who is, caring for your wife, and so how do you take care of yourself?
Hello, everybody. Good morning. First thing, we have to take care of ourselves by be healthy, physically and emotionally. The most important is she will stretch me mentally. That means sometimes you will feel you have to go out and de-stress, so-called de-stress. You stretch your mind, so you have to find some way to maybe listen to music or maybe play games. But as to the physical part, I have no issue. I don't take care of my physical health. I'm adopting a Mediterranean diet. So this one will help me, provide me a lot minerals, vitamin, and all those carbo, whatever you want for your body needs. So in these two ways, I will keep myself healthy, mentally and physically, so that I can provide her with the care that she needs whenever she go out. Because she cannot leave the house without me. She will lose her way. We discover her forgetfulness when we noticed she lost her way in the supermarket from the restaurant to the lady toilet. She's not able to come back to the restaurant. So we noticed from that. And then from then onward, we will send her to seek treatment. And now she's under medication for forgetfulness. So, so that's my advice, that you have to keep yourself as caregiver, take care of yourself. Most importantly is your bodily health. Eat healthily. Yep. Make sure you don't have all the san gao.
Thank you, Mr. Chiang. So actually, why we designed this panel is that in the room there are many notice that they have their health needs. Do they go for health screening? Do they take care of that? So fortunately, Mr. Chiang, you can tell he knows how to take care of his own health. But I'd like to hear from Doreen next. So during your journey as caregiver, what did the service provider, I mean this case was HNF, what did they do that you feel were useful, beneficial, and important to a caregiver like yourself?
Good afternoon, everyone. What Home Nursing Foundation has done for my family, which I think is very useful, is they're not only there for my mom when she's in it, but she does care for the family members. And in fact, she gives us quite a lot of homework. We need to jot down notes, and very often, we discuss with her things that we don't know how. And at times when they are not with us due to office hour, they will get back to us ASAP, and they will show us probably even video. Like, started off, I don't understand. I don't even know why it's a catheter, urine catheter. And then Nurse Priscilla actually guide me along and show me video. And many other more things that along the way she cared for the well-being of the family members. In fact, she even talked to our helper at home. We have one helper. So a lot of times she gives us a lot of encouragement. Yeah, and I'm very thankful. My whole family very thankful for Home Nursing Foundation help. Yeah.
Thank you, Doreen. And Priscilla is our APN here, sitting in front. So you can tell that, what was really appreciated was the nurse not just looking after the person who is on the bed, but also the family, and addressing and even sort of educating and training the domestic workers and giving them homework. So sometimes as a doctor, we don't know whether giving homework means anything, but giving them something to do, it seems to be really important. So the next person I really like to ask is Mohini. So as I mentioned briefly just now, Mohini used to work as a stay-in caregiver. So from your experience, from a perspective of stay-in caregiver, what kind of thing that service providers like a visiting nurse or a doctor do that can support someone working as a live-in caregiver?
Well,
what kind of thing will hurt a live-in caregiver?
Well, first of all, for a foreign worker to be a stay-in caregiver and take care of the family, take care of the patient as their own family, it actually had a lot of cultural difference that we make. And to get a understanding, and also for the family to accept you as a caregiver and encourage you to do the proper care for the patient makes a lot of difference. Well, Professor, me as having a professional background, I made a lot of difference in terms of the care towards my patients that I have taken care. And I was one of the pioneer caregiver of Active Global Company when I started my journey as a caregiver in this little dot. And at the time, I had a few experiences with the doctors and nurses. We have a home medical team from TTSH that always comes to visit the patient. She's a very little young lady of 22 years. Had a brain tumor. She has to go multiple operations. And where the doctors and the nurses has said that she'll have a very little lifespan, which is just 2 months. Me, with a professional background, to work for this little young lady has actually made a lot of difference in the care. With the knowledge that I had, it was very easy for me to communicate with the team of doctors and the nurses that have come, because she was on ventilator, she's on tracheostomy, and a tube feeding, and also she's assisted with the cough, as just mentioned. To me, I had an exposure in the emergency department, so dealing with the ventilator was not a challenge for me, but the cough assist machine, the standards that Singapore has, is quite something new for me. So I was not scared to approach the team of doctors and the nurses at that point of time to improvise the care for my patient. She had a postural hypertension, and we can't make her sit for a very quite long time. This is something that I noticed, and I asked the doctors and the nurses. So they have given me some ideas, like how to improvise that postural hypertension, which I implemented, and I have seen the difference when they came and told that your daughter is in the good hands of a caregiver. That actually gave me the proudest moment, because if I'm scared and feared to ask the question, I think I would have not made a difference in the care of my patient at all. Not just that, because she can't react, and they also said that her emotions can't be noticed, but your touch and your words make the difference in the care of the patient's life. Whether you are a family caregiver or caregivers like us, we are coming from a foreign background, with the professional background, there are also caregivers with non-professional background. But the minute the employers or the families, the trust that you will have on your caregivers or domestic workers, that will make a difference in the care of your family members. Thank you.
Thank you so much. I find that very enlightening. There are many learning points here. When a foreigner comes into a house, it must be quite difficult. Must be a shock. There's cultural shock. And yet suddenly you're thrust into doing something so technical like that. Unfortunately, Mohini was a trained professional. What if a person is not? And also what I heard was that actually it took a lot of courage to ask questions. And you need to be confident. And in a way, if we were to the way we talk to a person stay in caregivers is really important for them to build the confidence. And when they're confident, they really do a great job. And you can hear from Mohini, the doctors really appreciated her expertise. Now I'd like to turn to the doctor on the panel. Apart from myself, is Wilson. Wilson has been my mentor in the army. And he's also a very senior physician in the hospital system. You can see he's full of white hair. And so he was an emergency physician, task-oriented, saving lives. But a few years ago, he had to become a caregiver. So I'd like to hear his journey and also his learning, his insights, like as a doctor, former caregiver, and then becoming informal caregiver. What was it like for him? What was his learning?
Hello? Can you all hear me? Yeah.
Yes.
Let me explain my journey. It's a little bit more not so direct. First, my father has vascular dementia and subsequently bedridden. Then my sister then was the main caregiver. I'm the part-time one. That means whenever there's medical problem, I'll go in. Then my father passed away. Unfortunately, the sister who looked after my father found out to have cancer of the gallbladder. As you all know, that medically statistic is like 1.4% or something like that. But when you have it, it's 100%. So my sister went through 1.5 years, failed 4 chemo. She moved to my house to stay so that I can continue to look after her. So initially she's quite well, but to the later part, then you just go down by the day. Then before she passed away, which is last year, June 2022, 3 months before, then my niece, who just completed her university, met a car accident and she died on the spot. Sorry. It's okay, it's okay. So actually, my sister died. My sister is still alert. My niece died before her. So it's a journey. Okay, so coming back to caregiver, first is that I think I know everything because of my occupation and my work. Then my siblings, my family member, they think that I know everything. Okay, so it makes it a little bit more complex here now because from one person, it become a mass hysteria, so everybody start to believe that. But actually, I realized subsequently I do not know everything. And then if I do know everything, it does not make the difference. Okay? How many people see, this one I always tell my patient, how many people see doctor live to 120-year-old, still go on a jogging every 3 days? Can I see show of hands? So if doctor know everything, by right we should live to 120 years old, right? I mean, most of us. Or nurses, right? But we don't, okay? We still go through the process. So the challenge is that actually we do not know everything, but knowing everything may not be essential at most point. And this knowing thing involves not only you and the patient, and plus everybody around you, the expectation is different. Okay? So that's the challenge first. Mm-hmm. Then after that, the challenge is that how do we deal with it on a daily basis? Yeah, so that's the main thing that I learned.
Excellent question. Actually, how do we deal with it every day? That is a very important insight. So it's a journey. It's not about transaction that I come and give you a pill and everything seems to be resolved. And I mean, this was a theme from this morning as well. Yeah, anyway.
So what I've agreed with all the speakers, I've been through all the stages, and even after their death, I still trying to recover. When I look at patient, and we still need the coping mechanism up to today. And I tell you that I see more death than maybe all of you add together in this room.
Yeah.
Okay, so because I've been in practice for 32 years, and I see all kind of death. If you're interested, you come and look for me. I'll tell you what kind of death I've seen. Not even newspaper, okay? So I've seen all this. But when it happened to you as a caregiver, the whole story changed. And after that, besides the material or functional or instrumental kind of help, there's an emotional part of it that is very difficult to reach, especially in someone who like this, who looks strong, who is invincible. Weakness is not in my name, neither is in my look, and wisdom is on my hair type of personality, So it's very difficult, and we might not realize it, okay? Yeah.
Thank you, Wilson. I was reminded that he's such a funny person, and when you were coming here, there's another conference there, Trauma and A&E. He's supposed to be the speaker there. So it's really quite interesting. So from one professional caregiver
wrong conference.
to another one, and that's Samuel. I leave him to the last because he's not feeling so well, but he was a keynote speaker just now. So anyway, Samuel, for you, you're in a similar situation, not a doctor, but you've always been a social work professional. And you shared a bit of your journey just now, but I'd like to hear from you again. I mean, hearing the panel discussion and also your own experience, being a super social worker and then become a caregiver, what was the journey and what was the learning?
Actually, when I've been hearing all the different sharing, one thing that came to my mind is this thing about sharing our experiences. I find that a lot of people, number one, most of us, we are not prepared for this journey of caregiving. You are just like plugged into it. Many of us don't even realize that, you are already a caregiver and you're stuck into it. And then, to your horror, you found that, wow, the pressure of the challenges get more and more heavier and all this. Then I realized that, that one thing that does help for me is I'm very thankful that because I'm in social work, so there's this awareness of the more psychosocial dimension. So you need to build a social support network, and at the same time, you need to find a way for you to have the emotional outlet, ventilate, and all this. So I'm very thankful to also my colleagues, because I'm able to, sometimes, our problem is, that's why when I hear from Dr. Chong, I find that, sometimes this part of us, the professional and all this can act as a disadvantage, because even we also tell ourselves that, you're supposed to know, you're supposed to whatever. But actually, when I go into it, you're just as normal as any other people, correct? You still can feel very depressed. You can still kind of struck by, traumatized and all that stuff, So I find that one very important thing is that sharing of experiences, that you get someone who can share, whether it's a counselor, your friend, or whoever. And the other part is that the support network, that, that sometimes you just hear, after at the tea break time, I hear some of the people came up to me and shared their experiences. Wow, more xiong than mine. Sometimes like that, right? Then you say that, you're not alone, don't think that, Sometimes, we're all like that, when you're struck into that crisis or whatever. The first thing that comes to mind is, why me, God, why you're so unfair? And then listen to other people, no, then why not you? Because it's like a lot of people are also actually going through it. It's just that, so I'm thinking, maybe there's this, I don't know whether Wai Chong, because you're more experienced than me in terms of this area. Is there a thing as a silent sufferer in this whole caregiving, arena that, those people who come here or even online, you're the more enlightened one, because that's why you can come and all this. But a lot of people, they are just stuck at home with a ki xiao patient or with somebody, and then they just don't know what to do. So what are we going to do with these silent sufferers? For which is, can we build our outreach? And then, something like that.
Actually, that's a very good point, and maybe that's also a good invitation for those of you who are thinking of leaving after lunch to stay behind, because I understand one of the speakers later, actually is Dr. Art, we'll be sharing a lot about how caregiving journey can be very isolating. And there's a lot of social isolation among them, almost like they only come out at night when the seniors are asleep. So I think this is a phenomenon that we would like to explore further. Maybe, those who are not connected, but maybe I can ask Mr. Chiang. So you caring for your wife with dementia, and you mentioned that it's very hard for you to go out and do your own things. So otherwise she may wander off. So how do you connect with your friends and other families? And how are the support experienced by yourself?
Every morning we go down to the anti-aging center with my wife, and we communicate with a lot of members, how, especially where you go, and then just to make sure that she don't think narrowly, and also engage her on activity, like maybe play angklong, play game, just make sure that her mind is alert. Otherwise, you stay at home, the dementia becomes worse.
What about for the caregiver? Is it useful for you?
For me as well, as I said earlier, I do my exercise and take care of my food, healthy food.
Yes.
Because you have to be healthy in order to take care of her.
Any of your friends know about your situation, and do they check in and
Yeah, I share some of information with my center friends, but it's up to them to take it or leave it. That's why I benefit from this Mediterranean diet.
Okay. So in a way, it sounds like for you, the very important part of self-care is actually diet and the physical part of caregiving.
Yeah, so you have to take care of yourself, otherwise your health will not take care of you. You have to take care of your whole health. If you're not well, then your health will not take care of you. Where you want to go is because you're not healthy.
Yes.
You have seen a lot of people in wheelchair because they don't eat healthily. Yep. So we're a burden to himself and others also.
Yes.
So you have to be healthy, so I can bring her anywhere I want to go for travel or that.
So really must take care of our own health.
Yeah, you must take care of our own health.
Thanks.
Otherwise, the health will not take care of you.
Yes.
But who is the you? Your mind.
Yeah. Very interesting philosophy.
Your mind must take care of your
Yes.
body. Because your mind don't take care of your body, then your body will not take care of your mind.
Yeah.
Mind is the one who direct you to go, not your body.
I can see that you have a happy mind, and that's
happy.
really useful.
I'm always thinking positively.
That could be one of the very important ingredients about positive thinking that we may not even uncover if we ask directly. Actually, I still want to explore this concept of this isolation of caregivers. So, Mohini, in your journey, in the first few years as a stay-in caregiver, how did you feel isolated and lonely? And if you do, how did you deal with it? Or if you don't, what protected you from these emotions?
Well, to me, the word just now, Mr. Samuel Ng was mentioning silent sufferer. It actually draw the attention for me. To work in a foreign country and somewhere you are working as a living actually causes a lot of stress and burnout because, like I mentioned earlier, the trust that the families put on you is different. So for me as a caregiver, when I was taking care of my all the patients, I was never felt isolated because my employers, the small little things that they have done, that on my birthday they get a cake and blow the candle and keep me those positive little things that they have contributed has never left me feel isolated or never become a silent sufferer. Not just that, I also went out with my friends, my fellow caregivers. I always share my experiences. That's how we get to know each other, and I was never left isolated. Not only that, I love to sing, and I love to read the books. So these two things that I have implemented in the care of my patients by singing for them, just sing, because all of them love the voice, thankfully. So, and I have a very good voice though. So that actually gave me a better feel that I was never felt stressed out. And I always encourage them by playing cards with them or like singing, reading a Bible. Whatever my patients' interests are there, that I also incorporated in myself, in my journey. So I was never felt stressed out. That's how I manage my stress and burnout.
Yeah, thank you so much, Mohini. Actually, it sounds to me that you also have a very bright spirit in you. And also give me some idea, how can we support living caregivers? Celebrating birthdays, singing, regarding them as part of actually our colleagues. It's just that they are deployed in the person's home. And maybe that's why you didn't feel quite... But actually, it reminds me of what Dr. Rahul shared about expressive social support. Those are expressive social support. And if I do a survey, you won't say that I need to celebrate my birthday. I need the time to sing. But thanks for that. That's very insightful. And I'd like to turn to Wilson again. Because we've been talking about isolation and emotional support. But surely there's also that technical, tangible, expertise required in caregiving. So doctors are experts in health, right? Healthcare, preventive healthcare, whatnot. And we can even give you the references and give you the statistics of stuff. So are doctors good caregivers?
Right, is yes and no. Yes, because medical staff, we can look after small things like change catheter. You know, like my sister, I can give her the IV because she needs antibiotics. Because she's on chemo, then she needs antibiotics, 3 times a day. We can do things like that. But no, because like I've explained to you earlier on, number one is that sometimes we try to look for cure. You know, the famous saying, it is cure sometimes. What they call it, relief occasionally, and then comfort always, right? So we always strive to look at solutions. We like to use our standard to think that it is what it is. You know, this happens with some knowledgeable individual as well, not only doctors, like certain occupation. Like lawyers, okay, sorry. And so, yes and no, because we can look after certain fundamental, which is good. So we save the trouble. For example, like my sister, the tube, she stepped on it and she yanked it out because it drains the fluid. For me, I take the risk. I put it back for her without needing to go to hospital. Okay, so in a way it's good because she doesn't want to go hospital. But no, because we have a certain expectation. We have a certain things that we want to cure. We want to settle. We want to fix it. Okay? And like I said, sometimes there's actually no solution, unfortunately. Then we go into denial. We fight with our own colleague that there is a solution. But actually, it might not be. So yes and no. So it's always a balancing on each individual caregiver. My suggestion is that you find one of your colleagues or friends who you can trust, then leave it to the person professionally. And you come back and become the brother, become the son, become the daughter, or become the husband. Because you can't pay and find a professional husband for your wife, or you can't pay and find a professional son or brother for someone, and the person is truly needs you to be the brother. Okay, so I'm guilty of feeling this part actually. Okay, and the next part is that the family expectation, and this part, because of all the incident, very unfortunately that I also have gone through this difficult, where my sibling blame me that I have not done it, or I have emotional burden, they said. Okay, this is aftermath. After everything has settled, everybody has gone off and passed away, then I'm telling you the truth is that I still have not manned this part, which is very difficult. And isolation in the sense, because suddenly you're being isolated. I mean, for those who whole family doctors, congratulations, because we all can share the burden, or the nurses. But if you're the only person, you're the only nurse, then a lot of stress is in that part.
Yeah, all of us can attest to that. Me too. Everything about my mom is me. But fortunately, I got a good friend who is a healthcare SG GP, and then he's a great doctor. And just, Mom, you're going to see him. I'm your son. I'm not your doctor. Anyway, you don't trust me as your doctor.
So maybe Corinne also can tell us about this viewpoint that is non-medical. I mean, how do you look at us as a medical?
Yeah, maybe as Doreen, how do you look at doctors as caregivers?
Hello. Okay, what he has just shared, I think I agree that a lot of people will give him a lot of stress because they are medical people. And it's so true that he also brought up this point that you must go back to your role as a son, daughter. Yeah. So how do I see doctor? I think it's just a plus point that they have this medical knowledge. Other than that, I really think that we must still be that son or daughter for our parents.
Yeah. Actually, Doreen and Wilson share something similar. They have taken care of somebody who have passed on. So, like to talk about this because Dr. Malhotra also talked about that too. And there was a question about post-caregiving, life after caregiving. So Doreen, you walked through this journey. Maybe you could share how did you adjust to life after your mom has passed away? And if you had foresight beforehand, how would you advise caregivers to plan ahead for life after caregiving?
I'm not prepared to answer this question, actually. No. Okay. Because for my mom case, she faded away slowly. She gave us ample time. Doctor discharged her from NUH saying that probably another few more months. So go back for quality time. So we brought her home. I remember we painted the house and do up a new aircon for her, thinking that she might need it. Don't know how long. And with a good team, anyway, my team is right in front of me. Tete, raise up all your hand. Okay. I have 3 sisters that walk this whole journey together with me. They are all married. I'm single. I put on a lot of stress on myself, thinking that probably I'm single. And I'm more attached to my mom as well. So somehow I give myself a lot of pressure. But throughout, I have the support of my siblings. So although a lot of times I put all the stress on myself, but again, when I look back, I have a great support team behind me, especially with the support again from Home Nursing Foundation. So about because my mom, like I said, my mom faded away slowly, so it didn't come to us as a very sudden kind of thing. And of course, Nurse Priscilla prepped me every time when she do a house visit. She always talk, especially the last few times, she can sense that my mom probably is going away soon. She always talk about this topic. You must be mentally prepared. I think it's any time. So, yeah, I'm prepared somehow. When I say I'm prepared, not really prepared lah, but don't know. But the last 3 breaths that my mom had on bed that day, all of us were around with her. So she's very nice to us in a way. She gave us this time to prepare for her death. Yeah, so even when she was still lying on the bed, we start to talk about her wake. We talk about what we need to do. And the funny thing is that when my mom was still in NUH before discharge, my elder sister actually prepared for her funeral clothing because we don't know when is the last day. We told ourselves that when mom is going to leave that day, we don't want to be kalang kabut. We want everything to be, we want to spend time with her, beside her, to see her away. So all things that can be planned, we plan beforehand. Yeah. So after death, of course, not easy. Yeah. Not easy. Because, like I said, I'm very attached to her. So I like to touch her. So when she's not there anymore, only the memories left. Yeah. But I'm glad I was given enough time to keep hugging her on the bed. So I think if we have the chance, if our parents still around, the people that we care for still around, spend more time with them. And I think all they need is company. Yeah. Just even if they are naughty, they are very demanding, I think it's fine. I mean, how much more time left? Yeah, just spend time with them.
Thanks, Doreen, for the very heartfelt sharing. How do you structure your life now? I mean, what's your routine? I mean, is there... Because I'm just thinking it may be a useful thing to have a routine.
Well, I am a pretty active person before my mom falls sick. So when my mom is ill, suddenly I feel that my life very different. My work, it's definitely affected. I can't focus as much. and a lot of times I got to multitask. Social life come to a halt. Close friends that I always hang out with, suddenly say, "Hey, Doreen, MIA." Yeah, I can't even sleep and eat well. How to go out with friends? Yeah. So I force myself to go out with friends. So when I'm out with my friends, I'm constantly on my phone. Because we do have a family group chat. And when I'm out, the caregiver at home, we monitor our mom very closely. So her meals, her input, her output, anything. So we take measurements, and then of course from there we know that a lot of learning from the nurse and doctor as well, that they taught us, if this happened, maybe there's an underlying issue. So I can quickly prep, even things before mom get a delirium, before it comes, I think it's coming. Or even before mom has constipation, I think that it might be coming. So all this I gain my experience, I gain a lot of experience these 2 years. I don't want it to go to waste as well. So of course I look forward that one of these days I can contribute back to the society as well, my experience as a caregiver. Yeah, and I'm doing fine now. Thank you.
Thank you.
Yeah, social life is back as well.
Okay.
Yeah.
It's excellent. And we have got 4 more minutes, and I would actually like to invite Samuel to wear the hat of a social worker again, you know. And I think I didn't prepare you for this question, but hearing all this, how can social services, community services, support caregiver? I mean, hearing from this morning and now the panel, the insights of caregiving, and you yourself having experience, how can we do better in supporting caregivers?
My very quick comments to what I've heard so far, especially from Doreen sharing. I think it's important that from a counseling point of view, is this thing about giving meaning to the journey, to the caregiving journey that you had. I'm very glad to hear from her, although, I mean, there's still lots of grief and all this, but actually at the end of the day, you are able to actually give a meaning. You know, for example, you said, you know, that you are very thankful that your mom gave you a long, period so that you can hug her, you can spend quality time with her. You also give meaning to the relationship with your siblings, as a family. See, I think all these are very precious things. Sometimes we forgot simple things, as human beings, regardless of whether you're doctors, lawyers, or all this. At the end of the day, it's all these very simple things that are very important. The other thing it came to my mind is this thing about me. I find that a lot of time, as you also shared, when you are locked into the caregiving, like when I have to take care of my mother, one of my seniors came to me and told me, you better be careful because otherwise you will be very isolated. Which is true. I discovered that after that I don't go out with friends. Sometimes it's also no energy and all this or that. So you end up becoming very cocoon kind, and then the part about all the negative things keep coming in. And then the caregiving becomes, rob away a lot of your true, your authentic me identity and the meaning. Because you project all yourself onto that care recipient, whether your father or mother. And therefore, at the end of the day, you find that you're all depleted. Not just energy, but it's your whole self-identity. So in our case management or social worker, I always remind them it is very important when you journey with the caregivers, that you must teach them or counsel them to actually preserve that in different ways. Some people, like for example, singing, and all that stuff, and don't lose yourself because ultimately, you still, everybody at the end of the day, you are still yourself in this life. So I thought, that is important. So in response to that, that social service, I think Singapore, as I said earlier on, we're very good with the structural infrastructure, social infrastructure. We have FSCS, SSO, and all that. Now we have AIC coming in very strongly to provide all the support, which are very essential and important. But I think what I hear also from this morning is the social emotional part. That is difficult. The one we always brush away, say, okay, la family relationship are correct, or expressive
social support.
Social support and all this. But when you dive deep inside it, you find that actually these are all the intangible but very important, little steps that we need to help to actually coordinate and reinforce that kind of infrastructure. So you don't brush aside. A lot of time I feel very sympathetic with social workers, because people always think, social worker 你们就是这样的咯, good heart, then sayang people, or you think sayang people easy, you gotta try. No, it's that part. The society need to recognize that is intangible but very important.
Thank you so much for all your contribution. And I would like to first seek your forgiveness. I did not quite prepare all of you so well, and some of the questions must really come as a shock to some of you. Please forgive me. And my intention is that I'd like to show the inner workings of all of you, so that, because in the room there are many service providers, and we hope that all these will contribute towards better policies, better practices, better researchers, better insights into how do we support other caregivers. And so with that, I'd like to thank all of you for your sharing, your generosity, and your love and kindness. Thank you.
Thank you, panelists. But before we let you go, I'd like to invite Dr. Tiong again to do the honors. Thank you. Okay, first we'd like to have Ms. Mohini Terapali, please. Thank you. Mr. Chiang Yo-po, thank you. Dr. Wilson Chong. Mr. Samuel Ng. And ladies and gentlemen, a big round of applause for Miss Doreen Koh. Thank you. Thank you very much. Let's stay on stage. Maybe we'll take a quick picture before you come off stage. Let's have a nice group picture, please. Thank you everyone. We will now be taking a 1-hour lunch break. For those here with us, please head over to rooms 334 to 336 again for a buffet lunch. And for those online, do check out our virtual exhibition booths, and we'll see you back in an hour for the second half of our program. Do enjoy your lunch and do enjoy your break. Thank you very much.
最让我开心的就是他能够这样的笑容，看不出身体有什么病痛，希望他能够健健康康最好了。
Founded in 1976, Home Nursing Foundation is one of the largest and most established home healthcare providers in Singapore. While we started out solely providing home healthcare services, we now have started 2 daycare centres in Hougang and Buangkok to help look after seniors in the daytime when their family members are busy with work commitments. We also provide caregiver training at these centres. Our suite of home healthcare services include home nursing services, where our nurses provide nasogastric tube changes, urinary catheter changes, medication management, caregiver training and support.
我叫蔡彩凤，70岁了。2010年我确诊了癌症，2018年癌症复发，我还要照顾我孩子蔡玉贤，今年32岁了。1岁多，因为发了高烧，所以伤到了脑跟语言神经，所以他现在不能说话，右手左脚不顺利，因为他不能够正常的吃固体食物，只能够通过鼻管来摄取营养牛奶。教育基金每个月来换 feeding tube， 提供免费的 feeding tube， 来换这个 feeding tube 的时候也没有收费。我可以省了一点那个金钱了，而且我不用担心去找护士来换这个 feeding tube 了。那我们这3年这样了，接受家护基金的服务了。
Our doctors provide home medical care such as regular health reviews and prescription of medications. We also provide home rehabilitation services such as physiotherapy, occupational therapy, and speech therapy. Home personal care services assist patients with daily self-care activities like toileting as well as basic housekeeping, medication reminders, and maintenance exercises. Our social workers address the psychosocial needs by providing counseling, care coordination, advanced care planning, application of grants, nursing homes, respite care, and emotional support for patients and their caregivers. At our wellness centres, we offer daycare services to help lessen the load of family members or caregivers who are unable to care for their loved ones during the day due to work commitments. Our professional care team, which includes physiotherapists, occupational therapists, and nurses, come together to design the most personalized activities that are suited for our seniors' needs and interests. A range of center-based nursing services that include tube changes, medication management, wound management, and chronic disease monitoring are also available for seniors who require them.
My name is Hamza, 69 years old. At the moment, I'm at the rehab center and daycare because I'm one of the stroke victims. I at the moment doing therapy. Actually, I don't know about this place. That time my wife admitted to this place. She got Parkinson because she cannot talk properly. And my daughter was with me coming here. So after some time, I told my daughter, okay, I think I can give a try coming here. Last year, July, until now, I got a very good therapist here with me. When I come here first, I can't even walk properly. I have to use the wheelchair. Until now, I can walk properly. I'm getting the momentum again. So I really thank her very much. The people here, they are very, very friendly and very experienced. They know what they're doing. They know what they want to give you. I really enjoy it.
We recognize that many family members are thrusted into the role of a caregiver unexpectedly. Our caregiver training and support program aims to equip them with skills and techniques to better care for their loved ones and for them to understand the resources available in the community. Our desire is to empower our patients to live with joy despite the circumstances and challenges that they may face. We want to be here for our patients and clients who need us today and for those who will need us tomorrow. We will become a hub for home healthcare services, a go-to pillar of support for caregivers and patients to assess the comprehensive services that we provide. We hope that you will join us as our community of supporters, donors, volunteers and partners to help our patients and caregivers walk this journey with joy.
Hi, I'm Lawrence Low.
Hi, my name is Wei Ping.
I'm Wendy Lee.
Hi, I'm Asher Ang. I'm 17 years old this year, and I'm a volunteer at Wellness at Hougang.
I've been doing volunteer since almost 10 years.
I'm 56 years old. I've been doing volunteer job for a few years.
With Home Nursing Foundation, I started volunteering about 6 years ago. I've always been volunteering since school days when they organize volunteering activities, and I just maintained it throughout my life.
Usually we will accompany the senior, have activity with them and home visit them. It actually motivates me to be more strong and more active so that I can have more years to assist them. I feel happy when I'm with them, when I see they smile or I see they have more energy to interact with me, and that makes me feel that it's a great job that we can make senior more active and more happy.
So I've been volunteering for about a year now. So that was during my school holidays, and we came down for about 1 to 2 weeks. And we continued doing that every school holiday, whenever we can and when COVID restrictions allow. Some of the best life stories I hear are from the seniors here. And I think that it's very good for us to come down and have this intergenerational bonding. And I think that my friends also have feedback to me that they learn about how to socialize better with their own grandparents through coming here to volunteer.
So far, I find that I'm working very well with those seniors, especially at my age group. I find that I'm able to communicate well with them. I will collect the hamper from the home nursing. I will distribute to individual patient. While distributing, normally I will say hello to the patient, consult our patient and asking them, how are you? I think after they receiving the hamper, majority of patients are very happy and they will keep on thanks you.
Many of the recipients I visit, they are going through difficult situations in life, but they put on a smile. You see the love in their family, you see the hard work, the dedication, and it is very inspiring.
To me, volunteering is giving your time and effort where you can to help improve other people's lives.
I believe good quality volunteers, you must have the patience and the heart to share and to contribute.
最要有的就是慈悲心，因为你有慈悲心的人，你就愿意去付出，no complaint.
Welcome back, everyone. I hope you all had a good lunch. Thank you. Only one had good lunch? Everyone had good lunch? All right, much better. Okay, for those who just joined us online, a very warm welcome to HNF's Caregiving Conference 2023, Creating a Sustainable Caregiving Community, a conference for practitioners and caregivers. I am Kamaljit, and I'm your MC for today. Please kindly note that the Q&A session for all the afternoon speakers will take place during our second panel discussion later. During the presentation, you may still scan the QR code that's being shown on the screen to leave your questions on the Q&A platform. The speakers will be answering these questions later. Our next speaker is Mr. Brendan Yong, Head of Social Work at Home Nursing Foundation. A social worker by training, Brendan has more than 10 years of experience in the social healthcare sector. His passion lies in geriatric care, and he has published research papers relating to working with older persons. In his presentation, he will be sharing more about the upcoming Carers Hub that HNF will be launching. Brendan, please. Thank you.
Hello, hi, good afternoon all. Hello, hi. There's so much excitement, so nice to see. I'm sure many of us have benefited greatly from the morning segment, and thank you to those who have stayed back after a good lunch to join us here today to continue to explore this complex subject of caregiving. So today, I'm here to share with you all our latest initiative at HNF in supporting our caregivers, and that is the Carers Hub. I think many of you, if not all of you, would agree with me that caregiving is no easy journey, as many of the speakers have shared. Beyond challenging times, we are also seeing some bright spots. Caregiving and caregivers, they have got something to give back to the community. And that is what my peers and I, in our years of working with caregivers, have observed. And in the name of sustainable caregiving, this is what propelled us to have this idea of building Carers Hub to really pull together caregivers who need support at different time points in the caregiving journey, and also caregivers who have the resources, the motivation, and the capacity to give back to the community. By putting these two groups of people together, we hope to amplify the efforts that some of the caregivers actually wanted to make. In fact, I have spoken to one of the caregivers, Mr. Takala. Mr. Takala, if you're here, could you? Yes, Mr. Takala. He is a caregiver, and he is also a patient receiving care. So he had a bad accident, and he has allowed me to share his stories here today. And this is essentially a patient taking care of another patient. But despite all the challenges that he has faced, he is still a very active volunteer at our voluntary organizations and giving back to the society, helping more caregivers. And that is the spirit that Carers Hub want to achieve. Yeah. So can we give a round of applause for Mr. Takala's spirit and for his contribution. I heard that he was even featured at some Australia's collaterals. So really good work that he has done. And let me just continue to our next. So I just wanted to share another inspiring story of our caregivers, Irene. So she is a caregiver to both her aged parents until her father has passed on, and she is still single-handedly taking care of her elderly mother, who is 99 years old. So, of course, years of caregiving has also taken a toll on her own health, but she has never forget to also contribute back and help other caregivers. So she will make sure she stock-take her own household and caregiving items, used item, but in good working condition, and donate it out to benefit other caregivers. And because of people and the spirit that Irene has, Madam Rokia receives a donated wheelchair that enables her to bring her husband out to the community, a much-needed getaway from their one-room house. So it is these stories that really inspires us to say, hey, there is actually a good group of people and caregivers that has a wealth of resources and experiences wait to be tapped on and has not yet been systematically harnessed. So Carers Hub hopes to do that through the help of many caregivers here who are able and willing to share their experiences. In the early segment, one of the words that keep coming out was expressive social support. Yeah. So we all know care professionals and many practitioners here, we are only available mostly office hours. So at night, when the sun sets, it is the time when many caregivers starts to think about certain things, think about the challenges that they are facing. And it is those times that they also needed the support. And we hope that Carers Hub, being a web portal, will be able to be there for them with many other experienced caregivers chipping in. Knowing their stories sometimes helps us shorten our own caregiving learning curves because they have been through before us. Yeah. So there are many tips and tricks that actually many caregivers have shared with me. And as a social worker, I share with many other caregivers as well. So just now I have mentioned that Carers Hub is really wanting to appeal to the two groups of caregivers. One is to caregivers like Madam Rokia. They needed different supports at different time points of their caregiving journey, and it is there for them to receive the necessary support, be it resources, be it knowledge. And of course, not forgetting many people like Irene also is already helping them in their quiet ways, making quiet impacts to many caregivers. But we thought there is a wealth of resources out there that these caregivers can further be tapped on. So we also want to provide that opportunity and that space for experienced caregivers to come on board with us. So in designing Carers Hub, we went through many iterations with engaging with different levels of stakeholders, from caregivers to social practitioners like many of you here, and also healthcare professionals. And distilling that feedback into features that caregivers themselves think it is useful for them. So in the process, we have gathered many versions of the user interface and what are the features that Carers Hub wants to share and make available to our caregiving community here. So one of it is achieving this phrase we call transforming me to we, placing the individual caregivers into that mini caregiving ecosystem like what we are having here. So no longer is one caregiver being cooped up in their own house, facing the care recipients, trying to think of ways to overcome the different challenges that some of our earlier panel has shared. So by doing that, in order to do that, we have come up with different ways to achieve it. One is through interactive learning that the Carers Hub will seek to empower the users to come on board with. Being able to pose questions and seek advice from the many experienced caregivers who have come before them, not needing them to be like now, to be thinking solutions based on their own single experiences, and that is simply not enough. If there's a wealth of information out there, why not tap on it? The other part is, actually there's a rich collection of caregiving experiences. Just 1 hour of panel sharing, we have heard many different facets of caregiving experiences, and those are useful. I think one of the speakers in the earlier segment had also mentioned, just by sharing, we know that we are not alone, and that itself is already very therapeutic. Many caregivers whom I work with think that the problem is just too big to be overcome. But they may not realize that many before them has already done so. So that knowledge is simply quite empowering on its own. The other part that Carers Hub wants to achieve is also getting experts' insights, inviting experts to come on board this Carers Hub to share the knowledge, to share the resources and insights that they have with many other caregivers and be made available 24/7. And nighttime is the time that really the sandwich generation caregivers have that bandwidth to do something, to learn something that they want to. Morning is just simply too packed. I think some of you are already nodding their heads that, morning you have to do your work, you have to take care of your family, you have to take care of your children, you have to take care of caregiving, and it's just so many things that we need to get ourselves occupied with. Nighttime, let's bring some of this content at the caregiver's convenience to tap on. And lastly, in this Transforming Me to We initiative and objective is to allow caregivers to access recommendations that fellow caregivers have endorsed so that they don't need to scratch their head and think which product is suitable for my parents. There are already caregivers, many caregivers before them who have tried certain products, who have gone to different elder-friendly places, disabled-friendly places that they can bring their loved ones out to, and not always thinking that caregiving is just being at home between you and me. We can afford to have a more empowering caregiving narratives than that. So next objective that we want to achieve is really building bonds. Caregiving can really keep us, on a most daily basis, keep reminding us that we can be very isolated, sometimes even helpless. So one objective of Carers Hub is to build that relational bond and foster the social connection with that mini caregiving ecosystem. How do we do that? We want to build local chapters. We want to build support groups in geographic proximities. Building either a virtual support groups, and we have got facilitators to bring that virtual support group out to become a physical support group to further foster that relational bond, so that in times of needs, at least there are people that has walked through the same journey as you, being able to give you that empathy, that understanding, and support you in tangible ways along your caregiving journeys. I think I may have to go a little bit faster. The clock here is always ticking. So the next one is mental health. If you have gone to the booth area where you had your lunch, you will realize that HNF, we have got a booth there, and we had a mini poll. So mental health is the highest rating there. So it's about 20-25% more. So again, caregiving can can drain us emotionally. So we want to make sure caregivers are well supported. There are mental health materials scattered in the Carers Hub. And importantly, there's a self-assessment tools that we're going to make available. Sometimes caregiving gives us that very vague feeling, very mixed emotions that we cannot pinpoint. When we cannot pinpoint, we cannot act on it. We need to articulate it. And this instrument is a validated instrument used by professionals. It can allow us to systematically identify what are our needs. And when we can identify, we can then work on it. Okay, the next one is interest-based group. In Carers Hub, you can almost form support groups by any numbers of caregiving scenarios you can think of. For example, I want to set up a support. I'm taking care of my parents with dementia. I want to set up support groups by dementia type or by other disease type. I want to set up a support group that can have fellow caregivers who can connect with me in terms of taking care of a bed-bound person, for example. And you'll be surprised to know that there are many caregivers who can give you very effective tips and tricks because they have journeyed through that many years. The other part is Carers Coach. So another one thing that we want to achieve here is there are many experienced caregivers out there who have 10, 15, 20 years of caregiving before you. So they are like the senior, if you think of it as an office workplace, they are the senior director who knows all the caregiving tips and tricks. And they can buddy up with you, who can let you know what are the relevant caregiving schemes, financial schemes available in the market. I think right now what I'm keep on hearing is there is a lack of awareness. What is out there? What can I tap on? I see some of you nodding your heads. Exactly. So this Carers Coach might just have the answer. Okay, let me just go a little bit faster. So marketplace. We intend to build a marketplace to bring donors and receivers together. Currently at HNF, we have a manual process of doing that, and that is just not optimized in terms of meeting that demand. We're going to have an online platform for people who wants to donate and people who wants to receive to come together. And then, again, just now I said that there are many elder-friendly and disabled-friendly places that we can bring our loved ones out to. but where are they that are more receptive to receiving maybe a person with wheelchair? So these are some of the initiatives that we want to promote and encourage to build a more inclusive caregiving community. Okay, the other part, and I think this is the last few parts before I go into our prototype, which is Carers Hub gathers from two main domains of information. One is patient health. Through our offerings in Carers Hub, we also provide telehealth. And the other part is on carers coping, caregivers coping. If you had done your assessment, self-reported assessment in Carers Hub, the system will be able to match these two of domain for a bed-bound person with a very stressful caregivers who needed that respite, who needed some time away from caregiving just to take a breather. Your well-needed rest is important. What can you do? Where can you tap on? The care recommendation report in Carers Hub will be able to provide and to give you something to already start off with, even at night. You can already know where to go to apply for certain services the very next day, when maybe practitioners and care professionals are not available during that time. Let me see what is the... Okay, these are all the good things that we can harness from a web portal like that. But for a project of this nature, of course, there are certain issues that we need to think deeper about before we can unlock the true potential of our Carers Hub. So, one thing is user engagement. If I were to leave all of you here and link up to this system, I think naturally few will come together and congregate together very naturally. So there has to be some ways to engage these caregivers. One way is to really have a very user-friendly design and make sure we have good, relevant content that is of value as seen by the caregivers. Yeah, and bring them together. And of course, just to make learning a bit fun, we have got gamifications throughout the systems to make that learning journey just a little bit more fun to keep us going. The other part, and it's a big part to HNF, is on data privacy and protection. To do all these things, of course, Carers Hub will need to gather some information, and that information has to be protected. So we have harnessed and invested in robust data encryption, secure user authentication, and many other technologies to keep us assured and also in compliance with Singapore laws on data protections. Digital literacy. Now, when we talk about all these things digital, we cannot forget there is this group in our population that may not be onboarded on the digital space yet. So to support them, actually a good part of this group, with some training, they can actually come on board with us. So what we need to do is to build a simple user interface that they can quickly get onboarded. The other part is to keep our in-person service still relevant to them. Those are some strategies that we will be adopting to work with this group of persons. The other part is on scalability. So we want our Carers Hub to benefit a lot more caregivers as far as possible. So right from the planning stage, we already need to think about the infrastructures. How do we then cope with the demand as it grows? So, and many more. So given the time, of course, I'm just stating a few. But in digitalization journey, these are some of the areas that we want to look into. Anything worth building will need us to have that resolve to overcome certain challenges. And these HNF is committed to journey through to help our two groups of caregivers like Madam Rokia and Irene. Okay, so having said so much, what I really want to do is for you to come to us so that we can journey together. For service providers who wish to collaborate with us in supporting caregivers, or even just exchange of views on the digitalization journey, which is also rampant now, talk to us so that we are more than happy to work with you further. For family caregivers who wish to use Carers Hub to embark on your subsequent caregiving journey, we are more than happy to connect with you just by scanning this QR code. Yeah. So next, I will share with you some images of our prototype. So this is how it can look like. Here is the landing page for Carers Hub. You can see some of the main components that caregivers have told us that will be useful to them, which is caregivers training, a library of multimedia content available to them for them to access at their own convenience. And importantly, when they need help, talk to us. And there are also in the e-kiosk, it's too small to see here, but there's an e-kiosk where you can do your own self-assessment, how stressful you are, what are your needs. Going through that structured interview questions will allow us to identify things that may not be so obvious to us. Yeah. So the other part is, okay, this is the caregivers training. So these are our existing modules. Self-care is very important. I'm glad many caregivers here have joined us here today. Mental wellness, community resources, helping caregivers how to navigate this complex web of support services. In fact, this is a good problem because our caregiving resources are so comprehensive in Singapore. To some caregivers, they may find it difficult to navigate, but it is actually a good problem. So in these trainings, we will support the caregivers in navigating some of these. And of course, understanding aging and fall prevention. This is the Caregiving Library landing page. And these are some of the topics that we talk about. How do we cope with mental health issues? I think one panelist was talking about communication between family members. Now that can be very easy for some of you, but for some others, if we come with historical baggages with some of our family members, it can make caregiving harder and not easier. And how do we then manage that communication? It's a subject on its own, and we'll be happy to share more. And of course, there are other... So just to give us a flavor of how many things that we need to learn to become an effective caregiver. So many times, caregiving role is passed to you almost overnight, especially for sudden diseases or accidents. But can you imagine that actually we are not natural caregivers? None of us are natural caregivers. We need to go through so many things, and this is just to give us a flavor of what it takes to be an effective and educated caregiver. Okay, so this is what I've just mentioned. These are some of the topics. Now, the other modules in Carers Hub is the forum. We talk about interactive exchanges. We want to tap on the wealth of knowledge and experience from caregivers. And this is the part that they can come together and co-construct the knowledge base of caregiving. Okay, here you can also see support groups. This is the virtual support groups that we plan to facilitate to move on to physical support groups so that everyone can support everyone to make it more sustainable, to make caregiving sustainable. Okay, then the very important part, this is the support groups landing page. Okay, the very important part is self-assessment. So I have seen caregivers who told me when I asked them to do this self-assessment, they will say, oh, I already know what I need. I think someone was mentioning money. So money is always top of their head, which is natural. Which is natural. But underneath that money, even after you have given them subsidies and financial support, actually there are undercurrents, underlying needs that needs to be met for a smoother caregiving journey. What are those? I will leave you to, explore or talk to a medical social worker or your medical team to explore further what else do we need that we may not be able to articulate enough. I think the next page is the same. It's just a listing of the different assessment forms. Okay, this is the Leilong page, the marketplace where donors and recipients can come together to match them up on what they need and require. Let me see. Okay, this is the events page. Earlier I talked about, okay, how do I go back? Earlier I talked about having experts' views. So this is the part where we will invite different experts to come on board to share with us different insights. Okay, so that is what we want to achieve with Carers Hub. So for those caregivers and service practitioners, if you are keen, I can't go back anymore. Maybe the time is up, they don't allow me to go back. Okay, this is the QR code. So please scan. We will contact you so that we can all come together. Now, this project will not be a success if we cannot gather the collective strength and wisdom of the caregiving community that we have here. Yeah. With that, I thank you for your attention. Thank you.
Thank you, Mr. Yeung. Thank you very much. Next up, we have Ms. Carol Yong, who is the Senior Assistant Director of the Caregiving and Community Mental Health Division at the Agency for Integrated Care. With over 20 years of experience in the healthcare sector, Carol leads the caregiving team in review of caregiving strategies and facilitates collaboration across agencies and service providers to better support caregivers. She will be sharing more about AIC's hashtag WeSeeYouCare initiative and the resources available to caregivers. Carol, please.
Everyone can hear me? Okay, great. I hope I can keep the energy going. Okay, I understand that after we have this sumptuous lunch. Okay, okay. This one don't need to talk too much. Okay, okay. This is basically the content which I'll be sharing. The key thing that I wanted to share basically is the survey finding that we have, because this will actually help the care professional when you're planning for the service, and of course, what are the AIC initiative that actually helps the community, the caregivers as well. Okay. Basically, we all know there's two kinds of caregiver. We call it informal caregiver, which are like many of the family members. Usually, we are not paid for the service that we care for our loved one. Then the other group are we call that the professional caregiver. Okay. This one is my standard slide that I need to do for my AIC work. Okay, so for AIC, we have come up with these 3 E strategies. We wanted to engage our caregiver, empower them, and also enable them. The middle 5 approach basically are our caregiver support action plan that MWH have developed, and the outcome that we want to achieve, that we want our caregiver to be able to acknowledge their need and able to know where and how to seek help. Then empower, we want our caregiver to have a deeper knowledge so that they know how to pace themselves in this caregiver journey. And last but not least, that we want to have them to have access to the services and the environment to help them with to care for their loved ones. Okay, now I'm going into a bit more of the survey findings. Okay, so what happened is that start from 2021, we did a survey. It's a branding survey. We wanted to understand basically the public perception of caregiver, because we do hear a lot of time from our focus group discussion, a lot of time caregiver are in their role, but they don't see themselves as a caregiver because they see that it is a duty of a daughter or son. Okay, so our survey actually confirmed our finding. Okay. What we find out is that almost more than half, 65% of the caregiver actually do not identify themselves as a caregiver. And we also asked them, what are the 3 words that likely associate with the caregiving as well? So what happened is that mostly attribute to be challenging, stressful, of this kind of attributes. Okay. Then earlier this year, we did another survey. Not a mega survey, the kind, but we did a 300 sample size survey. Basically to find out a few areas for us to understand basically what is the impact of our AIC work on the caregiver. So I'll be sharing later on a few more slides on these 4 different domains. How the caregiver look for the information, How is the utilization of the financial grant, support services, caregiver training, and also self-care. So the first section would be the navigation of the caregiver info and resources. Okay, so first we wanted to know the awareness. Okay, how are generally caregivers are aware of the different financial schemes and the services? What we find out is that 9 out of 10 know at least one caregiver-related financial support schemes. Okay, however, for the caregiver training courses and the caregiver resources, awareness are rather low. Okay. Next, we look into the caregiver information and resources. Okay. So we ask, caregiver, have you ever looked for caregiver information? Okay. So 4 out of 5 told us that yes, we do. Then we dive a little bit more. Then we want to understand, okay, when do they actually look for this caregiver information? Okay. Half of them, 56%, actually said that is when their loved one, the care recipient, are just discharged from hospital, or when their health condition change, then they start to look for information. I mean, this is also another point that always we hear from the caregiver is that I will only look for it when I need it. Otherwise, I may not bother to look for it. So these are some of the survey findings. Actually, we kind of confirm our knowledge as well. Okay, then we wanted to know from the caregiver, do you find it difficult to find the caregiver information? Is that hard? Okay, so not too bad. 3 out of 5 actually still find it quite easy. Okay, but of course, we wanted to understand for the remaining, what is the experience so far? So what happened is that we still find the remaining of them find that they find lack of, for example, they don't know what, okay, and where to search for the information. Okay, so that remains some of the challenge that we have for the caregiver still. Okay, then second section, we look into the utilization of the financial support schemes and the care services. Okay, financial schemes, a lot of people are very concerned about, okay. So what we do find out is that 3 in 4 caregivers are aware of home caregiving grant and also the FDW levy. And these two, you realize that the red color words are basically the awareness. The blue color are the user, which means that out of those that are aware, how many of them actually utilize it. We do see quite good figures actually for the home caregiving grant and the foreign domestic worker levy. However, when you look at the SMF and also the caregiver training grant, the awareness and the utilizations are lower. Next, we look into the support services. Just now you see very good figures, 70 plus, 80 plus, that kind. Then what happens is that you come to support services, the number all drops. Okay. In general, 3 out of 5 are aware that there are caregiver support services. But if you come into individual support services like this, the awareness and utilizations are actually quite low. And what is more significant is that the below are aware of none of these. 39% of caregivers are not aware of any of that support services. Yeah, so I think the awareness remains one of the issue for us. Yeah. Okay. Then we dive a little bit more. We want to understand for the paid respite services, okay, what are the experience from the caregiver from the respite? So we are happy to feel that a lot of caregivers actually find that the respite services are being useful, satisfactory as well, and there are some of the reasons that they cite that indeed give them a break and also actually allow them to have some, to relieve some of the burden, okay. Okay, then the next section I'm sharing with you about the caregiver training. Okay, very colorful chart. I help you all to understand, okay. So basically we ask a caregiver, have you all attended caregiver training since you're a caregiver? The yellow part is telling you that they never attend. So which means that half of the caregiver, being a caregiver, never attend caregiver training. Then the other half, okay, then you see the other angkong there's a maid there, right? Okay. So what we find out is that for those who attended the caregiver training, a lot of them are the foreign domestic workers. Okay. So that is what we find. And okay, so then we wanted to know how many courses that they attend, when do they attend the caregiver training. So most of them actually attended one caregiver training, and most of the time actually is at the hospitals when the caregiver of the care recipient are just discharged, or maybe there is a change in condition. That is the time when they attended the caregiver training. Okay. Then what happened is that we wanted to know what kind of training that they usually attend, okay, so far. Not surprised, okay. 8 out of 10 actually tell us that they attended ADL training, which means help with bathing, showering, feeding, the kind of courses, okay. Then we also asked, okay, aside from that, then what are the other courses that you think will be useful for you, okay. So what we gather is that half of them, 49% actually say that social emotional courses, okay, how they support the care recipient, and also how they support their own well-being will be useful. And also we have 46% actually say that they want to know better how to apply the learning, okay, in their home environment for the care recipient. These are the courses that they're more interested. Okay. This one is for me to understand those who never attend training one, right? Why? Okay. Also, not surprised. Most of them actually cited because they have no time. Okay, we all know caregivers are busy. Then we ask them, okay, if you were given an opportunity to go for caregiver training, what kind of courses do you think that would be useful? These are those that actually didn't attend the caregiver training. And we get the feedback to saying that they wanted to learn more on how to manage challenging behavior, and also the condition of their loved one, and also at the same time, how to take care of themselves, which is good that the caregiver awareness of self-care is getting there. Yeah. Okay, and the section 4 on the self-care. Okay, so good to find out that majority of the caregiver that we interview believe in the importance of self-care. Okay, and most do take time for their self-care as well, and they also believe in the importance of getting the paid respite service and recognize that as a part of the caregiver self-care. Okay, so that is the end of my sharing of our survey finding. So basically, why do I do all this survey? Basically, is to kind of like to affirm whatever we are working on. Indeed, is it in really addressing some of the key pain points, which I think this sharing will be helping the care professional when you are planning for your work. There might be some key interest area, the reference that you all can take reference as well. So back to the 3 pillars, the engage. So what we need to do to engage the caregiver. Okay, a lot of things, right? Okay, so just now I shared one of the slides. Caregivers are not aware that they are caregiver. The awareness is low, the perception is low. So therefore this year, we have started a caregiver campaign. The caregiver campaign basically is to let a caregiver aware that there's a lot of unseen act, okay? In fact, what happened is that we want the caregiver to know that there are resources, there are support there to help you. You are not in this journey alone, okay? So we call that WeSeeYouCare campaign. So that's why I have a hashtag called WeSeeYouCare. And you see our health minister there, Ms Wang, actually do a TikTok show with the caregiver. And we also have multiple social media posts. The WeSeeYouCare, the pack that you're holding is one of the initiatives that we try to raise awareness as well. Okay, later you will see something more interesting instead of me talking, okay? So what happened is that we developed 3 short movie, okay? Basically to highlight the life of unseen act of the caregiver. We have one on the top of the young guy looking after the bedbound parents. We also have one of the mother looking after the mental health daughter, and also a husband look after a dementia wife, okay? So another thing that I want to make sure everyone remember is this WeSeeYouCare.sg. Basically, what happened is our caregiver campaign come up with this campaign website. We consolidate all the resources, information, schemes, learning, caregiver learning, training, everything inside. So if you cannot remember anything, at least remember this WeSeeYouCare website and go in to have a look as well. Okay, so now let me show you a clip of the video.
你没事。这是我们的家。 你的老公阿焕，阿焕。
阿焕。
There's three. Do feel free to go and watch. Sorry, do feel free to watch the other two as well. Yeah. Okay. Then another thing that I wanted to share, okay, is the care service recommender. Okay. Just now during our survey finding, we also find that caregiver a lot of time doesn't know where and what to find. Okay. So this care service recommender basically is a few short questions that you answer according to the care recipient's condition. And they would actually tell you maybe what are the care services, maybe daycare or maybe home nursing care that you will need, and also what are the financial scheme that you potentially you can apply. Okay, so this is a self-assessment tool. Okay, the website is there, and I also have a short video to show you what is it about.
Wondering how to manage the care needs of your loved ones? Check out the Care Services Recommender. It offers recommendations on care services and schemes based on your loved one's care needs. All you have to do is complete a simple self-assessment on the page. It's that easy. Just answer according to your own experiences and what you're facing. You will be asked to share about your loved one's health condition as well as any assistance you may need in caregiving. The questions will help to profile your loved one and find out more about what you need to take care of them. After completing the questionnaire, you will be recommended suitable schemes and services based on your loved one's profile and your caregiving concerns. Whether it's for physical or mental health care, social or financial support, or even future planning, you will get all the details you need so you can make the right decision. Let us help you find the support you need. Try the Care Services Recommender now.
Okay, then another thing that I wanted to actually let everyone know is that after this caregiver conference in HNF, there's another one coming as well. Okay, this is the first time that 4 agencies come together. We have NCSS, have SG Enable, AIC together with Caring SG. We're organizing this care conference for the care professional and also the care carnivals for the caregiver. It will be the whole month of November, full of activities. You can use the QR code on the left to register as well. I think definitely for the caregiver, you'll be benefited to definitely join the care carnival that we're trying to have the different part of Singapore. So we have one in Enabling Village, one at Kampong, Admiralty, and one at Bedok as well. Okay, so I will not take too much time to sell this. Okay, I'll go to the next one as well. Okay. Okay, the next one actually is on Empower. Okay, so on our caregiving survey just now, we understand some of the insight from the caregiver on the caregiver training, but we also done our focus group discussion to understand better of what are the concerns of the caregiver. Generally, what we do see is that the affordability is one of the issue. Another thing is that they wanted to see more cost ranges, different ranges. I do think that most of the caregiver training costs right now are more geared towards the ADL. Okay, there will be a need to have different range to add into it. Another thing is that the lack of awareness. A lot of caregivers actually may not be aware that aside from the caregiver training at the hospital when they're discharged in the community, there are actually caregiver training available. And there are actually government grant called Caregiver Training Grant that you can apply to defray your caregiver training cost. So going forward, there's 3 phases that we wanted to do. The first thing is we want to expand the range and the scope of the caregiver training. So the AIC team actually are working on the caregiver training framework and also a guidebook to help the caregiver to identify in their caregiver journey, likely what are the skill set or the knowledge that you need to learn, okay? And second part is enhanced funding. I know Singaporeans all very worried, way more on for that. That will be at the working to see how we can actually review the caregiver training grant and also explore collaborations with SkillsFuture on the SkillsFuture credit. Third is to raise awareness that we need to do more outreach to raise awareness of the availability of these caregiver training courses as well. Okay, then the last pillar of the enable. Okay, just now we do hear that caregiver do find respite care as one important aspect. Okay, so currently what happened is that there are different services available. For example, senior with minimal care need, there are household service schemes that they can tap on. And for frail seniors that nasally need a bit more of the medical needs, they have daycare services and also maybe home personal care services. Then for those more frail ones, there are nursing home respite or night respite service available. But I think the care professional will then always also highlight one thing is that the availability, okay? So this is one point that we are working to see how we can actually increase the availability and accessibility as well. Okay, over this, I just wanted to highlight one of the pilot that we have on the night respite pilot. So what is it in short? Actually, this is a pilot to help the dementia family. Okay, so some of the dementia, so one of you are looking after the dementia family, we realize they may have this sundowning syndromes, but at night they are rather active. Okay, so this night respite program is actually a night program, what time is it? Okay, it's a night service from 7 p.m. to 7 a.m. So the caregiver actually can send their loved one with sundowning syndrome to this pilot. Then they would be meaningfully engaged where the caregiver actually can have some good rest at home. So if you want to know more, you can scan the QR code a little bit small, okay, but you can scan for the application form to know more how to apply as well. Okay, then now I go into a bit of resource and the financial help. Okay. Understand caregivers are busy. Not everybody have time for caregiver training. So as such, we curated bite-sized tips, which I think at the booth, the AIC booth, we have actually print out some of them as well. So you can take a look at it, and if you find it useful, then you can actually go into read to the whole full content of the different information. We have curated the top 5 brochure for you all. Can be top 5 caregiving resources for dementia and for mental health as well. Okay, and then another thing is that I think just now we see that a lot of awareness on home caregiving grant and also the foreign domestic levy. Just to highlight that home caregiving grant actually have been enhanced recently, okay? So it have increased from 200 per month to actually 400 per month, okay? Another thing that I want to share, which I think just now I talked to some of the caregivers as well, they may not be aware that actually other financial schemes available. There are caregiver training grants that help you to offset your training costs. There are also SMF, Senior Mobility and Enabling Fund, that you can use it to actually to buy your mobility or assistive aids or even for the home healthcare items, okay? Then you say, hey, only 3, so little. Okay, actually it's not. Okay, there are more, okay? So then you say, then how do I know? So that's what I actually share with you here. On the AIC website, actually under this called Managing the Financial Aids and Grant, there is assistive tools that you just go in, answer a few questions. They also can tell you what are the potential financial scheme that you may apply. And if you prefer a hard copy, okay, actually there's hard copy available as well, okay? At our AIC booth, I think we prepare some of the English one that you can take. But we have also 4 different languages that you can actually download from our AIC website. Or if you cannot find, just remember this, WeSeeYouCare. From there, you can go in to access all this information. Okay, this is my last. Basically, what we want to emphasize is that we have this inclusive environment for the caregiver. So what I wanted to take back, for you to take back, is that you will feel at least you understand that how you know what are the caregiving resources available. So there are this care service recommender that can help you to recommend your care services schemes. Go to this WeSeeYouCare website that you can have your caregiver resources information. And so that what I mean is that we want the caregiver to actually, important to understand your need and look into your own self-care. okay? And also go for the caregiver training that help to better equip yourself. Then the last part of the I want is that take part in the different community events, okay, for example, like our care carnivals and the conference, to be aware of what are the community resource and services there to support you, okay? And last but not least, get connected to some of the caregiver support networks, okay? Maybe in the future, this carer hubs will be one of the important features that you can join as well. So that's all I have. Thank you.
Thank you, Ms. Yeung. Thank you very much. The next speaker is Ms. Susana Harding, Senior Director at the International Longevity Centre, Singapore, of Tsao Foundation. Thank you. I still have a few lines to introduce you first. No, but it's okay. You can stay here with me. Keep me company. I've been alone on stage. Okay. So her work focuses on policy advocacy, research, and the development of new programs that focus on active aging and community participation among older individuals. Her research interests include aging and gender and its intersectionality, caregiving, financial security, community resilience, and more. In her presentation, Susana will be sharing more about the positive aspects of caregiving, unveiling life satisfaction, meaning, and resilience that are often inherent in our selfless caregiving journey. Susana, please. Thank you. No problems.
Hello. Okay. Yeah, because I'm a bit of a challenge whenever I speak. I need water. One of the long-term effects of COVID was after a while of too long speaking, I tend to be out of breath. So, okay, good afternoon, everybody. Thank you for that very kind introduction. I think I also want to be introduced as a caregiver myself. Actually, I was an overseas caregiver, overseas online caregiver, because my mom was not with me here. She was away. She was back home in the Philippines, and she passed away 2 years ago, just after the COVID. So, when the invitation to be part of this very good initiative and conference, I cannot say no. Although I'm not sure if I can really, extensively value add to the wealth of experience in this room, both as individual family caregivers, the informal caregivers, and of course also the part of the ecosystem are the professional caregivers in this room. My background is more of a policy person, researcher, and program developer. So I look at this, the data from AIC is actually very interesting because there are two data there that is kind of a good transition to what I'm going to be discussing. One was 49%. What was that number? From the AIC survey, it says 49% of the family caregivers want to know more about how their own well-being and self-care can be addressed. The other one, I think, was 44%. So they said it again. So they did not just say it once, but they actually said it twice in the survey. 44% of family caregivers said they would like to know more about their own well-being and self-care. And that, I think, is very important. So it's not just about self-care and the many resources, but more importantly, the well-being of each and every one of us who are caregivers right now, will be future caregivers, will be future care recipients. So I think that, to me, is a very good segue to what I'm going to be sharing here. Okay. I also happy that the overall goal of this conference is really how we can create a sustainable caregiving community. Very, very big words, very, very big goals. But I think it's about time that we really work together. To a certain extent, I'm happy that AIC and the other agencies are coming with another conference next month, because we need to continuously find platforms and mechanisms and be able to have the opportunity to network and get to know other caregivers, whether informal or formal. So having that community in a regular basis and continuous, I think, is a very good way for us to go as a society. I am the director of the International Longevity Center Singapore, which is actually one of the 4 initiatives of the Tsao Foundation. So my organization is actually Tsao Foundation. So ILC Singapore is the initiative of the foundation that takes care of all the research for policy advocacy. What needs to be able to understand, what are the trends, what are the needs, the gaps in the community, be able to understand it and be able to have the evidence, and then find a way to get solutions from elsewhere. So as part of ILC, we're actually part of an International Longevity Center Global Alliance, where there are other 15 ILC centers all over the world. In 2018, when Dr. Marian Tsao, our chairperson, was the co-president of ILC Global Alliance, there were 2 issues of older people that she wanted under her leadership to be done or to be addressed and focused by the Global Alliance. One was long-term care. A lot of the countries have not fragmented system. There's not even a long-term care system. The other one is actually caregiving. So in the caregiving, so there was a work group on caregiving, of which I work with Rahul, actually, from CARE, and we kind of together catalyzed this together with our colleagues from ILC Canada, and then we did we looked globally, what are the policies in place currently that is addressing the needs and unmet needs of caregivers. For those of us who kind of may not fully understand the importance of a policy would mean that the government would be providing the enablers, support, so that the needs can be met across everybody, not just a group, not just a subgroup, but the equity issue. That means everybody can then have that benefit schemes or whatever. So a policy is important to be able to make the whatever resources or scheme available and accessible and affordable, hopefully for most, to everybody, not just to a few. So that is important. So we look at all the policies all over the world. So it's not just in Singapore. We look globally, and then we felt like there is a failure. Why is there a failure? Because we feel that the policies currently are more focused on the needs of the care recipients. You know, like they only look first at the care recipient, and then they look at you as, okay, you have to make sure that you're able to continue to take care of your elderly. So all the schemes, all the policies are really targeted at ensuring that the care recipient is addressed. And then the unpaired caregiver, maybe I look at my... So it's focused on the care recipient. Unpaired caregivers are not explicitly recognized. Maybe that's why only 2/3 can say that, hey, I'm actually a caregiver. Because it's not, we don't seem to have a culture of really explicitly, it's okay for you to say, I'm a caregiver. That's why, if you notice, when I say I'm also actually a caregiver, because to me that's part of who I am, and that has been part. But that's not just me. He told you, everybody, who I am before, but also part of me is a caregiver. So I think it's important for us to have the confidence and the ability to say, I'm actually a caregiver myself. So I think if we do that more publicly, then maybe, yeah. And then we found out that even when supported policies explicitly target unpaid caregivers, they are in place, there's a lack of knowledge, as we know. Lack of knowledge, awareness about what are these support. And the other part of it is access is an issue, right? And then means testing is also become so kind of like a variability in terms of, do you have the means to be able to pay for some of the co-payments? So as a global alliance, we feel that there is an urgent need for a collective understanding, study, and building evidence around really the caregivers as persons themselves who has expressly desire for their own well-being, not just the self-care, beyond their role. So they are not just, I'm a caregiver of my mother or father, but I have more than just that role. And that they also deserve their well-being supported and addressed, and that their contributions could actually be part of the computation or some way of recognizing it in a more, at the societal level, through the economic, look at it also as an economic contribution. Because if you don't provide that care, who's going to provide it? Then you need to find a formal caregiver, which we know is going to be more expensive, most likely, and we may not have enough manpower to be able to have all former caregivers. So our advocacy then at the Global Alliance was that perhaps, and one of the things we also found out is most of the studies globally focus on the negative aspects of caregiving, the burden. Caregiving is a burden. It's challenging, a lot of stress, blah, 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 blah. But perhaps we also need to think about, why don't we start thinking about what could be a positive way of looking at experience of caregiving? Is there? Anecdotally, we know there are some. No, the challenges would still be there, but is there a way for us to also think about the positive aspects of caregiving? So there are two. So from that Global Alliance work group, we look at psychology. Psychology offers one theory around flourishing. And the other one, the resilience one, is coming out of our own study around communities of older persons. So which traditionally has been about as a result of environmental crisis, but now increasingly resilience is also being discussed in relation to caregiving as a crisis situation for really those that get to a point where it becomes very stressful. So let me talk about first from the burden of care to flourishing. So these are the groups. So the ILC Global Alliance, together with the academic research institution based in Poland, plus the University of Ottawa Life Research Center, actually came up with this idea of, could we borrow flourishing from the psychology and use it to understand, can there be a positive aspect to address the well-being question, the desire of caregivers to have their own well-being addressed and supported? So these are the different components. So the PERMA theory, I'm not a psychologist, so I won't be explaining this in detail, But certainly, if you're interested, I can share with you the compendium of research that has come out of these 2 years of work that we've done. But the idea is the PERMA stands for the positive emotion, that caregiving could be a pleasant life journey. You know, if maybe from the start you kind of understand, what do I want to get out of this caregiving journey? If somebody can kind of have a facilitated discussion with you, then perhaps you'd be able to see your progression, and then you'd be able to find that it actually can be a pleasant experience. Engagement is also very important. That's why, as AIC said, one big part of their pillars is engagement. How do we continuously, the fact that you are providing care as an activity is also its own reward. And how then do you continuously do that such that, you know, it becomes a bit more positive. It gives you, it deploys your skills, you build your knowledge, and you are being much better problem solving, life problem solving. Relationships, you're able to have a more positive, you can change some of the past experiences. I remember with my mom, at some point, we didn't have a very good, really very good relationship when I was younger. But when she was older, and I was, of course, I have the hindsight of a wealth of knowledge behind me through the work that I do, then I realized that actually we could change our relationship, the mother-daughter relationship, to a more, so I managed to have the opportunity to change some of the past not so good relationship I had with her and have a better and more positive relationship as she grows older until she passed on. I was her best friend. Not of my two sisters, she doesn't call them as best friend, but my psychologist sister, you would always be her best friend because you're not with her, living with her. So it's like, yeah, I felt so good that she told me I'm her best friend, but my psychologist sister, who's also an aunt, told me, you'll always be her best friend because you don't live with her. My older sister lives with her, and she's not her best friend. So I kind of, okay, it kind of like, I came down after that. But at least it felt good for a while. Meaning derived from sense bigger than the self, service, and purpose. You can look at your journey, your caregiving, as a way not only to contribute to your own family, to your own parents, but also to this community, the other caregivers. Your wealth of experience could actually be a resource for other and the future caregivers. So I think that's, kind of like bigger than ourselves. And then, of course, the last bit is accomplishment. Can we look at the caregiving journey as a way that we could actually look towards some of the as an achievement, to be able, as an accomplishment, that I have been a filial daughter, I have been a very good wife, I have shown my love and my care to my family and to my loved one. And that could be something I can have that sense of accomplishment. So that's for the flourishing. So the next one that we are starting to kind of understand better. So the flourishing one, unfortunately, after we've done the compendium, then COVID came. And we couldn't kind of follow through with research. So hopefully with some, Rahul, we always work with Rahul and his team hopefully, and perhaps with some support from HNF and AIC and others, we could try and see, could that be something that we could understand better? Could flourishing be a way to address some of the well-being desires of caregivers for Singapore? So I think that's my call for our colleagues here. So the other part of the positive experience on caregiving that I'd like to share that came out of our research as well is around resilience. Traditionally, resilience has been looked at. This is a regional research study that we did, looking at risk. There's a lot of environmental crisis now happening, blah, blah, blah. But we realized that actually, also resilience, when we say resilience, these community members and all the persons are working together to develop and use their capacities to either cope. So when you are faced with the risk, you either know how to cope with it, you can manage it, or you could actually work towards a transformational process. So I think that's where this study is coming out of. This is more for researchers, so we did a systematic review. If you want to know more about the research that we've done, plus the papers that came out of this, we have a microsite actually on this. So we looked at resilience across stressors and country contexts, and caregiving was one of the stressors that we find that across the region, it's increasingly becoming a risk and a stressor and really a big challenge. At the community level, so then, as a result of this study, we've managed to develop a framework looking at resilience among older people. So from the evidence globally, we kind of narrowed it down, and then we developed this framework. It's difficult to explain this within 6 minutes, but if anybody, I hope I have a chance to kind of, what is important here is that really the understanding that when we are faced with a risk, really challenged by the caregiving responsibility, or we feel like we're alone and all that, we may need to look at what could be the enablers at the individual, what is it in us that we could actually pull out and then kind of, have that energy again to be able to continue either to cope with it, find a way to manage it, or to transform. But there's also that responsibility at the community level. That's why it's important, and I find that it is really good that we need to come together as a community, because we cannot just let the individuals work on this on their own. We need to have everybody working together to be able to build a more supporting environment and to build resilience at the community level. But there's also macro, so the national, that's where some of the policies, the schemes, the specific agencies that supports caregivers and their journey is also very important. If you don't have that enabling environment, then it's also going to be very tough. So with those three in place, we could actually, maybe we start first with coping, if you're a new caregiver. But along the way, you could actually find a way perhaps to go towards how do you manage it better, and then be able to find a way to transform your experience into a more positive. Yeah. Oops. And then we build, there are resilience wheels. So these are the blocks. These are the indicators at the individual level, capacities at the individual community at the macro level. We're still trying to see if we can use this to understand better caregiving as a risk, and how then do we find a way to measure the individual indicators that's in this wheel, and then be able to then offer some of the what else can policy support, what else can practitioners support, what else can we do ourselves. So that's the idea for this. We're actually at the foundation level, we're going to use this to develop or understand better and apply this. Because for us, we're an applied researcher, so we're not the academic kind of, that's Rahul added. But we're applied researchers, meaning whatever we study, we inform policy, we try and influence, but also we try and translate it into practice. How do we become better at engaging and working with caregivers? So we did a validation, and there's good practices. So the work is not yet finished. We're just started. We did this during the pandemic, actually. So very interesting. At least we managed to finish it despite the pandemic, this research. So for me, my contribution, I'd like to say, to this conference that was organized by HNF is really that I feel like we need to have a bit of a mindset shift from looking at caregiving as a burden to perhaps looking at it, what could be positive? or how can we have a bit more positive experience out of the journey. And then explore also from the individual to the community, and quite happy that there's Carers Hub now that's just been launched by HNF, and that AIC is doing a campaign. These are enablers. These are the part of the ecosystem that would allow us to feel more enabled and confident as caregivers. And of course, to be able to create a sustainable caregiving community, I think it's possible and achievable. I think we have a wealth of experience by now. And if we're looking at 2030, where there's 1 in 4 that's age 65 in Singapore, or 1 in 2 in 2050, then there's a lot of work ahead of us from now on. And I think this kind of conference, this kind of platform is something that we should have on a regular basis. So thank you very much.
Thank you, Susana. That was very, very insightful. Thank you very much. Next up, we have Dr. Maulod, who is the Senior Research Fellow at the Center for Aging Research and Education, or CARE, at Duke-NUS Medical School. Dr. Art's research focuses on translating cultural concepts of health and aging into effective program and policy interventions. Dr. Art has also conducted several evaluation studies examining user experience of health services and the factors that impact quality of care. Dr. Art's presentation will touch on nuances of filial care negotiation and explore how family support and relationships profoundly shape caregiving journeys. Dr. Art, please. Thank you.
I'm very grateful that you can see me, because usually people can only see my hair. So 7 years ago, I came across a research participant who had won an award for being a good caregiver to his wife, who has dementia. He lives in the rental flats in Chinatown, one of the poorest neighborhoods in Singapore. He was proud to receive the award because, being poor in this country, he felt like his life never amounted to anything. So the award signifies an accomplishment of some sort. So I was praising him like an eager novice researcher, but I stopped when I heard him say, "All I do is out of love for my wife. Anyone who loves someone will do the same. Like this also can get award." So to this man, how can an act so natural, so ordinary, be worthy of institutional recognition? Every caregiver then should deserve an award. So my encounter with him made me question, what makes a good caregiver? And if there are good caregivers, does this also mean there are bad caregivers? So to answer the question about what makes a good caregiver is to think critically about some of the misconceptions of caregiving, such as caregiving comes naturally when you care about someone, especially if you're a woman, especially if you're a single, unmarried woman. Caregiving is easy, what? It's all about routines. Caregiving is love, so it's not work. Shouldn't get paid for it. Shouldn't ask for money for it. Caregiving is stressful, so where is the benefit? Good caregivers must willingly sacrifice for their loved ones. If you don't want to sacrifice, then you're not a good caregiver. And also, caregiving stops when loved ones enter the nursing home. Your role and identity as a caregiver stops when your loved ones pass away. And then next, we need to think about where and how such misconceptions come about. There's an entire literature debunking misconceptions of caregiving, and it kind of revolves around these 4 themes here. First, the feminization of caregiving roles based on gendered stereotypes of women as natural caregivers due to the maternal and nurturing instinct. Oh wait, I have been pressing different things. Like an imaginary board here. This is what, I'm used to someone else pressing the slides for me, that's why. Anybody wants to volunteer? So thank you. It took someone 4 slides before they can speak up about me doing something about it. Okay. So these are, caregivers in this room. A lot of you are very used to staying silent even though you are experiencing problems. So when I'm presenting, if you don't understand anything, please interrupt me. This is your space, your voice, your platform. Okay, I'll move on to the next slide. So the sources of this misconception comes from the idea of caregiving being a very gendered act. Second, the normalization of filial piety as duty to obey, respect, and care for one's parents or elders. And third, the understanding of caregiving as limited to only the physical act of caring. And next, the stigmatization of care. Nobody wants to care, right? Because it's a form of dirty work. There's nothing innocent about misconceptions, nothing innocent about assumptions like this. You know what? I'll just... How to switch this off? Okay, another feedback. This is better now. Wow. So there's nothing innocent about assumptions. They have implications to the everyday lives of our caregivers. First, when you feminize caregiving, you shift the burden of care disproportionately onto women. When care is viewed as natural and out of duty, it ignores the emotional, cognitive, mental, and physical labor of caregivers. I think Brandon presented something just now to say that caregiving is work. It's not natural. You have to learn to be a good caregiver, even though it's something that you do every day. Just like how we need to learn to be a mother, to be a father, these are things people assume as natural just because it's care. It is also difficult for caregivers to articulate challenges and seek support or help to avoid being judged as not being filial, or to avoid being judged as incompetent, because care is so natural and easy, right? If you're complaining means you're stupid or what? Are you incompetent or what? So people are afraid to seek help because they do not want to be judged. Another issue is the mental load of caregiving. There's a lot of anxiety around making the right decisions because responsibilities fall onto yourself. And this mental load often goes unnoticed and ignored. And next, finally, caregivers also experience situations in which their self-determination, their sense of who they are as people, is at odds with filial piety. So for my presentation today, as you can guess from my title, since the title was on for a good 3 minutes, you should memorize it by now, I'll be focusing on normative assumptions of filial piety and its implications to caregiving. Filial piety as means to normalize care for our elders is pervasive in Singapore, and it's prevalent throughout our policies as a social safety net. This is evidenced through the 1994 Family Values Campaign, Maintenance of Parents Act set up in 1995, and more recently in the past decade, a national campaign to encourage filial piety with the tagline, "How one generation loves, the next generation learns." When filial piety has been touted to be confusion, while filial piety has been touted to be confusion in its origins, the notion of care, respect, and duty to elders is actually common to all the major ethnic groups in Singapore. And it's not just an Asian thing also, okay? Because we do have some kind of filial piety resemblance in other countries in the world as well. So it's not an East versus West thing. We're so proud to say that filial piety is an Asian value, but I will right here, right now tell you it is not an Asian value. There is a universal aspect to love and care for the people who raised you, loved you, and nurture you. So there is the concept of Xiao. I hope I say that correctly. It's not the crazy one, but it's the familial one. In the Chinese Confucian philosophy, Ta'at or Birrul Walidain among the Malay Muslims, and Seva in the Hindu ideology. They all espouse the same thing: deference, loyalty, duty, respect, and providence to elders. These are often couched in the language of reciprocity, mean giving back to someone what they've given to you, and also interdependence. We help each other, we raise together, so there's this sense of, being interdependent. Despite its existence as a cultural norm, filial piety is actually experienced in diverse forms, but its diversity is less explored or acknowledged in the literature as well as in familial policies. This dual filial piety model, for example, differentiates between authoritarian filial piety and reciprocal filial piety. Authoritarian focuses more on duty and obligations, your adherence to these obligations, while reciprocal filial piety is focusing more on intimate affections or voluntary expressions of love and care for parents. So to put it very simply, authoritarian is about being forced to be responsible, while reciprocal emerges out of your own free will and autonomy. And I think Doreen, when she presented just now, she talks about wanting to touch her mother, wanting to cry. That's reciprocal filial piety. So in this presentation, I would like to also emphasize there is no one type of caregiver. The toolkit that you see over here is produced by National Council of Social Services, and it has highlighted 5 different typologies of caregivers that informs what types of support would work best to address their struggles. So the 5 types are detached caregivers, conscious caregivers, balanced caregivers, self-reliant, and reactive caregivers. So what we also know that from our literature review is that caregivers who perceive themselves to be well-equipped for caregiving tend to experience more positive outcomes from caregiving compared to those who are less or not equipped. So being prepared is key to experiencing positive outcomes in caregiving. As an experiment, my team and I, we took the work that NCSS has done and we took it a step further and mapped it to the dual filial piety model. Since filial piety has been the modus operandi shaping how we think about family caregivers, in the DFP model, there are 4 different modes. The authoritarian mode, the balanced mode, non-filial mode, and reciprocal mode. You don't have to memorize all this now. It's not going to be included in your exam after this. But I'm going to go through it later in later slides. But what I wanted to show you as well is how nicely it maps out. Traits of the more balanced caregivers, or those who perceive themselves to be well-equipped, tend to be aligned with high levels of reciprocal filial piety. While the more detached caregivers, or those who perceive themselves as less equipped for caregiving, tend to cluster around low levels of both authoritarian and reciprocal filial piety. So not all forms of filial piety is great for your well-being. From the literature, we also learned that the difference between expressing authoritarian or reciprocal filial piety boils down to one's self-determination. Self-determination, if I were to define it, is concerned with the fundamental right of people, individuals like yourself, to shape your own lives. So in the practical sense, self-determination means that we have the freedom to live well and determine what it means to live well according to our own values and belief. So this theory basically proposes that fulfillment of filial obligation does not necessarily compromise one's self-determination. We think that being filial means we have to sacrifice ourselves to care for our parents, but actually filial piety can work with one's self-determination. And how does that happen? There needs to be alignment with your autonomy. That means there's flexibility and choice in fulfilling your filial obligation. There's also competence. You do have some kind of self-mastery, and you know what to do in completing certain tasks and overcoming challenges in caring for your loved ones. Relatedness, there has to be some kind of quality connection with your loved ones through mutual respect, understanding, and affection. And lastly, what you do is very integrated with the cultural values and social norms that you have been socialized in or that is meaningful to you. So findings from this presentation is based on our study called Qualitative Insights into Caregiving Transitions. It's called the Quality Study. And here in this study, we are interested to understand caregiving beyond narratives of burden. We want to understand for this presentation specifically how family caregivers negotiate the self-determination vis-a-vis filial care and the ways in which their care practices contribute to positive and negative caregiving experiences. So this study is actually a qualitative longitudinal study using semi-structured in-depth interviews with a total of 40 caregivers. But for this presentation, we have extracted 34 family caregivers of parent-child diets. Participants were interviewed twice, 12 months apart, and the baseline interviews focus on their caregiving journeys, their experiences, their perceptions, and attitudes towards caregiving. Our interviews took about 3 hours long on average. The follow-up, 3 hours long is enough for people to cry and then be happy, then cry again and be happy. And it was actually very, very intense experience for us researchers as well, doing the interviews. The follow-up interviews were shorter, it's just like 1 or 1.5 hours. Here we just want to identify what has changed in the past year since we last spoken to you. So some of the care recipients have died. Some of our caregivers have gotten into poorer health situations or financial troubles, or even other loved ones becoming ill. So they are now becoming caregivers to more people. And these participants were actually purposefully sampled from a larger quantitative study called Caregiving Transitions Among Family Caregivers of Elderly Singaporeans, or TRACE, which I think Rahul has spoken about earlier in the day. And these participants were actually grouped into 4 different classes based on latent class analysis. I will not explain what that is, but all I can say is that latent class analysis produced 4 distinct groupings for our caregivers, from which we sample to take and bring into our qualitative study. So the 4 different classes are satisfied, balanced, intensive, and dissatisfied. This one you must memorize, okay? For satisfied, these are people with low caregiving burden but high benefits. They perceive high rewards. Balanced are those with low caregiving burdens, but they feel that their benefits are reasonably okay. Intensive is high caregiving burden, but high benefits. Dissatisfied would be moderate caregiving burden, low benefits. So majority of our participants are taking care of their parents, and more women than men. There's 25 women compared to 9 sons. Majority of our caregivers are also Chinese and women. There were relatively similar proportions of caregivers who were not working versus those who were still working. And basically, because half are retired, it corresponds to their household income, slightly more, earn less than $3,000. Majority of our participants have been providing care for at least 5 years, the highest being about more than 15 years or between 5 to 10 years. Majority of them also have care recipients with 6 ADL or 7 ADL limitations. That's the maximum. And caregivers in the intensive class spend significantly more hours providing ADL assistance per week. So before we conducted our analysis, we had assumed that the more intensive care needs are, the larger the caregiver burden. But instead, we found that there is no direct relationship between ADL needs and caregiver satisfaction level. So the perceived burden of caregiving is actually not dependent on the number of ADL needs. Rather, it's attributed to the following: lack of support system, the physical need to pay constant attention to someone who has dementia, perhaps, and underpreparedness to cope with a disease. So these are the 3 factors that actually contributed to perceived burden rather than ADL needs. Given these insights to caregiver burden, I will move on to talk more about what our study reveals in terms of filial piety and positive and negative experiences of caregiving. So being filial is a journey, and there are different journeys. In terms of being a caregiver, we found that across the 4 different classes, all caregivers are providing care out of a lack of choice, or it's a natural progression for them to care for someone. But it's not something one willingly volunteers for. Second, no one is prepared for the role despite knowing that being a caregiver is inevitable. So they said that caregiving is more like on-the-job learning. Third, all caregivers acknowledge filial piety and reciprocity, but there's a difference whether one cares out of love or being forced to. Aside from their existing classifications, the satisfied, balanced, intensive, and dissatisfied, our participants can also be differentiated or distinguished further in terms of how they express filial care. So participants from the intensive and dissatisfied classes tend to express authoritarian filial piety, where they perceive caregiving more as a duty or sacrifice, driven by adherence to societal norms, family hierarchy, and obligations. It may be seen for them as a compulsion to fulfill a role rather than personal choice. There's also a lot of emphasis on, I sacrifice this, I sacrifice that. Never mind, they're my parents, so I have to sacrifice. In contrast, participants from the satisfied and balanced class tend to express reciprocal filial piety, where caregiving stems from mutual respect, love, and gratitude. They also see their acts of care as voluntary to reciprocate the affection and care received from parents. There's more emphasis here on how they want to do this for themselves. No one asks them to do this, but they see it as joy to be there to support or care for their parents. So in the next few slides, I will demonstrate with case studies of 4 different types of filial caregivers to flesh out more the difference between filial care and caregiving experience and outcomes. So let's meet Mr. Allen. Mr. Allen, 56, has dedicated the past 15 years to caring for his mother, who has dementia. He prioritizes spending quality time with her, ensuring her financial well-being, and managing her care. The helper of 14 years plays a crucial role in his mother's care. Without this support, Mr. Allen acknowledges the immense stress he will be facing. He deeply values the social aspects of caregiving, cherishing moments of communication, and the recognition that his mother still offers him despite being nonverbal. Reflecting on the love she gave in his youth, Mr. Allen feels compelled to reciprocate her affection. Transitioning to a flexible part-time job came through his own volition, fulfilling his desire to spend time with his mother. So he says here, she gave us so much for so many years. We appreciated her love looking after us. So now it's our time to take care of her, look after her. We saw that she is a great mother. We thank her and appreciated her love. Now the top priority in my life is to show the love back to her. That's why I take up flexi part-time job. So in terms of filial piety model, Mr. Allen actually belongs to the reciprocal mode. He exhibits low authoritarian filial piety while high on the reciprocal filial piety. So caregivers who were similar to him basically have close and positive relationships with their parents and practice healthy and good communication. They focus on personal practices rather than actually expressing role obligation. And they tend to see their filial behavior as authentic love. If I ask them, why do you care for your mother? He will look at me and say, what kind of question is that? How dare you ask me that question? No, they didn't scold me, but I think from their tone, they think I'm rude to ask that question. And he actually says that's a very difficult question to ask because I never thought to question why I do this for my mother, because it's something that I've wanted to do for myself. Next is the balance mode case study. We meet Madam Mayyan. So since 2014, following her father's death, Madam Mayyan, 60, has been the primary caregiver for her mother, who has dementia. So as an eldest child, she feels a deep sense of duty towards her mother's well-being. She partners with her siblings to care for their mother. So it's not just her alone, it's a network of caregivers. And they have weekly Zoom meetings to discuss about their mother's care. They also have a helper of 6 years who assists in the mother's care. Despite being a caregiver, Madam Mayyan believes that her life remains unchanged. So if you ask Madam Mayyan whether or not she identifies as a caregiver, most likely she will say no. Mother is just in the house, but I have my own life. So she practices self-care and feels her personal priorities are intact, unaffected by caregiving. So she says over here, we have to take care of ourselves before we take care of other people. If I'm miserable, everybody around me will be miserable. What reassures me is that I have family support and they will step in whenever I need some personal time. So based on this narrative, Mayyan exemplifies a balanced mode, high authoritarian filial piety and also high reciprocal filial piety. Next example is Miss Nancy from our intensive class. So Miss Nancy, her interviews were really, really difficult to hear. She has been a primary caregiver for her mother for 25 years. They have a very strained relationship. There's lack of mutual affection. In fact, Miss Nancy is not her mother's best friend. like Susana, and not the favorite child. So there's a lot of tension around that. But Miss Nancy, she is motivated to care for her mother, not because she loves her mother, but because she is responding to a higher calling from God. She wants to go to heaven. That's why she's doing this. So it's quite interesting that if you are appealing to a higher calling like God, you are not actually belonging to any filial model. It's a non-filial model because it's not based on wanting to care for your parents. Yeah. So this is something that she said. I can't be bothered with my mother already. I even told the maid, do whatever you want. You want to beat her, you beat. Up to you. I'll be inside sleeping. Don't disturb me. Because I take care of her and I just want God to know that I'm doing my part. Next time when I die, I wish to go to heaven because I got credit from there. Yeah. But you have to understand, Miss Nancy is not cruel, she's not mean. She's pushed to the point where she's past her breaking point. Remember when I say intensive is what? High burden, high benefits? When you suffered so much, you need to make sense of the meaning of your suffering. And thinking about God, thinking about rewards that come after is the thing that keeps you afloat. So this intensive caregiver, they are past their breaking point. And finally, we go to the authoritarian mode case study. And this is Madam Fatima, who, 65, has been a sole caregiver for a bedridden father for the past 4 years. So caregivers like Madam Fatima, they have a less intimate relationship, but they are very differential towards their parents. So they really think about what is appropriate to do according to the culture, to the religion. They focus a lot on duty and role obligations, and they tend to feel oppressed or trapped by their own sacrifices. Over here, Madam Fatima feels that her sacrifices will bring her barakah or blessings in the life here and in the here and the now. So she says over here, the doctor wanted to send me to a psychiatrist because I'm very stressed. I told him, you think by sending me to counseling it will cure my stress? They will only know how to talk, but I'm the one carrying the burden. I said that until I cried. So there's already this sense of I've given up on things you're trying to do to help me, because at the end of the day, I'm the one facing my father, I'm the one facing my loved one. And don't ask these people to go take a break, yeah? Because they will tell you that they'll feel guilty doing so. So we need to understand, how do we support people like Madam Fatima and Miss Nancy? Since I'm running short of time, I would skip this part, but I'm going to say that, or you can take photos. I'm going to say, it's very easy to present because I say, just take a photo, I'm not going to explain. That each of these stories represent a certain archetypes that's really distinct. And they differ in terms of how they manage care. They differ in terms of their relationship with their family members. They differ in terms of how they view filial piety and how they view themselves as caregivers. As you can see also, they're more satisfied and balanced. They belong on the other end of the opposite spectrum of filial piety. The reciprocal, people who engage in reciprocal forms of filial piety are more satisfied and balanced in their caregiving outcomes. Whereas those who think about filial piety in terms of authoritarian or wanting to obey culture or obey parents or adhere to norms tend to be more dissatisfied with caregiving. So at the end of the day, it's really about where does your self exist within your acts of care. So fulfilling filial piety when aligned to caregivers' self-determination and identity can be rewarding. But what we also found is that normative impositions of filial piety, when people tell you this is your responsibility as the child to care for your parents, or the reliance on filial piety as a framework for family caregiving does more harm than good. Mismatched filial expectations refers to a gap between expected rewards of filial piety. You care for your parents, so you expect to be affirmed. But sometimes some of us care for our parents, but we get shit on by our siblings. And that's not nice. And this is the experience of our caregivers. So based on our analysis, our team came up with this model to demonstrate the mismatch and how it amplifies and reinforces negative aspects of caregiving. So you can see the intensive and dissatisfied caregivers tend to perform duty of care. They are driven by really extrinsic forces of filial piety. They tend to talk about self-sacrifice. And on top of this self-sacrifice, they are also saddled with lack or no reliable family support. They have limited personal resources. They are not being affirmed, valued, or noticed or heard. They are exhausted and stressed. They also have less positive encounters in caregiving, a lot of conflict and tension to manage in a family, and then increasing demands of care over time. Based on all of these factors, you will crumble one day, and it really amplifies and reinforces the negative experiences of caregiving. So what makes a good caregiver? Number one, it is definitely not just about adhering to social norms and cultural expectations of filial piety. Good caregivers emerge out of good environments, contexts, and conditions. And to have someone experience good outcomes in caregiving, there has to be presence of positive relationships with the care recipient and other family members, access to timely and reliable support from other family members, that the caregiving load is manageable. And the caring for care recipient is more than just duty, it's also out of love. And this love comes about because it is a good environment, good relationship, good conducive conditions to begin with. Having the financial means to outsource care, the personal capacity such as knowledge, good health, being a problem solver, these are the traits that make someone easily become identifiable as a good caregiver. But it's not that there are bad or good caregivers. As I mentioned in my presentation here, good caregivers can only emerge out of good environments, contexts, and conditions. So what I'm trying to say is that everybody has the potential to be a good caregiver. But circumstances makes it difficult for some of us to achieve that. So how can we transform caregiving into good experiences? So the fulfillment of filial piety contributes to positive outcomes in caregiving, but caregivers require resources, healthy and supportive relationships, and conducive environments that can support them in their journey. So in ideal situations, caregivers shouldn't have to sacrifice in their journey to provide care. Nothing good emerges out of self-sacrifice. It compromises overall well-being and the fulfillment of filial piety through the impact on one's self-determination or your autonomy. There has to be a greater appreciation for the unique circumstances of every potential caregiver, and also, more importantly, the recognition of a caregiver's life history and interpersonal familial relationships. Just now when Doreen was sharing about her caregiving journey, she said, before I cared for my mother, I was this person. There's a recognition of that. If you want to help caregivers, there has to be ways in which you remind them of who they are before the caregiving begins, and during the caregiving, what they can do to maintain that identity. Focus policy and practice to enhance conditions that support caregivers' self-determination, including working with, rather than against or imposing, cultural frameworks that are meaningful and affirming to caregivers. So if someone believes in the filial piety model, find a way in which you can work that around to ensure that they are able to achieve self-determination. So lastly, interventions to support caregivers need to cater to diverse caregiving dispositions, especially in terms of identifying archetypes of caregivers that are prone to certain habits such as maladaptive or negative coping strategies, and to deliver appropriate interventions before caregivers hit their breaking point. And with that, thank you so much for your attention. I'll see you soon at the discussion.
Thank you, Dr. Art. Thank you very much. Our next speaker is Ms. Tan Ching Yi, Head Psychosocial Services at HCA Hospice Care. Ching Yi is a registered social worker with more than 25 years of working experience in the acute, hospital and community settings. She was awarded the Outstanding Social Worker Award from the President of Singapore in 2019 and currently oversees a team comprising medical social workers, a spiritual care counselor and art therapist in HCA. In her presentation, Ching Yi will be sharing more about the importance of self-care and explore the dilemmas, intentions, and aspirations towards care of the self. Ching Yi, please.
Okay, make sure I clarify to press the green button. Okay, good afternoon. Yeah, actually, I want to check in on how's everybody, because it has been a very heavy afternoon after lunch, isn't it? Nodding of head. And between me and T is you. No, just joking. Yeah, and I think I want to shift the focus back to us, me and you, and ask, what are you getting out of all the discussion this afternoon? Yeah, because a lot of information, a lot of very valuable insights that even I myself have gathered this afternoon. So apart from being a social worker, I also want to acknowledge myself as a caregiver. And I think a lot of us in the audience are family caregivers, professionals who are also caregivers. And just now afternoon, I had to pick up a call because my dad called me and said, my heart is squeezing. You know, I think I need to go to the hospital. And I asked, who's bringing you? He said, your sister. Thank you. You know, I'm glad my sister is there to help. But you know, compared to many of you, perhaps my journey is just starting. So many of you would have been a caregiver for a long time, and to be looking after someone, that's a starting point, right? The starting point is going for appointment, speaking to the doctors, sensing things around at home, you know, is changing, forgetfulness, you know, not being able to go out to do things in their usual way. So, okay, let me see. Okay, so I guess this afternoon, I want us to go back to ourselves and connect to the self, because a lot of what has been shared this morning and this afternoon, as I was hearing it, I was also connecting back to myself. You know, and I wonder whether do you see the glimpse of yourself in what's being shared, that I could perhaps connect with this point. Okay, I'm not a researcher, I'm a practitioner, right? I'm someone who enjoys sitting, hearing, and being present with my staff, with my patients, with my caregivers. And that's what I do well. So I don't do research and I have all that stats to show you. But I like to draw from what others have done through research to help inform me what I can do better. So, but there was this piece of work that was done, commissioned by SCS, that touched me very deeply. You know, and in HCA Hospice Care, we support persons who's dying and also their family members. It is really at the point when death is very near. And we hear stories about how things can be challenging, but we also hear stories that reflects the positive aspects of caregiving, the meaning behind. This is, after all, the last lap, you know, and we saw the energy that the family put in, you know, to walk through that journey. And just as the stories shared by the 10 caregivers in this, I thought I want to share this that I copied from the publication that really reflects what are some of the emotions the caregivers shared. Right? And caregivers among us, could you identify with some of these feelings? Yes, right? Yeah. And I'm sure in your journey, there will be times when some of these feelings come together. Right? I feel tired. Very tired. Yeah, but I worry, what if I take a break? Something happens. What if I just go down to the hawker center and grab something to eat? Then something happens. And that fear is very real, right? Yeah. Can I trust my sister to look after my dad? You know? Yeah. Can I trust that she asks all the questions that need to be asked? Right? Can I trust myself that I can concentrate here, speaking and sharing, while that all the things that need to be taken care of will be taken care of? Can you see that tension that as caregivers we have within ourselves? Right? I see your nod your head. And that is the tension that is probably gets very familiar because it's every day. Right? You wake up, your eyes open, you plan the day, there are decisions to be made. That when there's decisions to be made, it means you are weighing several points, several things that need to be sorted out. And therefore, what goes on within? What do we do with the tension points in us? And that's a reality of providing care. That's a reality of life, actually. Right? At work also, we make decisions. At work, we also face challenges. What do we do? How do we cope? Right? What do we do within ourselves to manage those tensions in us? Okay. So there's some insights from this. I will not go through because I think today we have gotten a lot of knowledge. So do take pictures if you wish. But I guess some of these insights, what do we take back? This is also familiar, right? Yeah. This constant survival mode, we have to stay afloat for others, is very real. Okay. Yeah. That sense of burden was very much talked about this afternoon. Right? Yeah. The sense of responsibilities, the sense of what needs to be done, right, day to day, is very real as a caregiver. Right? So, what's our story? Right? So going back to the self, what am I taking back from today? What am I going to do with all the information that I get from this session today? Whether is it for myself or for others? Yeah. I mean, as a social worker, as a caregiver, I try to use my knowledge with my family, but it's very hard. As a social worker working in a hospice, when my grandmother at 104 was in a hospital and was dying, I realized none of my knowledge could be applied. Yeah. I could do nothing except to be with her, be with the family. Because in a family context, there's family dynamics. There are relationships. There are people who make decisions, and we find ourselves, our role, to be in the context to do our best in. And at some point, I felt that, if given a choice, this is not how I would decide. But that's the tension point. But what did I do then with that tension point? Is to trust that whoever is making decision is making decision from the best interest of the situation. And transforming that tension into seeing what's that value, what does it say about the family, that everybody is so concerned. Does it matter who made that decision? Or does it matter how decisions are made? Does it matter that, what matters most? And I guess after the funeral, my uncle told me that, what's most important is harmony. And that value of harmony was important. And that's the story of my family, and to my parents as well. Harmony is important, right? And therefore, going back to working through the tensions, we go back to thinking about what do we value, what do I value, right? About decisions making. Right? But there's aspects of not just the caregiving, but going back to ourselves, right? It is always then going back to ourselves, the tension points that happens in the caregiving, it happens at decisions, happen at the day-to-day life, but going back then to me. Where am I in this whole space, right? So my question to you is, back to now, here and now, what kind of day are you having today? This opportunity to sit here, to be together, to hear each other and to learn, right? Did we decide that today would be a learning day, an easy day, a challenging day, a day that I feel a little guilty, a day that maybe I feel a bit more relaxed, a day that I would just want to enjoy the good food that this conference offers and just enjoy, right? After I step out of Suntec, okay, I go back to my usual workspace or home space or caregiving space. But it's that decision. What do we want to make of the time here and now? Right? A time to hug, right? A time to say hello, to connect. And that's the permission that we give ourselves. Right? Then what kind of day are you having tomorrow and the day after? Right? Because the conference will not be happening tomorrow. Right? It's a one-day conference, a very good, solid one-day one. Then how would be your day like for tomorrow? Right? Yeah. And it's something that we ponder, right? Because after the session ends, we go back to being a caregiver, go back to our home space, go back to a space where we are most familiar with. Right? Go back to whether the sense of busyness, that sense of burden, that sense of the list of things that I need to do, the sense of filial piety, the sense of I'm doing it, because of whatever reason. What would today be like after the learning? What would be tomorrow? What would tomorrow be like after the learning today? Right? And I guess that is the thing about making a decision for ourselves. Okay. So in HCA, we give all our caregivers a booklet where we invite them to do a very short, this Q&A. You can find a copy of this at our booth outside later. And perhaps I invite you to ask yourself some of these questions. And if your answer is yes to the above statement, it may indicate that you're more stressed than usual. Right? Yeah. So the importance of self-check is needed, Yeah. So again, going back to ourselves, how are we now? How are we feeling now? How are we feeling today? Am I feeling stressed? Am I feeling okay? Am I feeling not so okay? And knowing that it can fluctuate from day to day, from moment to moment. Right? And that is just being very human. Okay? Yeah, that's just being very normal. Because if life is a flat line, it just means we are dead, right? Yeah, nothing. But this life there's ups and downs. There are good days, there are bad days. There are okay days, there are not so okay days. There are crazy days, but there will be very calm days. And we can all connect to that. Right? Yeah. But are we able to see how are our days? Yeah, have we think through, or do we see that all our days are bad? Yeah. So I think going back to the self, it is really developing that mirror within ourselves to see where are we. And to know that at the fundamental level, we are all human. Right? And we ask ourselves, how are we taking care of ourselves? Yeah. Okay. So from today's discussion, we appreciate that actually we all cope quite differently. Right? We all have different coping mechanisms. Some might choose to do the day-to-day work and do it very well because that's where the satisfaction I get make me feel good about myself. Yeah. But some of us might choose to go out with friends occasionally and still keep the part of ourselves, our identity. Some of us might choose to pray, might choose to read, might choose more sleep. But at the end of the day, are there time for ourselves? I think one of the speakers was sharing about the identity, right? Do we still have the me the self as we are caring. I think one of the greatest challenges as a caregiver is we constantly put the person we are caring for at the top of the list. Right? How many of you agree with that? Yes. Right. And there's no doubt about it. Because no matter what's the reason why we choose to become a caregiver, we put that as a priority. Yeah. Right? But over time, when we stop taking care of ourselves, we lose ourselves in that midst. And what happens thereafter? Right? What happens thereafter? Where is the me? Where is the person that I'm most familiar with at the end? So in HCA, we tried to organize a forest bathing session recently. And 2 caregivers came. There were quite a number of attendees, but 2 caregivers who came shared with us that, when I was caregiving, it was almost impossible for me to leave home. It was impossible. I just felt I need to be with my mom because things were very tough, and my helper would not be able to cope alone. And Mom has passed away, and she's decided to come to the forest bathing session. And it struck me when she said, but now that I've got all the time that I have, Mom has passed away, my life is a blank sheet of paper. It felt like I had to restart drawing my life again, and I'm not sure how to start. And I think this is what Rahul shared earlier this morning about that sense of, after our loved ones has passed, the adjustment, it is something that is very real. And drawing from the stories of the caregivers that we look at, that we listen, and that we hear, what does it tell us about ourselves today? Yeah. So if we ask ourselves, is there that part of me that is still here? What does that mean? Can I continue to do the things that I enjoy? Can I find times for myself? Can I find time to have my needs met besides just the person whom I'm caring for? Right? And I think that is a decision point. And that is really visiting. If our answer is no, it's very hard, it's impossible, I think that is a reality that we face. Right? And I think no one can fault us for making decisions. But for us, for ourselves, it is a decision point where we think about and we make a decision. Just as how you make the decision to sign up for the conference and make time here today, what are the daily decisions that we make at every tension, every decision point that takes care of ourselves as well? So we're not saying you take care less of the loved one, no. But how do we build in that system and that mechanism where whatever we do, there is that component where it is for myself? If we lose ourselves in the midst of caregiving, what might that mean? Right? I think that's something we have to ask ourselves, right? So, okay. Yeah. So this thing about work and rest is something within our organization we are really studying very seriously. As an organization, taking care of professionals who take care of patients. But it applies to every one of us, right? Work, caregiving itself is work, it's tough. But rest is also important. And how do we balance that? We talk a bit about well-being today, right? And recently when I attended a session, someone was telling me, happiness is not a goal. Right? Happiness is part and parcel of what you do every day. It's not something that you say you want to reach. Happiness is what you get day to day, same as our well-being. Like we were sharing, right, with my colleague, we say, oh, you can't wait for that one big holiday, take a plane somewhere to feel recharged. Recharge every day, just like how you charge your phone every day. It needs that as, we need that as human. And I've also learned after 30 years of social work where I can't wait for that holiday to not feel burnt out. Every day, I must find at least a few minutes of holiday. What would be your holiday every day, even if it's going to take 2 minutes? Right? Okay, I think that's the commitment that we give ourselves, right? Is it an option we give ourselves? Is it our right as a caregiver, for ourselves, right? So before a caregiver, it is me, right? It's a self, right? So again, really think about, inviting you all to really think about what do you do for your own self, for your own well-being, and for your own happiness. Right? And I like this quote from this person, because people say, oh, happiness, peace, very big words, but as a caregiver, you think, wow, you don't even think about this. Every day was just busy. But when we have time to ponder, at some time, maybe midnight or one day, or when I'm watching a movie and all of a sudden this thought came to my mind about, am I happy? How am I doing? Is this what I want? How come nothing sits right? Or maybe, wow, this is really a feeling that I cannot explain. But every experience in our life indicates to us is that moment of realization, moment of appreciating what's going on within us. Right? So this quote I really like because it talks about happiness taking a lots of choices that are sometimes hard to make. Yeah. Some people say, it's very easy, just, like they say, oh, if you can't look after, then just choose the nursing home. It's not so easy, right? If it's so struggle, why not get a helper? Is that so easy to decide? To some, it may not be so easy, not so straightforward. Right? But what is it that it is for us to make that choice? Okay. And I want to share this about, it is about a comfortable sense of balance. We are not even talking about what are you balancing. That is for you to discover, right? Okay. What will work for you? What are you balancing in your life that provide a space for you to take care of yourself? Yeah. I could do a long list of what are the self-care strategies, but I decided not to present that long list because so what if there's 100 things about self-care strategies? Okay. Yeah. It is about us believing first that I think I need time for myself. Then Google works wonderfully. Or ChatGPT. How to care for myself. It will give you thousands of suggestions. And just pick one. But at which point you decide, yes, this is what I want to do. Right? So what it means well when I'm well, and you ask yourself, what it means well for me when I'm well? Right? The commitment to take care of the self. And what it means when I'm not well. I'm not even defining what is well means, right? It can be different for different people. And only we know whether are we well or not. Okay. So when I'm not well, what do I do? Right? Is there someone that I can go to? A family? Is there someone I trusted that I can talk to? May not be family, could be a friend. Could be the auntie who's selling me the fruits every day. Right? It could be my neighbor. Yeah. It could be my pet, talking to my pet. you'll be talking to my God, right? If you have a religion, yeah. But when I'm not well, and I know that I'm not well, what do I do about it? Okay. So I this is perhaps a few things that I'll show you about resources. Mindline.sg. So you might want to Google now, bookmark and explore. Okay, yeah. So it has whole lots of information that you could explore. Yeah, support go where. Carol has presented. I like the way they say support go where. Maybe tired go where, right? Sleepy do what, you know? Yeah, it's very catchy, right? Yeah. Okay, so explore, really. There's lots of resources there, right? Yeah. Then my legacy. This website shows what we can do to start planning, especially when our loved ones, is coming to a phase where the end might be near, right? And it gives information. So all this website gives information. But then if you need someone to talk to listen to, maybe the Carers Hub, right? Explore that. Or a few hotline, or reach out to someone, okay? Right? NEA also has a website with a lot of information about death and post-death matters. I think very few people know that there's a website that offers such resources. But the website has been there for many, many years. Very useful website, okay? Yeah. Yeah. And know that you matters. You matter because you matter. Right? So a lot of discussion focus on person with sickness, person with illness, but then this platform today really offer us the opportunity to know more about us, right? To get knowledge about, what does caregiving looks like? Am I a good caregiver, right? Really allow us to connect to those concepts that allow us to know more about ourselves. But what do we bring back with us today? What would help us? What would guide us? I think it is the me, right? The person in me who has to make those decisions. Right? Yeah. So I wish that we all leave the session not only feeling enriched, but to feel empowered that decisions that we make for ourselves means a lot for ourselves, means a lot to ourselves, but also means a lot to the person we are caring. So when they see us well, it means a lot to them as well. But I think most important to continue this journey, I hope we stay well and keep well. Okay. Thank you.
Thank you, Ms. Tan. And also thank you to all the presenters who presented this afternoon. Much appreciated. I think it is a very good time now to break for 15 minutes, and we'll see you in 15 minutes back here again. The reception area is at the same place. Thank you very much. See you in 15 minutes. Welcome back, ladies and gentlemen. I just want to share again what Dr. Tiong shared this morning. There are possibilities of making a contribution. If you could pick up one of the paper flowers where you made a registration this morning. They are handmade by the seniors at HNF Wellness from Buangkok. And you can plant it at the exhibition area and make a contribution straight away. So they're just outside. On the way out later on, you can still do that. Thank you very much. Now, on to the final segment of today's event. And I believe most of us here are looking forward to our second panel discussion on the needs of caregivers and services available. Let's welcome our panel moderator, Brendan Yong, Head of Social Work at HNF. And our 5 panelists, Carol, thank you, Susanna, Dr. Art, and Ching up on stage. Thank you very much. Also, I would like to invite Ms. Yvonne Tay, Senior Medical Social Worker with HNF, as one of the panelists as well. Big round of applause for Ms. Yvonne Tay. Brendan? Yeah, thank you.
Hello, hi. Good afternoon again. My name is Brandon, if some of you haven't recalled. I just got reminded that in the group here, there may be people who hasn't got their mobiles with them. So you could not pose your questions on our Slidos, our questions. So if you would like to address some questions with our panelists here, so please feel free to raise your hand and someone will pass you the mic for us to also address your questions. All right? Yeah. So today, I am the moderator for this segment, exploring the topic of caregiving landscape and support system. So a quick recap of our panelists here. We have got Dr. Maulod, Susanna, Carol, Ching, and Yvonne. So together, we will explore what is the landscape that is in store for us now, and maybe take a glimpse of what the future holds for us in the caregiving landscape. Maybe I start off with Carol. That in your sharing, you mentioned about the awareness level of our caregivers. Could you also share with us for the areas that the caregivers has feedback it wasn't so aware? Nationally, how can we help to also raise the awareness of caregiving resources?
Okay. I think first, important for the caregiver to be aware of their role first. Okay, so I think the easiest one I would say that is why not is share the caregiver campaign by AIC. So through the social media, through the different network, that the caregiver are aware that they are, by doing this task, this role, they are caregiver. Then after they acknowledge that they are caregiver, then they will know that, oh, okay, there's time for me to step out. There are resources available, there are services available, there are schemes available. I would say that actually one thing is that on our campaign website, we have this WeSeeYouCare campaign website. There's a consolidated website that we try to consolidate the info for the caregiver, do not need to go everywhere, anywhere, and also a more trustworthy website. I think another one that I think HNF tried to build is that this hub is also a consolidated net portal that the caregiver can actually go to as well. So I guess to me, the awareness, first step definitely is to raise the caregiver own awareness of their role. Second thing is that they know what are the one-stop portal for them to actually go in to find the resources. Yeah.
Mm. And could you also, since you are at the AIC at the agency level, could you share with us what can we expect from the future caregiving landscape?
Interesting question. Okay. I think we all know Singapore aging population. Okay, we have more elderly, and also now the family size getting smaller. Okay, which means in the future more caregivers have to look after their care recipients. Okay, and we all know technology is one way going up. I think in the future, definitely, tele-support, okay, AI, all that will definitely come to handy. We will definitely need to make use of more of the tele-monitoring to help in our caregiver role. Likewise, I think we also try to, all of us, in a way, are more tech-savvy. I think all of us use handphone, okay? How we can actually use this to actually use AI to provide more personalized support for the caregiver, I think that should be the future trend. And another one thing that I will emphasize in the future, what we hope to achieve is that I think currently all our services are quite siloed in a sense that we focus more on the care recipients, okay, either in the hospital care, in the community care. In the future, the best is that when our caregiver services or caregiver needs are being looked into, are being roped together as the conventional service. So it will not be just the care recipient on its own. When we look at it, it will be the care recipient and the caregiver as a dyad, as a pair together. That will be my vision. Yeah. Thanks.
Thank you very much for giving us a glimpse into the future, what caregiving can hold for us. We have shared about nationally, how can we see caregivers? I think the next person that I would like to really invite to share your opinion is really Ms Susana. You are involved in overseas policies in the caregiving space. Could you share with us, comparing to Singapore context, what have we done well and what can we learn from there?
Okay, what have we done well? I think it's not about comparison. I think it's about understanding the differences, the context, because each of the countries has their own context. So definitely comparing, say, caregivers in Canada as against caregivers in Singapore, probably we have some sort of similarities for highly urbanized countries or cities. But say a caregiver here as against a caregiver, say, in India, slightly different, but I think there is some common needs and unmet needs. So definitely we, in Singapore, I remember when I first joined the foundation back in 2002, we actually started to talk about caregiving already as a foundation. We've been trying to raise awareness about the role of caregivers and then how we are, we need to prepare and then understand. It has gone a lot better because now, we have an agency for integrated care. There are platforms like this that regularly provides platforms not just for professional but also family caregivers. So I think these are good practices that I think from Singapore, from our experience in Singapore, are good practices to have for societies that have an aging population. So I think we are on the right track, definitely. But as actually Carol's point about her wish, actually we're piloting it now in the foundation. We're piloting a protocol whereby when a care recipient comes to any of our services, whether it's primary care or care management or day center, we don't only develop a care plan for the care recipient, but we also develop and start a conversation with the caregiver who comes with the care recipient. So we're piloting it within our own service. So your wish, I hope we can continue this conversation, because I think we need to pilot test it. I think this is one good practice in Singapore, that we are working together. There is enablement, there is a more aware and responsive policy environment that allows us to pilot test how do we become better at addressing the needs. What always have an advocacy kind of try. What we don't know yet fully for Singapore context, which I think in other countries is also, not just in Singapore, are the unmet needs. We know the needs, but there's also that unmet needs. So we need more research on the unmet needs in Singapore for caregivers. So I think the ad might have some ideas.
I can do a lot of research, yeah, and I can present a lot of unmet needs. But if no one is listening and doing something about those findings, despite many outreach attempts, then I think I can do anymore.
No, I think that's one good practice, I must say. I think there is more willingness to listen from stakeholders. I think we need your support. Caregivers, working with professional caregivers, we need more of your voices to be heard. We can present, as Ad has said, but if you don't come forward and say, I'm a caregiver, this is what then, the power is actually in all of us, collectively, as a community, providing the evidence, our stories of what exactly do we want our own journey to be. And I think, in fairness to AIC, they're good listeners. But we need to kind of go up a little bit higher, perhaps, and then really engage with the support of AIC, engage more stakeholders who would then be able to provide both the necessary policy enablers as well as some resources to be able to do more. So that in a nutshell, quite a long answer to your question, but we are doing much better than when I first worked with Tsao Foundation in 2000. Definitely much better.
Sure. Thank you for the answer, very comprehensive answer. I think that is not a nutshell, that is very detailed answers to the question, which is good. So let's keep the spirit. What I'm hearing from Susana is that there are social, economical, even political contexts that affects caregiving. Earlier on, if you recall, I mentioned about caregiving as a complex subject. And this is how complex it can be. The macro factors affecting your individual experience as a caregiver. So just now I'm also hearing that AIC has been doing a lot of work in the background to support caregivers and to roll out even some of the research findings. So amongst the family caregivers here, if you have not heard about AIC before today, you have missed a lot. So please, after today, log on to AIC website and you will find WeSeeYouCare. Yes, WeSeeYouCare. So that's a call out to also all the caregivers here. These are the resources that you can tap onto. I think another call I want to make, but before that, let me just go to Ed and maybe tap on your understanding. How easy is it to get the research participants? Because if we need to have good impact, real impact to the caregiving landscape, it starts from knowing It starts from research. So if we don't have participants, that's just all empty talk. Ed, please, how easy is it to get our caregivers here to talk to you?
I don't want to be a self-conceited researcher, but I think very easy because I think doing research is not just about extracting data out of someone. The kind of research I do is ethnography. It's really about having people lend me their voice because they feel like no one's hearing them. They feel silenced. They feel like there is no avenue for them to articulate the issues that they're facing. I mean, no one's going to tell their friends or their family members, I wish my mom can just die faster so that I can have my life back. But you can tell me that. You can tell me that, and it's a safe space, and I won't judge because I understand what made you say that. What are the contexts that you're facing that shapes you to say those words? I mean, it's those words that are precious because I'm not judging your intent to kill your mother, but I'm thinking about the situations that you're facing, the challenges that you're going through that we need to address so that you can become better for yourself. Not for your mother, but for yourself. So that's why I said if I'm doing research and I'm inviting you, you would definitely want to take part in my research study. And I'm going to be a researcher forever, so I'm going to remember all of your faces. But I also want to touch on about the idea of a caregiver identity. I think Carol mentioned that we need caregivers to have a sense of identity, who they are, so that they have an awareness of what they need. But this is like a chicken and egg question. If I were to say, if someone were to ask me, so Art, what are you doing right now? Oh, I'm a dad. I just got a kid. And they'd be like, congrats. I didn't know that. But if I say I'm a caregiver, they'd be like, oh, I'm so sorry to hear. Now, who would in their right mind be proudly brandishing that they are a caregiver to their friends? Because Doreen said the friends go, Doreen, you're MIA already, caregiver already. People would avoid you because they feel like, oh, they don't understand your burden, they don't want to stress you out, they're a caregiver, later if you say something, they will cry or they get so stressed out. I don't have the bandwidth. Because friends meet to have fun. Now she's a caregiver. How do I deal with that? So people are thinking also about how others are viewing their identity, and your identity has changed when you become a caregiver. You would know this better than I do. I only understand caregiving through you. Yeah.
Thank you. And just now, I just want to go back to the concept that you have helped us unpack, which is filial piety. I think that is a very interesting concept. I think that's a very interesting concept about reciprocal filial piety. I think amidst us, I presume many of us are coming here on reciprocal filial piety. And if a caregiver wish to move to a different quadrant, just like you mentioned 4 quadrants, I wonder if your findings has showed that there are caregivers who manage to move between different quadrants, and if a caregiver wants to move to, for example, a balanced quadrant, how can they do that?
That's a very good question. I didn't think about movement because our longitudinal study is only 1 year. People don't move so much within 1 year unless significant things happen. So for example, you can be reciprocal and then you lose your job. And then your husband gets cancer. And then you start to feel like everything becomes difficult for you, so you're just operating on autopilot mode. There is no will in that autopilot mode. So I've seen people actually move down from reciprocal to more authoritarian, doing it for the sake of doing it because they do not have bandwidth. But I also seen some minor movements between like a balance, between more the more authoritarian to more balanced because they have gotten like family to help them out. They're saying stuff like, oh, somehow or another now I had an argument with my siblings, we all cry, and now we decided that we are going to help each other out. But then it's very rare to hear these kumbaya stories. Typically, when you start caregiving and your siblings abandon you, they continue to abandon you. That is the story that I've heard. But if they've been helpful right from the start, it's like you have all these happy reserves working with your siblings that one day when they are not able to help you out, you are more likely to think something's going on in their lives. It is not their fault. I'll try to find other means to help. Yeah. Family dynamics are the things that are very difficult to change based on our research. And if you can modify that, if you can change the family dynamics to something more positive, it would mean the world to the caregiver. So we cannot just look at caregivers and care recipients as a dyad. We need to also see where this dyad is embedded in within the larger family ecosystem. So that is, I feel, the future of caregiving support as well.
Well, I think you speak so much like a social worker. We always talk about not just the caregivers, not just the patient, but the caregiving system. And within the caregiving system, there are family who influences that dynamics. And then, of course, the community plays a part. Yeah,
I look at Doreen, and then I look at 3 sisters behind. There's 3 sisters, right? Yeah, I mean, that image stays in my mind throughout the time I was sitting here. It's like she's not alone, you know. There's 3 sisters, and they all look damn garang. Like I will protect Doreen if anything happens to her. There's that vibe, and that's what I see in the data, especially for caregivers who are satisfied and balanced. They never felt that they're alone because they're just speaking on behalf of their siblings, but actually their siblings are like whacking them from the back, giving them things to do, and supporting them willingly, and very important, willingly.
Yes. I think thank you for the candid sharing. Just now I noticed that the floor has got question. If we could pass him the mic.
Yeah. Hello. I'm addressing this question to the Home Nursing Foundation. I noted that before 1960, Home Nursing Foundation was in existence. Is that true? Before 1960, Home Nursing Foundation was in existence. Before 1960.
No, we started out in 1976.
Right?
Yes.
I was in the police force. There was the Home Nursing Foundation.
The Home Nursing Foundation started in 1976.
Cannot be. I know there was 1960, there was one before 1960.
I make sure I check with our CEO before answering you. So she has verified it's 1976.
It's very funny because I noted that when I was in the police force in 1960 in Tanjung Pagar, there was a Home Nursing Foundation.
How about maybe you can let us know what you would like to find out about that part that you had
because
shared.
how many wards do you have now in Home Nursing Foundation sector? How many sectors do you have now? How many branches do you have?
Patients, did I hear you right? How many patients I
How
see?
many branches? How many branches do you have now?
Branches. Okay, if you're referring to centers, we have got 2 senior care centers.
2 senior care centers
in
from 1960 to now.
And in
That's very
Hougang.
poor. Let me be a administrator. I will increase the number.
Sure.
HDB,
So do you have questions that you would like to ask the panelists?
Yeah.
Because we don't want it to be
Have you all approached
advertisement for
Have you all
H&M?
approached HDB? Have you all approached HDB? HDB to set up sectors, branches.
Okay. Sure.
And what did HDB reply to you?
Yeah, I think it could be part of the carers hub now that they're looking at branches localized in your presentation. See, I listen to you.
Thank you very much.
They want to look at chapters. So potentially there could be more branches of HNF in various parts of Singapore. So, yeah.
Yes. Yes. Thank you for answering that for Ms. Susana. Okay, we have got another question here. That's the mic, please.
This morning, is it Dr. Samuel mentioned about psychotherapy in the family, and Dr. Maulod also mentioned about that. Since we are also looking at integrating everything together, and AIC is actually the platform for bringing about caregivers, etc. I just wonder whether it could be something that is also placed, this whole thing about psychotherapy or family systems, how important it is to be placed inside the website with resources available so that families actually look into that and address it. Because if the public or people or families are not even looking at that, or they don't have this education aspect of it, I think when we try to solve the caregivers or care recipients issue, this is definitely a big aspect that is going to cause this losing our equilibrium, etc. So I personally think that my suggestion is, could AIC actually consider putting this, even this whole part about family coming together, and let's see how we can work this out. Yeah, thanks.
Thank you very much. It's a very good question, actually. Okay, I think we all hear from this, all the experts here, actually sometimes where you say that in terms of the caregiving, it's not just the care recipient, the caregiver, actually involve the family as well. So I think just now in my slide, I mentioned that there will be a caregiver conference coming up next month. One of the key topics that we wanted to actually have the overseas expert to come to share is family-centric care. Okay, this is one area I think that we need to learn exactly what does family-centric care, what is it about, how we go about doing it. Yeah. So thank you very much. Indeed, I think this is one of the key things that we want to learn in the upcoming conferences on the 8th November. Okay. And certain things, for example, like the baby steps that we are taking on before we can reach this stage, that is that for upcoming, we are doing family caregiver training guide. Okay, so this guide we want to share with the family what are the different skills, what are the different, aside from ADL training, okay, there are a lot of other things that we need to learn, okay, even though like communication or like what are the things that we need to know in order to ask our healthcare professionals, okay, or maybe what are the conditions that we know. So all this, with all this information, then the family can make better decision, okay. So we're going to roll out the guide, okay, maybe to actually share with the family, caregiver, what are the different learning knowledge or technique that they need to know in their different journeys as well. But yes, thank you very much for the family-centric. I think this is definitely one of the things that we wanted to learn more. Yeah, okay.
Can I add to that? I hope you would also consider that currently the data can confirm this. 29% or 27% of caregivers of older people are single, so they don't necessarily have like a nucleus family. And moving forward, we would see more of this kind of like a not biological. Perhaps that's why maybe while we are, it's important to look at it from the family-centric care, but we also really need to kind of maybe perhaps family of choice. Which is actually something that we learned from the US model, that it doesn't have to be biological, but people that you connect now, people that potentially could be part of your care network, that's within your ambit of that they can be there for you as well, not necessarily just your siblings or related in that sense. So I think perhaps that's my appeal as well, that we need to also consider those that are single and doesn't belong to a family of sort.
Actually, Carol, if I may add also, I think the website that your presentation is about the initiatives, right? And HNF is about having the website, right? I feel that our data also shows that most caregivers are unprepared to take the role. And if you're so unprepared, you're so overwhelmed, all of these things that you have to press, you have to click, you have to go, you have to refer, it is incredibly even more overwhelming. I just want to shut my laptop and sleep. And that's the reaction that I get from caregivers as well. When I look for something, can I find what I'm going to find or not? Or I have to find and search more things and then have to fill up more forms and then I have to go and see this and that and that, and then you know what? Forget it. I think I'll just wait. How do you resolve this? I mean, having another website is another thing for the caregiver to press. Yeah.
May I just add something? Yeah. I think that the idea of a family-centric care starts off with us recognizing what are we experiencing beyond just the patient, just the person who's ill. So among us, there's quite a number of professional caregivers here. The question is whether when we check with the patient, how are you? Are you taking your medication? Are you got pangsai wo and all that? We also need to shift to face whoever's accompanying them at the clinic. or whoever we are seeing within the family during our visit and check, how are you? How's everything at home? Because there is a virtual family there. This person sitting in front could be representing a community of other family members, right? So if I meet Doreen, I need to imagine behind Doreen there's a group of family members who are interested. But if I do not shift my vision beyond the person who's ill, I would not be able to see who's behind caring for this person. And I think that it works two ways. As care professionals, as professionals, we need to go beyond the person who's sick, the person who we dispense medication, but see the person next to them. Be it a foreign domestic helper who's looking after, or a family member who's accompanying for the first time. Do a check-in. And I think it starts from there, to know that dynamics, to know that the environment that they're operating in, to know that how do they seek help, and what will make sense to them. In what way they want help to come to them. Right? Yeah. So that it stays relevant. In HCA, we also tried to develop a caregiving app. Okay, you can go in, do self-care, learn caregiving tips and all that. The take-up was very low, and we wonder why. And actually, the reason is, all those that we've discussed today, right? Yeah, technology could be helpful but difficult. It can be, helpful, but I wouldn't have time. Maybe what I need is not more knowledge, but I need listening ear. So how can we be relevant and be at the point of need? I think that's something we also invite caregivers to say, you come and see me, thank you, but I don't need all this. What I need is this. So how could we also help caregivers and patients to speak their mind and feel safe enough to share, this is what I need. Give me what I need. Thanks.
Thank you, Ching. Yeah, just now, sorry, in the interest of time, maybe I'll just address this point that the speakers has mentioned. So I always share with my caregivers that caregiving is like a prism with many faces. So whatever that is visible to us is often the front of the prism. What we really need to do is to look at what's lying behind. So just now, the panelist has cast some light on the different facets of caregiving. We heard terms such as family-centric care, psychotherapy, and accessibility to services. I think the next exploration would be really to turn to our practitioner. Yvonne, you are a social worker by training. You would have observed many caregiving scenarios. Could you share with us, in your line of work, the support systems or the needs of caregivers that you have seen?
Okay, thanks, Brandon, for the question. So I think when we talk about caregiver, I really like what Dr. Art was saying earlier. What makes a good caregiver? Actually, what makes a good caregiver is actually a good environment. And how that environment comes about is that it's really a community. The caregivers can't work in silos. We ourselves, we can't work in silos as well. So there must be a lot of system and layers in it to actually help support the caregiver so that this caregiving journey can be positive and rewarding. So, at the macro level, we have systems, we have policies, legislations and all that can continue to make a very good impact on caregiving and their journey. As care providers, we can also work to collaborate and strengthen our referrals, share ideas on how to actually enhance support, and so I'm actually quite heartened to actually come to see that there's actually a lot of representatives from different agencies who are actually here today. So conference like that or even like the Caregiver Hub that Brandon actually mentioned earlier, would actually be a very good platform for us to collaborate and foster a greater relationship. And that's ultimately for the betterment of our clients, our caregivers, and also the community as a whole. Yep. And, you know, everybody has a part to play. If you are employer here, your bosses here and all that, allowing the provision of flexi working hours or, you know, parental care leave, family care leave, all this will help our caregiver juggle their roles better. And I think more importantly, it's not about the provision of leave, but building a culture, a workplace where it is inclusive, it is compassionate enough that, you know, if your staff is a caregiver and they need to take leave just to be taking care of their loved ones, they're not being penalized by that. Yeah, and, you know, family members and friends and all that, like what Ms. Doreen said, I need socialization. Caregivers, they are humans too. So they need the safe space to share their emotions. They need an outlet to vent. Yeah, so invite them, continue to invite them to socialize, to hang out. And I think one thing that is quite important is also refrain from giving unsolicited advice, because ultimately we are not the caregivers. We are not in their shoes. We don't know truly what they are going through. So rather than giving advice, give affirmation, give validation. And this will actually really go a long way. And family members will also have to understand shared responsibility. How can we actually help? Provision of physical care. If not, then, you know, there are other methods like helping navigate healthcare system, providing even more financial support. These are ways that we can also help caregiver. But ultimately, the core is our caregiver, right? So like what the other speaker has said, one thing is that recognizing you yourself, you're a caregiver. Secondly, I think really the caregiver has to understand that, you know, you matter too. You are actually just as important as the person that you're actually caring for. So I think a few things that please learn to also prioritize. So prioritize your task. What is important, you do now. But what is not, we can actually shelve it aside. If it's secondary, we can delegate tasks to others. We can reach out to a family member. And I think a lot of times when we work with family members, a lot of caregivers, they don't want to reach out. But because they see reaching out as a sign of weakness. But in actual fact, reaching out actually shows a degree of awareness of your situation and shows resilience and tenacity more than anything else. So, if you're a caregiver, I hope that you learn to be kind to yourself as well, so that this journey, right, can cultivate more happy memories and rewarding and sustainable journey. Yep.
Thank you, Yvonne. You reminded me of my own work with caregivers, you know. Sometimes I hear caregivers, they experience such a scenario. They share their difficulties with someone by mere seconds, and that person can give the whole string of solutions for the caregivers. But do they really understand the problem? Do they really understand the caregiving situation and dilemma that the caregivers could have, you know, faced? So sometimes it surprises me that someone can give a whole string of solutions before hearing exactly what the problem really is. So I guess in the caregiving support narratives, like what Yvonne has mentioned, really is listen first before we talk. I think that helps a lot more than just giving solutions. Yvonne, just now I also heard you mention about inclusivity in caregiving. I got reminded that some cases they will come across as, oh, because you are the eldest child, so you take care, right? So there are these, particularly in the Asian culture, there seems to be this thread of expectations. Then comes linking back to Dr. Ed's concept of filial piety, authoritarian filial piety. So I wonder, as practitioners,
how can we make it more inclusive? How can we promote the family systems of caregiving rather than, simply because you are eldest in rank, so you take it up? Yeah. Could you share your experience in that? Yeah.
Sorry, hello. Yeah, so it is actually not uncommon. So like what Brandon has shared, like we do see actually a fair share of cases like that where the role of caregiver naturally goes to the elders. Normally it's between two spectrum, either the elders or the youngest. And it's actually quite prevalent in more traditional Chinese family. This is what we actually observe. But I think ultimately we actually have to think, are they really the best choice? Let's say the elders, they are probably the oldest out of all the siblings. They probably have their fair share of health condition that they have to manage. So are they really physically that able to manage the care recipient? Similarly, for the youngest, they might be at an age where they are probably branching out, their career is taking off, or they are at a phase where there's transition in life and getting married and all that. They might not have the bandwidth to be able to take on or commit to be a caregiver. So we do see issues like that. And as a social worker, normally what we'll do is that we'll call for a family conference. And really it's actually to provide that platform where everybody's voices are being heard. Everybody's expectation, your perspective are being heard, and then in that way we can actually try to facilitate and hopefully come to an informed and agreed decision. But of course I have to say we are medical social worker, we are not miracle social worker. So like what Dr. Ed said, family dynamics and relationship, they are very, very sticky. So oftentimes we really need to pace with the family member, work with them. One session is normally not enough, but I guess it is a continuous conversation, and when you get the family members to come together, at least they hear each other out first. Yeah.
Oh yes, please.
I think if we want to talk about family-centric care, it can take a whole day conference. But I guess for the benefit of today, and we can at least try to put a perspective about families, right? Families are made up of people, and we relate to each other differently. Some families work in a way because of the family values that the elders make the decision. So there is the decision-making component. There's also the actual responsibility component can be different. I might make a decision, but I might not be the one doing all the work, right? But some families work in this way where whenever there's an issue, we all come together to sit down and we share that decision. Some families defer to the expert. If the expert is the youngest, most educated, the expert is the doctor in the family or the social worker in the family, that can happen. And when different families function in a different way, and when that's how we appreciate. When does it become an issue or a problem? Sometimes when the decision is so big that the eldest person alone cannot carry all that decision by themselves. Sometimes the task is so challenging that the only one available cannot carry it alone. That's when situation happens. Right? Sometimes when opinions are so different that family come together, the fight breaks out instead of their usual, give and take. So stresses happens, and therefore we learn to recognize that it is stressful. Then what do we do about it? And I guess just now someone asked about the psychotherapeutic part, right? At which point the way we deal with our life situation becomes challenging to this extent that the usual way we solve problems doesn't work anymore. That's a signal of, I need help. Then where do we go for help, right? There are social workers, there's case managers, there are doctors, people that you can come across to say, hey, we have this problem, we cannot come to a decision, we are facing a challenge. what do we do? Right? And I guess understanding how family works allow us to then appreciate that actually each family solve the issues differently. And I guess that's what, when we talk about family-centric care, family-focused care, looking at things, supporting the family, that is quite critical. But I guess what can help is helping families to recognize, right? How do we sort out problems when we face problems? I think part of education could be bringing the awareness to each one of us, right? How do we operate within the family? Yeah.
Thank you, Ching. I think in the interest of time, we are reaching the end of the segment. But in name of support, I'd just like to go one round and invite all the speakers that in your respective work, what advice or suggestions would you give to our caregivers here and in our virtual domains? What advice or suggestion would you give to them? Maybe we can start with anyone who is ready.
I think after speaking to 700 older people over the course of 6 years, 7 years, they've given me a lot of advice. And I want to share with all of you, like, aging is extremely difficult. And for those of you who are caring for older parents, you are yourself aging too. In fact, caregiving will accelerate your aging process. I'm not here in the business of saying that caregiving is a beautiful thing. It is pretty nice when you have good moments, but it can get pretty ugly and pretty crappy, and we should acknowledge that. So do not feel afraid, do not feel guilty to say that you do not enjoy the process, because AIC says we see you care, right? So they see you. Turn to your friends to affirm and validate you, and if you don't have friends, there are caregiver support groups that will do that for you. Because nobody sees the kind of shit that you go through. People only see you when you're happy, but not when you're sad, when you're alone, when you're isolated, and you're lonely. So reach out. They see you care. So make sure you care to click on the website.
Thank you, Ed.
I think he have kind of shared what I want to say as well. I mean, me, myself, as a caregiver, sometimes the journey can be really tiring. I think if want to summarize, I just want to share that caregiving is not alone. You have find people to help you, like the support groups that you can share experience. There are resources there to help you. So this journey is not alone. That's all I wanted to share again. Yeah.
I don't. I think I don't want to give advice because I think you have more experience and expertise than me in this area. But what I have seen from my own father took care of 2 elderly siblings in the family. And he was away from us for 2 years as a result. He came back after 2 years, and I was a bit younger than my 20s. I was kind of like, I didn't realize the impact of caring for 2 elderly could take a toll on my dad. So after that, he died, actually. So, and that kind of like stayed on and got when I work at the foundation. So I think, so I'm not in a position to give advice. But what I could say is that perhaps I'd like to see more men come forward. Actually, there is a convention that Singapore is signatory. From a policy, right? So I'm coming from policy. I hope the campaign would actually also have some gender lens to it, because we need both more of us, not just women, like the traditional perception that actually men be able to recognize and support him in that process. So I hope we could really also look at it and allow more men to have the platform to be able to express themselves and their stories in the caregiving journey. Yeah. So thank you.
Thank you, Susana. Okay, our last two practitioners, what suggestions or advice would you give to our caregivers here?
I think same as Susana, I think it's very hard for me to give advice because I think at the end of the day, the answer is from within. And I think what we can leave this session today is really appreciate yourself. If I can say, I thank myself for doing what I'm doing. Whatever I'm doing, know that I'm doing good enough job. It's good enough, then it's good enough. It didn't have to be the best, but it is okay and good enough for myself. And that is something I say to myself more often nowadays because it's what I needed to keep myself going. And I hope we do that. Find words that that we give to ourselves, and to take care of ourselves. Thank you.
Okay, so I guess just very quickly, I think what needs to be said has already been said. So, but just to drive this message across is that caregivers, you are really important to everyone. Like what earlier the speaker said, one day we'll also become caregivers. So let's all strive together. Let's try to make a kinder and more inclusive community. And ultimately, let's continue to support this caregiving support ecosystem.
Thank you, Yvonne. With that, can you all join us to give a round of applause to all the panelists here? Thank you very much. Thank you, panelists. Oh, yes, and also another round of applause for all the fantastic caregivers here, please. With that, I pass the time back to MC.
Correct. Thank you, Brendan, and also the panel members. I would like to invite Mr. T.K. Udairam, who's just joined us, President, Home Nursing Foundation, to present tokens of appreciation to the panel participants. Mr. Ram, please. Can I have Miss Carol Yong, please? Thank you. Big round of applause for Carol. Miss Susana. Miss Tan Ching. Miss Yvonne Tay. And of course, Dr. Maulod. I'm sorry, I would need the panel members to come back again for group photo, please. Otherwise, it's not complete. Thank you very much. And also, if I could invite Dr. Tiong up, please. And also Dr. Ng Wai Chong. Thank you very much. While that is happening, I'd like to share with you that we would like to receive feedback from you. A QR code will be screened shortly. Okay, you see that? Please download the QR and we need responses from you, feedback from you, so we know where we can improve for our next event. Thank you very much. Thank you. Thank you, everyone. Mr. Ram? Yes, please. Mr. Ram, thank you.
Thank you. First, let me thank everyone who's come here and taking part in this. I think it's a really important event. We hope to try and make this an annual event where we can keep adding to the repertoire of things that we are able to provide so that people can use it as a resource over the longer term. First, I'm sure you have gained valuable insights on caregiving and the resources available from our speakers. And it's not just, I think, the resources, it's also from sharing from caregivers themselves. We all learn from each other, and that helps to make the journey a little less daunting. The panelists and the speakers are all people who have a lot of experience. They have valuable contributions to healthcare and the caregiving community. And they, I think, provide you with some of the latest caregiving trends and resources and to sharing of personal experiences. They have shed light on the evolving landscape of caregiving. And I'd like to make a special thanks to Dr. Wai Chong and Brandon, our program director, who have conceptualized this conference. I think conference was planned with the aim of gathering agencies, practitioners, caregivers to try and embark on a journey of shared learning and collaboration, because this is going to become a really important thing as we move on in the next few years, because it's the population, it's not just that the population is aging. I'm already in the aged population, but I recognize that as we age, a lot of us are still very healthy. We have people who are much older than us that we have to look after. And that means that we have to look after ourselves to keep ourselves healthy and fit so that we can actually help to look after our parents or our even grandparents. So the conference gives us the opportunity to provide a platform for every year that we take part in this conference. We can provide more insights, more information, and as more services become available through government and through other agencies, we can share some of these. And hopefully our caregiving hub will become something of a resource center for the whole population of Singapore. By bringing together diverse perspectives and expertise, we hope to improve the overall caregiving experience for caregivers themselves and for those who are cared for. I cared for my father many, many years ago, right? And he actually had CA prostate, and he had what we call transient ischemic attacks. So what used to happen, he was actually basically catatonic most of the time. That means he sees you, but he can't talk to you, he can't sing. And I tell this to all the A&E doctors before, that at that time I was living in East, and there was no Changi General Hospital. So every time he had one of those episodes where he will throw up, and then he becomes very alert. And because he threw up, and not sure whether he regurgitated, I will end up having to take him to SGH for them to review and make sure that he's not aspirated. Once in the ambulance on the way, just before we passed the Bedok flyover into ECP, he asked me why. And you know, that time the nurses were the ones who were ambulance officers. So the nurse looked at me, I look at him. So I said, what do you mean by why? So he says, why don't you let me go? Right? So then I look at him and I said, I'm going to take you to SGH because you threw up. I'm going to make sure you're okay. Then I'm going to bring you home. When you go, it's between you and him. I have nothing to say about it. I can only make sure that I take care of you as long as you are around. So I think that there is one part of the caregiving where we want to do everything we can for the family member, but the other part is also from the family, the person who's being cared for as well. How do we make sure we address some of their concerns? We are not going to hasten their departure, but we still have to address it. And for me, my simplest answer was, it's beyond my control. It's between you and him up there. So I left it to him to do that. So the next time he had that episode again, he didn't ask me that question again. But he was alert. The thing was that every time he had one of those episodes, he was very alert. So it became this thing that at that time I could talk to him. I could ask him, you are this, that, the other, in the ambulance on the way. But most of the time he was like, okay, just take me home after this. Fine, right? A few years later, I think he was with me for 3 years, and after that he passed on. But it gave me the experience of dealing with it, and that was something that I find needs to be translated to all our care providers, because when I was at CGH, the A&E doctors sometimes had a hard time trying to deal with the family members who would come to the A&E and say, you must do everything for my father, or do everything for my mother, and they were already not there. So what do you do? So it's something that, for me, I had experience so I can talk to them. I said, so what do you want me to do? What is it that you expect from us? Right? So we can have that conversation. But for some of the younger staff, that's a bit difficult. So we need to be able to converse with them and explain some of this to them as well. It was a difficult time when I was doing that, and I still remember Mr. Zin, who was a nursing officer from Tan Tock Seng Hospital, who was volunteer with HNF. I've come around circle. And he was the one who used to come to my house to help to change the catheter, make sure everything is okay. And after a while, I learned from him how to do the catheter myself, because my dad would pull it out in the middle of the night. Right? And at night, the only people who are looking after him is myself and my mom. The helpers, I tell them go to sleep, because the whole day they're working, and at night they sleep. So at night, when something happens, my mom will call me. So I had an intercom placed between my room and hers, so she just pressed and called me, right? So but you sort of work around some of these. You try to work around and try to figure out how you want to handle this. And my reason for saying about the workers is also that some of us have helpers at home. We also need to take care of the helpers and make sure they have their rest as well. Because at the end of the day, for them to stay with us, they must feel that we take care of them as well. So we want them to help us, but we should also make sure that we take care of them. So whether it's the helper is somebody who is hired by us, or somebody who's the other family member who's coming to help us, we need to make sure we take care. So these are the type of things I learned. So I had first-hand experience. So when I came back to HNF, now as president, my thing with them was that you need to have this really built into the system. And it's something that we are trying to expand. I hope HNF can become even bigger, doing things differently. It's not just Home Nursing Foundation looking at wounds and trying to take care of people at home, but trying to also do, now we're looking at end-of-life care. We also need to start thinking about some of these type of things. How do we help? How do we build that knowledge pool so that and how do we make sure that the people who need it can access that information? Electronics is one way, but I think for us, we need to think of different ways as well. How do we spread it out into the community? How do we find people who need help, identify them, and bring them in to then help them, to give them that skills or give them the knowledge? I learned how to do catheterization from Zin. Are we going to teach other people? I think we can. A lot of the people at home can do. It's no point trying to call it on a Saturday night or a Sunday asking for somebody to come down and put a catheter in. What happens is end up going to A&E. You spend 3-4 hours at the A&E, put in the catheter, come back. It's a lot of time and a lot of stress. Better if they can do it themselves. So even the RAS tube is a little bit more dangerous, but can we teach? And I think we can. A lot of the people who are going to be caring for other people are very senior, and they will be able to do it. So we need to come up with programs that will help them to get these skills. I think we should. So I would like to encourage all caregivers present not to hesitate to seek help. Don't wait and say, I cannot, I don't want to disturb my relative, I don't want to disturb the nurse, I don't want to disturb the HNF, whatever. It doesn't help you if you need help and you don't seek help. So we should make it available, we should make it something that's accessible, and we should make it something that people say, okay, my first port of call when I have a problem, I will call HNF, or I will call this resource, I will go online to see this, or there is this brochure that can get the community that we place there that allows them to pick it up and say, okay, I've got a hotline that I can call, for example. And maybe we should think about a hotline that will give them access to call. So it's all this network of caregivers that we put together, network of specialists we put together that will help us to build this. So I hope that we can continue to build on it and we can get more and more assistance from our partners. In the case of our panelists, Ms. Chang and Doreen, their experience illustrate the power of community support. But community support comes at a price. And it means that we have to build that platform on which they can provide that service. And how do we achieve that? So we need to find those. So Mr. Chang, who cares for his wife with mild dementia, Mr. Chang, I think, has gone back, found respite and support by attending HNF's active aging center with his wife. Today he's paid forward by sharing his caregiving experience. He shared his experiences with us. On the other hand, Doreen was dedicated caregiver for late mother who required palliative care during the challenging period. Doreen received both caregiving support and advice from our advanced practice nurse, Priscilla. And I would like that at the end of the day, Doreen continues to support somebody else who would need that support. That's something that we can put together, this type of resource, not necessarily to do it, but to be able to listening ear, to be able to advise, okay, this is our resources you can use, right? So the personal all our personal journeys are testament to the importance of community support. I think that the community by and large is ready and willing to provide guidance, provide assistance. And I think today the Ministry of Health is coming up to say that we are prepared to put in more funds to support some of these. The problem, I think, today is not funds. The problem is getting the people, getting them trained, and making them available to the community. So I hope that within every HDB estate, we can build up a small core of people who will be available. Like today, SCDF has this system where they call, if you have somebody with a heart attack, they can call. There are people who are trained to use the automated defibrillators. There are doctors who are volunteered, there are nurses who are volunteered. Can we also build up one of these types of services? So we have people who are available to answer. Not necessarily that they will go and do, but they know who to contact to get that service or support done. If they can help, that's fantastic. But if they can't, they have the information and the knowledge who to contact. That, I think, HNF can do as well. Sorry, I'm putting more work for HNF while I'm here. So I believe the insights you gained today during the session will pave a way for hopefully a brighter future for caregivers and for care recipients, better quality of the care and better quality of the life that they have. I look forward to hopefully positive changes. No, I will rephrase that. I look forward to positive changes. Not, I don't want to say that hope, no hope. It is, let's get it done, right? And let's our caregiving community continue to flourish and expand. Hopefully we don't need it because people are cared for so well that they don't have so many years of bad quality life. Their quality of life will be good until maybe the last short period, but even then there will be a need. So let us work together on a regular basis, come back together to share experiences, share knowledge, and maybe to expand the range of knowledge and the range of services that we can provide to our community. So I thank you all for taking time and for listening to me as well. Because I can go on and on. I have this saying, I always say, if you give an Indian a microphone, you better watch out, because we don't give up the microphone so easily. So thank you very much for being here. Thank you for all the participation.
Thank you, Mr. Ram. Quite apt. I've been holding on to this mic the whole day. So, ladies and gentlemen, speakers and participants, thank you for your time to join us at our HNF Caregiving Conference today. We have come to the end of the conference. We wish you a wonderful evening ahead, and we hope to see you soon. Thank you very much, everyone. Thank you. And for those who have not done their feedback yet, the QR code is flashed again. Please, we would like to hear from you. We want to hear from you so we know where we have fallen short and we can improve ourselves. Thank you very much. Yes, also, before you go, another announcement on the flowers. If you want to give a contribution, please collect the flowers from the recept table outside and just drop it in the exhibition booth. The flowers are just there. The staff of HNF are there to help you. Please, every dollar, every $10, every $20 will go a long, long way. Thank you very much.
Yeah.
you.